Hello, good morning, everyone. I hope that you can hear us fine. So I think we can make a start for the today session. Yesterday, for the one that were able to join us, we had a very interesting overview of the current initiative and also the opportunities and challenges from all the stakeholders. But with today's session, we want to really go in a bit more detail and have a deep dive on concrete application of new digital technologies in key regulatory areas. We are going to see the application on antimicrobials, on environmental risk assessment, pharmacovigilance, and real-world data in supporting efficacy and effectiveness evaluation. So the morning is going to be very dynamic and we will welcome the attendees to raise their hands to participate and contribute to the discussion. Before starting and giving the floor to the moderator, I would also like to remind you some housekeeping rules for a smooth running of the events. So all the presentation that you will see today will be made available on EMA website in due course. Also, this event is being recorded, and by participating, you agree with that. If you don't, unfortunately, I need to ask to leave the WebEx connection, and you might follow via the broadcast. The recording is also going to be made available on EMA YouTube channel. If you can't hear us fine, please disconnect and reconnect. We are also aware that there was a bit of a hiccup with the registration ID of the events, and then a registration ID has been sent to all of you via email. If you disconnect, please use the registration ID that was provided to you earlier this morning. Also, as mentioned, all the attendees are muted, and if you want to have the floor, please raise your hands. You want also to use the chat to provide all the panelists with the question that you want to raise. But also, as I said, we really welcome your intervention and verbal elaboration of your intervention. What else I need to say? I think in the interest of time, the moderators will need to select a bit the question that we will receive. In case we don't address the question today, we will follow up following the meeting in the future. And with this one, I really hope you will have a very enjoyable discussion, and I pass the floor to the first moderator of the session, to Zoltan Kuntsagi. He's a scientist specialist in the antimicrobial resistance team at the agency. Zoltan, please, the floor is yours.
Thank you very much, Ilaria. Good morning, everyone. As we all know, antimicrobial resistance is a top global public health concern, and combating antimicrobial resistance, particularly resistance to antibiotics, is a high priority in the European Union. The European Medicines Agency plays a vital role in the global response to the threat of antimicrobial resistance by supporting the development of new medicines and treatment approaches, promoting responsible use of existing antibiotics. And the third thing I would like to definitely underline today is collecting antimicrobial consumption data to guide policy and research. Because the main drivers of antimicrobial resistance is the misuse and overuse of antimicrobials, both in humans and in animals. That's why I'm really happy that I can introduce the first presentation today by Dr. Dewulf, who will talk about the big data concept in antimicrobial usage. Professor Jeroen Dewulf finished in 2002 his PhD on the epidemiology and control of classical swine fever. He's the head of veterinary epidemiology unit and is supervising over 10 PhD students. He is author, co-author of over 300 publications in the field of veterinary epidemiology. He is the principal author of the annual Belgian report on antimicrobial consumption in animals, and also the chair of the JPI AMR network on quantification of antimicrobial consumption in animals at herd level. So I'm happy to give you the floor, Dr. Dewulf, and your presentation's title is Big Data in Antimicrobial Usage and Biosecurity Data Collection in Animal Production, Current State and Future Opportunities. Thank you very much. The floor is yours.
Thank you very much for this very kind introduction, and thank you for this invitation for having me on this interesting conference. So it's my honor to give you an introduction and talk about big data and antimicrobial use, and we also included some issues on biosecurity in there because there is a link. I'll come to that later. And it's going to be about current state of what is available, and also about some opportunities for the future. So I don't know, can I move my presentation forward, or you have to do that?
We can navigate from our side. We were not informed that you.
Okay, so please, yeah. So I'll mention next slide. So let's dive in it immediately. And Zoltan indicated already in his introduction that indeed there is a lot of data on antimicrobial consumption in animals available, and European Medicines Agency plays a pivotal role in that, and collecting all this data from all the EU member states and also other countries that are allied with it. And it's also already a long tradition of collecting this data that are then annually presented in an SFAC report. And I think many of you will probably know this SFAC report, maybe even look out to this SFAC report every year again to see what's in there, what comes out. And more recently, there is also this SFAC database that if you haven't seen it, it's really something to go and look into, because it's a very nice tool where you can navigate and you can create your own graphs and your own outcomes, specifically in the topics you are interested. So it clearly illustrates that there is a lot of data, and that this data is also made available and made accessible to many people to go and look at it and to make use of this data. So I think this is already a first very interesting example. Next slide, please, where you see that the data is readily available, and then we get this type of graphs where you see different countries in Europe with the usage in milligrams per PCU. So it's a milligram per a certain unit of a biomass, or it's an approximation of the biomass number of animals in a country, and the different and you also see the evolution over time. And when preparing this presentation, I had made actually another slide showing the same data, and if you go to the next slide, you see the other one, and I think it's interesting to see, because I knew beforehand that I would get some feedback on this slide, because it's politically not correct, and it's my advantage of being in academia that I can be a little bit outside of these political discussions. But it brings a very important point with regard to data to me. If we collect data, we also, and we use this data, these data have a lot of limitations, but they also have a lot of value. And we have a lot of data here. And in the previous slide, if we can go back to the previous slide, it's exactly the same data here, but it's presented in a way that's a bit less provocative. It's more like, okay, countries are ordered in an alphabetical ranking, and then but anyway, if you look at this data, at least if I do, I'm counting. I'm still looking at who's there in the high rankings, who's there in the low rankings, and try to understand why that is. So data collection is one thing, data analysis is another thing, data visualization is a third thing, and it's equally as important, because with the visualization of your data, you can bring important messages, you can bring strong messages, you can at the same time also even make people upset about the message you bring, or you can create a lot of discussion with regard to, if we go back to the next slide, with regard to is it good to present data in this way? And I'm fully aware of all the limitations, the the distribution of the populations in the different countries is different. Some countries have more ruminants, other countries have more monogastric animals. So there's a lot of reasons why countries differ. But nonetheless, this data is immensely powerful. If you want to change something in a country, and if you are up there to the left, this data really helps you to benchmark your country with regard to others. And you can continuously dispute that there's reasons why you are a bit higher than others, but you can't explain why you are 3, 4, 5 times higher than others. And it's not only because of the demography of your animal population. There is another reason as well. And I've noticed in my own country, Belgium, which is still a little bit too much to the left on this graph here, and that's also why I dare to present it, because we're not the best student in Europe within my own country. But showing this data to the stakeholders in my own country has worked. It really has helped us to motivate everybody to deal with this topic, to work on it. And if we go to the next slide, you can see that we really got some results already. In 2012, we started with many actions to reduce antimicrobial usage in animals. We start to do a lot of different things. I'll mention a few later on. But the main message here is that in the meantime, we have reduced our usage with over 40%. And that is, and I'm really convinced about that, that is strongly driven by the fact that data are made available, data are made public, and we can show to our stakeholders, being farmers, being veterinarians, being the government, that our country was really among the countries in Europe where there was a lot of use of antimicrobials, and showing that it really initiated the motivation, or it sparked the motivation for everybody to work on it and to deal with it. So my message from this is that data are really powerful. We have a lot of data, and if you make use of them in a good way, then they can be very helpful. Next slide, please. Yeah, okay. All of this were data on usage at the national level, all animals together. For those of you that are familiar with this type of data, as I mentioned before, there is a lot of limitations. We have the usage in pigs and poultry and cattle, but also companion animals and horses is all together piled up on one big pile, and that makes it difficult to interpret this data, makes it difficult to really pinpoint those animal species where there is maybe more, there's more an issue. And that's why also many countries throughout Europe have initiated actually additional data collection systems, which are collection systems where we monitor usage at the farm level. And if I would ask you in the audience, can you give me some examples of countries that are doing this? I'm pretty sure that some of you will be able to do so. And I can predict which countries will come up. You will think about Denmark, you probably think about the Netherlands, and you might think about 1 or 2 other countries that maybe your own country where you know about some initiatives. But you might be surprised about how many initiatives are already available. And within this acting network, we've made an overview. And in the next slide, you can see this is our acting website. It's available to everybody. You can go and look at there. And if you can see here an overview of all the different systems that are available for monitoring of antimicrobial usage at farm level. And next, please. And there are already systems available in 16 countries, probably many more than what you could have imagined just thinking about where it's already installed. And you see them up there, all the different countries. And next, please. And it's also, currently we have 37 herd level data collection systems that are available. At least those are the ones we've identified. It could be that in the meantime, others have been developed and are not yet on our list. If that is the case, feel free to contact me, or feel free to go to the website, and there is a a contact file there where you can initiate it, because our goal is really to make this overview as complete as possible, because it's really interesting to see that huge amounts of data are collected here. And this is type of data that is much more detailed. Here you really have data at the farm level, and you know which type of species gets which type of antibiotics. So there is a lot of data out there. Next, please. One of the limitations when we look at all this data is that it's collected in different ways. And it's collected in different ways, that's one thing, but analyzed also in different ways. And here I give you a graph of a figure of a review paper that we've published a couple of years ago, describing all the different methodologies that are available to quantify antimicrobial usage. And for those of you that are not in the business, I would say, about quantifying antimicrobial usage, it sounds an easy job. It sounds as you just have to count. Just count how much antibiotics are used. But once you start counting, you very, very rapidly realize that it's not such an easy job. It's really quite complicated. It's complicated at the level of your nominator, how much antimicrobials are used, but maybe that's still okay. But it becomes much more complicated at the level of your denominator. What is your population at risk? And how do you quantify your population at risk? Do we quantify that in kilograms of biomass? That's what is in this overview on the left side. Or do we quantify the number of animals that are potentially at risk of being treated? But also there, these animals vary from broilers that have a weight of 2 kilograms up to cattle that have a weight of 500 kilograms or even more. And so we have a huge variability, where we have also animals that are growing enormously faster. Our piglets are born at around 1 kilogram, and they are slaughtered at 115 kilogram. And so it's totally different than what we have of methodologies in human medicine, where for the ease of the calculation, they assume that every human being has a weight of 70 kilogram. Which in veterinary medicine we can absolutely not do, because our variation is much bigger. So you can see, and I'm not going to go in detail. If you have questions about that, I'm happy to answer that. But you can see here that there's really many different methodologies available to quantify usage. And in the previous slide where I showed you all the different systems, unfortunately, I would say these different methodologies are used. So that's why the outcomes of these different systems are not necessarily always comparable. They do not match. You cannot easily compare the results. And that's, of course, a big advantage of the SVAC system, where at least the methodology is standardized. So that's a step forward. Next, please. But also here at the level of so the advantage, and maybe first step, the advantage of having these farm level data collection systems is that you can make this type of graphs. And this is again from my own country, from Belgium, where we can, for all the different animal species or groups of animals, it's even more detailed than a species, because we have different age categories in the species. We can, in these different groups, we can identify the average use. And this is here it's given in the treatment incidence. It's the number of treatment days out of 100 days. So it's easily also can easily also be translated into the percentage of the lifetime an animal is treated with antibiotics. So it's a quite detailed quantification system, which is more and more used by different countries, different data collection systems. But this type of outcomes really shows you where the working points are. If you look here at the Belgium data, we see that the wiener pigs, that's where there's still a lot of use. And also in the veal calves, there's still a lot of use. That's where we need to try to reduce the usage. In the breeder pigs, we won't gain as much anymore. We're already very low. So this type of data is quite informative. Next, please. So once we have this data, we can go further. We can go into this benchmarking systems and also steward methodologies. So here we have here the usage, where we in our own country, in Belgium again, where we then translate the data collection at farm level into information that is feedback to the farmers. They get every 6 months, they get a report, and it's indicated where they are in this distribution, if they are among the low users, the medium users, the high users, and if they're among the high users, of course, they have to take actions, they have to reduce. So again, an illustration of how data that is collected, that is analyzed, analyze 2 steps. The third step, and equally as important as I mentioned before, is the data illustration, is translating the data into something that you can use with, that you can work with, and in this case, you can use it for stewardship. Next, please. And to try to, in this publication here, we have reviewed actually all those different systems that I've shown you before. We have a very recent, it's only published this year, a very recent publication where we made an overview of all these existing systems, and we have described and analyzed the key components and processes. So if anybody among you is interested in setting up your own system, of in trying to understand the systems available in different countries, this is really a guidance that can help you. Next, please. And we have also made some guidelines, and this is already a little bit going into the future. That is, if we want to standardize, as I mentioned before, the SFAT data has big advantage of being standardized. They have the disadvantage of being very crude, I would say. There's not very much in detail, but well standardized. The acting data here on the other side, it's quite detailed, but it's not at all standardized. So the step we have to take here, or the work we have to do here, is to try to make the methodology more standardized, so that we use the same methodologies in the different countries and the different systems to make, again, the data more comparable. Next, please. So we have also, besides these data systems, we also have research systems or research studies, and one big study that we have done where we were involved is the EFFORT project, and in the EFFORT project we've collected data in different countries. So next, please. So this is a map of Europe, as you can obviously see, and every flag is a country, is a farm in Europe that was sampled, and it's a border farm. In this case, we've done the same exercise in pigs. We've sampled all these farms, and we quantified the usage of antimicrobials in the farm. Besides that, we also looked into the resistance data here, but at this stage, I'm focusing a little bit on the usage data. Next, please. And out of this, we could get an idea of the median use of antimicrobials in borders. And it's again quantified in the treatment incidence. It's the number of treatment days out of 100 days. And we could conclude here that our mean broiler is treated 9 days out of 100 days. Of course, they do not live 100 days. They typically live 40 days, between 35 and 40 days. So it means that a typical broiler in Europe is treated 3.5 days in an average production round. So that's more or less what we found. Next, please. So you could say that, okay, looks quite okay. It's not too bad. It's maybe better than what you had anticipated. But if you would translate that to human beings, next, please, it would mean that for us, it would mean that every human being, all of us attending this conference here, we would take antimicrobials every year for at least 1 month. And that would also be 9% of our lifetime. And then you probably would agree with me that that's maybe not the best idea. That's maybe a bit too much. So again, this translation of data on usage data in treatment incidences and number of treatment days is helpful to put things into perspective and to understand better what this usage means. Next, please. But another and even more important conclusion is that the average broiler in Europe does not exist, because that average one, this 9, comes out of this distribution. And every color here is a different European country. And you immediately see that there is a huge variation between the farms. And also between the countries. So there is a huge variation between the different colors. Some countries have way higher levels of usage, other countries have lower levels. That's not surprising, because that's also what we learn from the ESVAG data. But what is also interesting to see is that within each country, within each color here in this graph, there is a lot of variation as well. There is farms that do with very little, even zero use of antimicrobials, and others that use enormous amounts of antimicrobials. And I always say, when I look at this data, variation is good. We should bless the fact that we have variation, because it means that there is opportunities for improvement. So this showing the fact that already today a lot of farms are doing with very little amounts of antimicrobials also illustrate that the others can go there. So should be able to go there. Next, please. It also allows us to illustrate when the antimicrobials are used. So typically in the borders, I'm not going to go in detail, but it's typically in the first week, the majority of the use is done. It also illustrates that a lot of use still today is preventive use, although it should not be the case. And very soon, or already now with the new legislation, it's forbidden. But one thing is to forbid it on paper. Next thing is to realize that on the field. So there's still a bit of work to be done there. Next, please. You can also look at the different types of antimicrobials that are used. I'm not going to go in detail, but you see the whole variation. Next, and this is next, please. And this is very interesting, and that's also what we've seen. We've seen it in borders, but we've seen it in pigs as well. These are all treatments that are given for intestinal problems in borders. And what you see, and what we've called a little bit provocative again, the randomness in choice of active substances. This is all to treat the same type of infections in borders in different countries in Europe. And you see a huge amount of variation in types of products that are used. So that is really illustrating that the use is not so much what we would have hoped, that it's really based on pharmacological and microbiological characteristics, and that we veterinarians always use this active substance that is the best working for the specific pathogen. The reality is different. The reality is that they're using a lot of different products, and that the motivations to use them is probably linked to other factors such as marketing, price, availability, a lot of other things that are not so much linked to the biological or the pharmacological argumentations. Next, please. Of course, why is it important to look at antimicrobial usage? That's because we are concerned about antimicrobial resistance, and there is a clear link, and I think that's quite obvious for all of you. But it's good to re-emphasize it. There is truly a link between usage and resistance. I always say the epidemiology of antimicrobial resistance is quite complex, but there's one golden rule that is always true, and that's the rule that says the more you use, the more resistance you'll get. And that's illustrated here in this study, where we again made use of publicly available databases. On the one side, in the x-axis, on the level of antimicrobial usage based on the ESVAG data at that time. On the y-axis, in the level of resistance in different animal species, in E. coli as indicator bacteria, and that was based on national reports on resistance. And every time for all the different molecules, you see the lines going up. The more you use, the more resistance you get. Next, please. It's also shown in this. Next. Yeah, it's also shown in this graph where you see which countries were included, and it has a remarkable fit. Those countries that have a long tradition, and I'm referring to Scandinavian countries in Europe, and that was at that time in 2012, those were the only 7 countries in Europe that had sufficient data available to do this exercise. Today we have much more data, fortunately. But at that time, those countries, Scandinavian countries that have a long tradition in low level of antimicrobial usage, they have low levels of resistance. Those countries, among which my own country unfortunately was present, have been using a lot of antimicrobials in animals. They also had much higher levels of resistance. It's quite straightforward at the meta level. At the meta level, we find this very good associations. If we dig into very precise situations in a specific farm, in a specific animal, sometimes the links, the associations become much more blurry, but at the meta level, you clearly see the effect. Next, please. And this was not, what we've seen is not a one-time shot. It's not a lucky shot or we maybe even twisted our data a little bit to make them fit good. But other studies, and the GIACRA report is really a very interesting one to refer to. Other studies have shown the same, and it's probably too little to read here, but this is about resistance in fluoroquinolone. Where again it shows you that if the more fluoroquinolones are used, and every dot here is a country, and there's already much more dots than in the previous study, but the more you use, the higher your resistance are on average. You see also here these trend lines, all these trend lines moving up. So again, illustrating that if you use more antimicrobials, you get more resistance, and we should not be surprised about that because that's quite logical. Next, please. Okay, to end up, I also want to say a few words about biosecurity, because if you think about antimicrobial usage and we think about antimicrobial resistance, and what I've been doing now, I've been describing problems. The problem of usage, the problem of resistance, but we also have to think about solutions. And solutions are things about how can we avoid this usage? By avoiding the usage, we can diminish the levels of resistance selection. And one of the solutions in there, it's not the only one, I want to say, there's others as well, but one of the solutions is also improving biosecurity. And biosecurity is actually everything we do to try to avoid that animals get infected. So it's actually the same as what in human medicine they would call infection prevention. Everything we do to prevent infections, to avoid the need or to limit the need of antibiotics. Next, please. So this biosecurity is actually it's the fundament of any disease control program. If I always refer to building a house, if you want to build a very nice house, but you do it on a very weak basis, on a very weak fundament, sooner or later your house will collapse. And that's the same with animal production. If you have big farms, which these days we have and increasingly have, the bigger your farms are, the more solid your fundament has to be, your biosecurity should be. Next, please. And within my research group, we did a lot of studies on looking at biosecurity and looking at all those factors that are related with biosecurity. And here again, I'm not going to go into detail in explaining this this graph or this figure, but it's really to show you that a lot of things are really interdependent. By internal and external biosecurity is linked to each other. It's linked to the size of the farm, which is then linked to the number of employees, to the production and so on. There's a lot of things linked, and this is bringing me back to the whole data thing. There is so much data. There is also a huge amount of data on production. Every modern pig farm in Europe has a herd health management program. They have data on their fertility, they have data on mortality, but all this data is very poorly used, very poorly exploited. It remains in the farm or maybe in some database, but it's difficult to get access to. Whereas it would be really very, very worthwhile to make it more open and to get access to this data, to link everything, because that's really a way forward to improve things. Next, please. Because here we've shown in this study, we've shown that, and you see it here at the right, at the external biosecurity, has an influence on the antimicrobial usage. So if you have better biosecurity, you have lower levels of usage, and we've shown it in other studies as well. And so really it can link, it can help you. So from that side is quite important. Next, please. There are some databases on biosecurity. One is the BioCheck database, where which is hosted at my university, Ghent University, where we collect antimicrobial, where we collect data on biosecurity. Next, please. In a lot of farms, and it's used in a lot of countries. We have data of over 16,000 farms now in different countries in the world, and pigs in different animal species. So there is quite some data available. There's more databases elsewhere, but again, we have to make it more exploitable. Next, please. One of the things we do with this data, you get these reports. By the way, this is totally free for use, so everybody can use this system. It's absolutely free. It's on the internet, and it provides you with these scores per farm of your data. But it's also, next, please. It's also helpful in ranking farms. This is what we call our barometer, where we have different levels of biosecurity. You see the different countries here, and some countries have high levels of biosecurity, others have more lower levels. Some score better on external and others better on internal biosecurity. So you can again start to benchmark, compare, and as I illustrated before, that's the start of improving. First showing, measuring, and then improving. Next, please. And what is also nice is that then for each country, you can get more into detail, and you can see again differences between countries. And some countries do very well, others do poorly, and that's also a starting point for your national policy to start to improve, to know where you have to communicate with your farmer community to get them to get things improving. Next, please. We also work with the FAO, for instance, where we are creating. Next, please. Where we are looking at within the BioCheck scoring system, we are looking at different components of the biosecurity that are very strongly linked with the possibility of epidemic diseases starting to spread. We think that's not about antimicrobial usage here, but we think about African swine fever, we think about foot and mouth disease potentially. And so if we know these components and we know how well they are applied in different countries, we can more or less also predict or estimate how easily or how difficultly a pathogen would be able to spread in this country, and where again things have to improve to stop these spreads. Next, please. To finalize, just one more study that we've done. Next, please, where we've looked at the impact of biosecurity on antimicrobial usage again. And this is a study where we motivated farmers to improve their biosecurity on pig farms, 60 pig farms, and we throughout for the period of 1 year, we improved the biosecurity. Next, please, and then what we got in less than 1 year time, we could reduce we could reduce the antimicrobial usage in the piglets with over 45%. Next, in the finishers with almost 82%. And if we put those two together, it's 52% in the from bird to slaughter, and it's around minus 32% in the breeder animals. So you see that by improving biosecurity, by motivating farmers, you really can make a difference. You really can make things change. So again, illustrating that linking all these databases is powerful and is really helpful in achieving our goals. Next, please. And it was also interesting to see that this had no negative effect on the production, so reducing usage and still at the same time also increasing production. That was what we achieved. Next. We also did the financial calculation, the economical evaluation of these exercises, and it turned out, and I'm not going to go in detail, I don't have time here, but it turned out that it was really also economically beneficial for those farms to improve their biosecurity. So from that side, it's not a hamper. Next. So conclusions. Well, I think I've illustrated that there is a huge amount of data on antimicrobial usage. There's also a lot of data on antimicrobial resistance. I have not focused so much on that one but also shown that usage and resistance are linked. There is an increasing amount of data on biosecurity. Next, but the challenges are that there is a lot of standardization that still is needed. Really have to improve that on that side to make data more comparable before we can really start to compare that. There's also an issue about data ownership and availability. Often these databases are really very closely guarded. You cannot easily access them. People or countries or organizations are not willing to share their data, even not after an anonymization step or whatever. So there's a lot of work to be done there. But if people and countries get more the attitude of opening up data, not being afraid about the data, but really showing the data, I'm 100% convinced that is a first step towards improvement. And so using the data is helpful to improving the situation. So I really want to thank you all for your listening. I'm sorry that I went a little bit over time, I think, but I'm open to answer any of your questions. Thank you very much.
Thank you very much, Jeroen, for this excellent presentation. And I would like to remind everyone that these slides will be available, so you can check them later as well. There was a lot of information in the last 20 minutes. Also, I would like to encourage everyone to send some questions in the chat box. And just as a kickoff, a question from my side. With regard to the biosecurity applications, you have mentioned one application, one database, and are there others? And if so, could these be linked somehow? Thank you.
Yeah, it's a good question, and there are others. We're also involved in an EU project now on biosecurity in poultry, where we're trying to make an overview of the databases that are available. And often, like national quality labels for different production sectors, they have questionnaires. But the availability is a problem. Sometimes these are really still paper-based databases, or the data are in a database, but they're not willing to share them. So there are, or there is a language issue. The data are collected in only one language, which is not easily or readily accessible for others. So there's a lot of, again, standardization here that could be implemented. Often this data on biosecurity is organized by national authorities, and one authority has done it in the framework of the threat of avian influenza, others have done it in the framework of the threat of salmonella, and others. So there's a lot of initiative being taken, but they're, again, poorly standardized. And so there's a lot of work of standardization also here to be done. And
Thank you. Thank you very much. There is also another question from Ulrich Gugerle. Sorry for my pronunciation. Jeroen, thanks for a great presentation. Could you give some examples of internal and external biosecurity?
Yes. External biosecurity is everything that has to do with preventing pathogens coming in. And so it's linked to visitors, people coming in. So measures you have to take when people come into farms. It's about changing clothes, changing footwear, washing your hands. It's about trucks coming into farm. It's about animals coming into the farm. So the whole issue with quarantine, with movement restrictions. It's also about things that go out of your farm, manure that goes out of your farm, dead animals that are transported. That's all external biosecurity. Internal biosecurity is about things going from one age group to another. It's about movements within your farm. The working lines you use, the idea of working from the young animals towards the old animals. It's about the cleaning and disinfection of the stables in between production rounds. It's about the stocking density. It's about the way you work with diseased animals, your hospital pen and the way you're using it. So there's a lot of things, and I'm really squeezing it here because we have training workshops for 2 days to talk about this. So there's a lot of things you can say about it, but that's more some examples.
Thank you very much. I also received a question from Ricardo Carapeto. It says, for the data standardization in a researcher's view, would it be better to have raw consumption data rather than standard data? Do you think raw consumption data or rather than standard data?
Well, it's depends a bit what is seen as standard data, how detailed this standard data can also be detailed. But of course, raw data is, as a researcher, you always want to have. But again, in that question, I cannot emphasize enough that consumption data is one thing. It's the nominator, and we very often forget to think about the denominator, and it's even more important when we think about usage data. The nominator, consumption data, okay, can have it, but as long as I don't have a good view of my denominator, the size of my farm, the age of the animals being treated, and so on, I really need to get. So I would stress more on that side and the raw data that I want to have on that side than on the side of the consumption.
Thank you very much for this as well. We only have some minutes left. Let me get another question from Nancy Debreen. Thanks, Jeroen, for the great presentation. Soon, all EU countries will need to collect use data per species. What do you see as the biggest challenge to do so? Thank you.
Well, yeah. Well, there is already a lot of initiative been taken. I've shown you with the overview of the acting. So a lot of countries have initiated this, so it starts to work, and it mainly starts to work in the food-producing animals. So the pigs, poultry, cattle. There we are more advanced, and things getting established. Methodology slowly is I think emerging a little bit towards a comparable methodology. The next challenge will be the more, would say, companion animals, dogs and cats, horses, and so on, and minor species, because there, and typically, for instance, in dogs and cats, we do not have this denominator data. In a farm, we know how many animals are there, the size of the farm, and so much. We have ENR data systems in every country. But for dogs and cats, we often do not even know how many dogs we have in a country. So we can quantify again how much we use. But is that, if you look at trends and we see the usage going up, does it mean that there's more use per dog, or does it mean we have more dogs? And that's still a challenge. Same is true for horses, for instance. So there we need to work more on the methodology to get things working. And then next, I really think it's important that we go for standardization throughout Europe. That would be very nice, and maybe there is a role for EMA also there to guide us in that.
Thank you very much. I need to stop here because soon we will start the next presentation, but I can promise that we will follow up all these questions and we will get back to everyone who sent questions by written procedure. And I think you also showed your contact in the last slide as well. So may I ask if they can also contact you in this case?
Sure.
Yeah, thank you very much. So just for the conclusion of your presentation, I noted that you mentioned that huge amount of data on antimicrobial use and antimicrobial resistance is available and increasing amount of data is available for biosecurity. But there are challenges. For example, a lot of standardization in data collection and analysis is needed. Data ownership and availability needs to be sorted out, and open data should become the standard, as you mentioned. And finally, I'm also grateful that you mentioned a report, a joint interagency report with EMA, ECDC, and EFSA. This is the JIACRA analysis. This JIACRA stands for the Joint Interagency Antimicrobial Consumption and Resistance Analysis. And the reason why I would like to mention, just to advertise it a little bit, because we are almost finished with the third report, and it will be out at the end of this month. So I would like to encourage the participants to have a look at our website in the coming weeks, because you can download the latest analysis as well. With this said, I again would like to thank you very much for this excellent presentation. And this was the first part of section 2, Big Data in the Monitoring of Efficacy and Risk. And now I would like to give the floor to my colleague, Dr. Michael Empl, who will moderate the next section, which is about managing big data for environmental risk assessment of human pharmaceuticals. Thank you very much, Michael. The floor is yours.
Yes, thank you very much, Zoltan, and good morning, everyone, from my side. Yes, as just said, I will moderate the upcoming session on environmental risk assessment and possible application of big data concepts in the assessment. But before getting into more details and into the session per se, I'd like to give you a short outline of the session and the goals we try to achieve with this. So much like antimicrobial resistance, the environmental impact of pharmaceuticals has gained a lot of attention in the last years, also translating into different policies. For example, the European Commission's strategy on pharmaceuticals and the environment. But nonetheless, the application of big data concepts or approaches while being used is not really used on a routine basis and also far from being standardized. So we consider the upcoming session more or less as to be of an exploratory nature, basically, and trying to get stakeholders' feedback and comments on whether actually big data applications can be applied in the environmental risk assessment of veterinary pharmaceuticals. And in that regard, we look to forward to a very fruitful discussion later on after the presentation. And you will also notice that the presentation that will be given by Professor Ragas focuses very much on the environmental risk assessment of human pharmaceuticals. Nonetheless, we believe that a lot of the concepts and the ideas that he's going to present are very much applicable to the veterinary domain as well. And there again, hopefully this will stimulate a lot of discussion and ideas and comments and possibly drive the use of big data concepts in the environmental risk assessment of veterinary pharmaceuticals. So without further ado, I would like to give the floor to Professor Ragas. He's a professor at Radboud University in Nijmegen in the Netherlands, and specializes in the modeling of the environmental risk of chemicals, and he is actively participating in various high-profile international research projects, and he chairs the Dutch Scientific Advisory Committee on Quality Standards for Air and Water and the Dutch Inter-University Committee on Environmental Sciences. Ad, the floor is yours. Thank you.
Yes, thank you, Michael, for this kind introduction, and thanks also for the invitation on this to participate in this exciting conference. So I would like to share some experience with you from the IMI research project called Premier. It's a project that aims to develop a database and a digital assessment system to support the environmental risk assessment of human pharmaceuticals. And although it focuses on human pharmaceuticals, I hope that this may be a kind of a source of inspiration also for the veterinary sector. I would like to start my presentation by giving you some background information on the project. So it started last year, September, and it runs for approximately 6 years. There are 25 partners involved in the project, of which approximately 10 are pharmaceutical companies. We have a budget of 9 million euros, and half of that comes from the European Commission through IMI, and the other half comes from FPA partners, so pharmaceutical industry, and that's an in-kind contribution. The project is led by myself. I'm from Radboud University in the Netherlands, and by Jason Snape from AstraZeneca in Sweden and the UK. A little bit about the background of the project. What is our aim? As you probably know, since 2006, it's obligatory in the European Union to perform an environmental risk assessment of pharmaceuticals if you want to put a new pharmaceutical on the market. However, all pharmaceuticals on the market before 2006 have never been systematically assessed for their environmental risk. And these are probably somewhere between 1,000 and 2,000 active ingredients that never have been systematically assessed. And if you would have to assess them all one by one, that would take an enormous amount of time and also an enormous amount of money. Some estimates are saying it could cost up to 500,000 euro per substance. So what we are actually doing within the Premier project is trying to gather a lot of data on all these legacy pharmaceuticals, as we call them, in order to prioritize them and to pick out those that probably cause the highest risk and do a full risk assessment for those, but not for all 1,000 to 1,500 or 1,000 to 2,000 pharmaceuticals. And we do this with the following steps. First of all, we try to create a public database on all active ingredients in human pharmaceuticals, and that database should contain all data that are relevant for an environmental risk assessment. Then we try to develop predictive tools, let's say computer models, for assessing the exposure and effects of active pharmaceutical ingredients, and as well as explore the feasibility of green design, so of using these tools to develop more environmental friendly pharmaceuticals, you could say. Third, we like to develop decision trees and guidance for how to use the data and the models to take regulatory decisions and to take management decisions. So that's more in the regulatory domain. And finally, we want to integrate the data, the predictive tool, but also the decision tree and the guidance into what we call a digital assessment system. So in my presentation, I will focus mainly on our database and the digital assessment system that we're trying to develop. Just to illustrate how the project is organized, we have 5 work packages. One focuses on prioritization and environmental assessment of APIs, one on exposure effects tools. Then we have a 4th work package on application and guidance, and one on management. But in the center is the one that aims to develop this API information and assessment system. So that's really very crucial to our work in this project. To give you a bit of idea of the partners involved in this project, as said, we have approximately 25 partners, and I want to highlight 3 groups. The first one is, of course, the pharmaceutical industry. We got 10 industries involved in the project, and that's important because, of course, they are tasked with the environmental risk assessment, and they often also own the data. Then I'm happy to say that the European Medicines Agency is involved in the project. First of all, it's of course a regulator, so they also clearly have an interest in the environmental risk assessment. But in due time, we hope that EMA will also be involved after the lifetime of the project in the maintenance of the database. A third partner I would like to use is Momex. So that's a small medium enterprise, and they're actually doing the IT work. So they're developing the infrastructure of the database and the digital assessment system. So the digital assessment system is more than just a database. It contains, of course, the substance properties of APIs relevant for environmental assessment, but it also will contain tools to predict substance properties in case we don't have empirical data. So we call them QSAR or QSPR tools. Then it will contain the models that we use to predict actual exposure in the field and effects as well as risks. And it will contain decision trees. So one of the ideas we have, for example, is to automatize, I would say, the procedure that has been laid down in the EMA guideline, for example, that with one push on a button, when the data is in a database, it can automatically, the system can generate an answer and a risk assessment according to the EMA guideline. What I will show in the remainder of this presentation is I'll go into a little bit of more detail into the detail of in the background of our database, and I'll show some examples of the models we are developing and want to implement in the digital assessment system. Before I go into detail about the database, I maybe should tell you that Premier is not the first project that focuses on the environmental risks of pharmaceuticals, of human pharmaceuticals. We have had several predecessors, like the ERAPharm project, the Pharmas project, but the most important one is IPI, which was also an IMI project and ran from 2015 and 2019. It had more or less the same aims as Premier has. It also started building a database, but then we gained a lot of experience and decided to do it a bit better in Premier, but we're really building on the experiences from IPI. So in IPI, we developed a system called IPI-SIS, and there's also a publicly accessible database from that that's called IPI-SUM, and we're actually using the data from IPI-SIS to develop our new database and digital assessment system. To give you a little bit of idea of the type of data that we will store in our database. So we have these 4 type of data that were also stored in the database from IPI. The fields are identity and structure data. So you can think of data on, for example, CAS numbers, SMILES codes, INCI codes, molecular weight, molecular structure, etc. Then we have data to assess exposure and fate. So you can think about partition coefficients for different media and degradation rates in different media. Bioaccumulation rates like bioconcentration factor, bioaccumulation factors, and finally, and probably most importantly, there will be a lot of acute and chronic ecotoxicity data in the system. So this type of data were also stored in the IPI database, but in Premier we will extend it a bit further. We will also try to capture measured environmental concentrations of pharmaceuticals, for example, based on a database developed by UBA and by the EMPO database from the Norman network. We try to capture data on consumption of human pharmaceuticals, probably from ECVIA, although that is not still decided. Data on daily defined doses, data on different medicinal products that the active ingredients are used in. And data like other data like excretion rates that we need to, for example, predict the human exposure, data on mode of action and ATC codes. Where do our data come from is, of course, an important question. So first of all, we're trying to map the universe of APIs used within the European Union. And their important data sources are the Article 57 database of EMA, but we also look at other databases like Drug Bank. We use a lot of data from industry. Already in the IPI project, we started extracting data from industry databases. So these are proprietary data from industry on about 200 to 500 active ingredients. And within the Premier data, we are scheduling a new extraction for new active ingredients. So probably somewhere between 300 and 400 active ingredients, the data will come from industry. Within the project, we will also do some testing, and we will focus that on 25 case study APIs for which we think it's important to gather data on. And these data, these tests that will be performed with these case study compounds will be performed by industry partly, I think largely even, and some tests will also be performed by public partners. Of course, we all also be using existing data from existing databases like Drug Bank, PubChem, US EPA's Ecotox database. We'll, especially for the 25 case study compounds, we also do a systematic literature review and extract data from the public literature using databases like Web of Science, Scholar, and Google. We'll look at data used in regulatory assessments already. So we are currently extracting data from the European Public Assessment Reports, also look into national assessment reports, and we might also look into reports from the FDA. And finally, we as said, we might try to get some proprietary data from IQVIA and store that in the database. It's important to realize that when you set up such a system, a database and digital assessment system, that different groups will have different uses in mind, and I listed some of these uses in this table. So, for example, there are a lot of scientists involved in the Premier project, but also outside of Premier, and they're looking at the database as a treasure of data that they can use to develop new predictive tools. For example, if you have a lot of degradation data for pharmaceuticals in there, you can try to develop a QSAR that links molecular structure with a prediction of degradation, for example, in sludge or in water. And that's an important potential application of our database, I think. But there's also a lot of stakeholders like industry and regulatory agency and water boards that say, oh, we are mainly interested in risk assessment, and we want to either assess the risk or prioritize the pharmaceuticals for management purposes at various levels of details. So that's more an application-oriented purpose, I would say. Of course, there's the formal support for regulatory decisions, like decisions for the EMA guidelines. That's mainly EMA and other national and regional agencies that are interested then. And a final purpose I would like to mention is now mentioned by the industry. They're saying we can also make data available, at least give other companies access to our data through this system using a letter of access system. And that might even be a way to fund the database in the long time by saying, okay, generic companies can get access to the tests performed by innovative companies through a letter of access that is given through the system. And of course, that would involve some payment. There are, of course, a lot of database issues when you try to set up such a database, and I'm not claiming we have all solved them yet, but I just want to give you an impression of what kind of issues we run into when we try to set up such a database. One important issue is the issue of having an unique identifier for each active pharmaceutical ingredient as it is present in the environment. And we are currently discussing what is best to use as a unique identifier. CAS number is one suggestion, although there are often different types of CAS numbers for different variants of the same substance, so this can still be quite complicated. For example, if you have salts as medicines, you may have potassium or other types of salts that all have their own CAS number, and you have to deal with this issue. Another issue we are dealing with is how to deal with confidentiality of proprietary data. Especially within the previous project, we had a lot of companies that wanted to keep part of the data confidential. I see now a movement in our new project that more and more industry companies are getting convinced that it is also good to share data, and they really are convinced that transparency is important. So we are more and more moving towards a fully public database with a very small amount of confidentiality in there. Of course, there's also the big issue of data quality, and we're trying to address that, I would say, in a two-step procedure. When we enter new data into the database from the project, of course, we cannot assess the quality of all the data going into the database, but we will put flags on the data, like whether they have been assessed for quality or not. For all the case study compounds that we select in our project, we will try to assess them, and that will, as said, be a two-step procedure. First, the company that performed the test will fill in a quality assessment form, and that will be checked by an independent agency like RIVM or ITM Fraunhofer Institute. So essentially, our database will contain a flag whether it has been the quality of the data has been assessed by the agency performing the test, or whether an independent check has been done on that, or whether it has not been assessed at all. The last issue, data issue I want to mention is data provenance. Since we are collecting data from a large variety of different sources, some of these sources may, of course, have are themselves databases, and that introduces the risk of having duplicates, data that you extract from literature, for example, that are also already present in another database. Therefore, it's very important to track the provenance of the data to avoid duplication of data in your database, and that's something we are very keen on doing. That much about the database. The next thing I would like to show you is two examples of models that we try to incorporate in our data digital assessment system. The first one is on assessing exposure. So we developed a model called EPI, which stands for exposure to pharmaceuticals in the environment. And what the model basically does, it tries to estimate the concentration in surface water of pharmaceuticals based on consumption data of the pharmaceuticals in different European member states. So the model simulates the whole process of consumption and excretion through feces and urine in the sewer system, and then the treatment in sewage treatment plants, and then the ultimate discharge into surface waters. It's a basin-oriented model, spatially explicit. So we have mapped all the river basins in Europe, And if we know the consumption, amount of consumption in all member states that are in a basin, we can predict the concentration everywhere in the river system. This is just an example from the Ouse Basin in the United Kingdom. And the right triangles are all the sewage, the wastewater treatment plants, and where discharge is taking place based on the number of people connected to a wastewater treatment plant. And we ultimately predict the concentration all along the river. Just as an example, we applied this EPI model in the Ouse Basin, but also in the Rhine Basin in Central Europe. The dots in these plots here, the yellow dots, the red dots, and the green dots are actual measurement locations. And we compared these measurements with the predictions of our model, and that results in such a kind of plot where on the horizontal axis you see the predicted concentration in the river water, and on the vertical axis you see the measured concentration. And of course, it's not an exact one-to-one line, but in general, we're able to predict the concentration in surface water with a deviation of a factor of 2 to 3, and in some bad cases a factor of 10, but on average is quite well predicted. Then we have another model. This is more on the effect side. It's called EcoDrug. And this is basically, it's not a mathematical model, but it's more like a comparative tool. And it's based on the assumption that a pharmaceutical would be more toxic to those species in which the human drug target will be conserved. So, for example, if you would have an algae, a fish and a Daphnia, and only the fish would have the human drug target conserved in its DNA, this fish is probably more likely to be sensitive actually to this human drug when it comes into the environment. And what you see here is a system where you can look where you can enter a drug target or a medicine and look to the level of conservation in different species. These are the rows in this table that you see. The red means no conservation, and the green means that it is conserved. And we try to use this system in the selection of species that are to be tested, but also in our prioritization procedure for selecting pharmaceuticals that might be a high risk in the environment. This is EcoDrug. The website link is shown below, and it's publicly available. Finally, and this is my final slide, of course, when you develop such a database and digital assessment system, you don't only do that for the project. So we hope that after the project, our database and digital assessment system will still be used by many future users. And we're currently already during the project really thinking about, okay, how to maintain this system and database after the lifetime of the project. And we are discussing issues like, okay, how to deal with confidential data, how to deal with infrastructure, with ownership, because there are ownership of data, but there's also ownership of IT infrastructure and ownership of models. So you all have to make agreements about this. Who will host the ultimate system? So now currently it's hosted by Semomics, a small SME, but you could think about that it moves ultimately to EMA, that EMA will host the system ultimately, or another third party. Of course, the question is also who will update the system and who will pay for that. And of course, another question is how to guarantee long-term access. And I think this was my last question. I would like to thank, of course, all the Premier partners for contributing to this project. And with that, I would give the floor back to you, Michael.
Yes, thank you very much, Art, for this very interesting presentation on this very ambitious project. And we've received a few questions, but before I'll go into these, maybe let me ask an open question to you, maybe, and also the panelists, and feel free to comment in the course of this discussion. And my question would be, would the establishment of a similar project as the one that was just described by Ad be something that would be of benefit to the veterinary domain? So would it benefit the development of VMPs and reduce the burden, for example, for the registration of veterinary medicinal products, but also protect the environment more if such a project would be developed considering veterinary medicinal products? That would be the first question. And again, to all participants, please feel free to comment on that. But Ad, I'd like to hear your opinion on that. Thank you.
My simple answer would be yes. I really do think it would be beneficial because I think although the situation in the veterinary sector is in some ways quite different, I think, although I'm not an expert in this area, but there are also a lot of similarities. So one, for one, I think there are also a lot of parties involved in the environmental risk assessment in the veterinary sector. So that's quite comparable. You have the industry, you have EMA, so I think that part is quite comparable. And let's not forget that in the environment, it doesn't really matter whether a medicine comes from veterinary use or human use, and that's where the ultimate risk is. So especially from an environmental perspective, I would be very much in favor of a similar system, or maybe even extending the current system that we are developing with the veterinary part for in the model. And of course, it's not only the data, but also the models should probably have to be adapted, because, for example, this exposure model that I showed is specifically for human pharmaceuticals and focused, for example, on sewage wastewater treatment plants, which is very important for human pharmaceuticals. But the routes into the environment for veterinary pharmaceuticals are quite different. So that has to be extended. But I definitely think it would be valuable to have a similar system, or maybe an extension of this system for the veterinary sector.
Okay, thank you very much. I see that there is one raised hand by Ilaria Del Sepia. I will give you the floor right now.
Thank you very much. So I just wanted, in fact, to comment and ask a question to Professor Ragas. I mean, clearly the models you just mentioned needs to be adapted to cater for the veterinary business cases. But in terms of data, you already use human medicines data, which are sitting at the agency via the Article 57 database. You were also posing a question around the terminology to use for the substance and ingredients. And I wanted to ask you whether you consider, in fact, Article 57 is based already on the substance management system information. And the reason why I'm asking this is because, as you may be aware, we are implementing the Pan-European Veterinary Medicinal Product Dictionary, the Union Product Database, which is going to be compiled by the member states by the 28th of January 2022. And we are using the same terminology, which is this SMS, Substance Management System, which is in fact actually ISO IDMP compatible. So this is actually a first step in trying to understand whether the connection of the data can actually be piloted very early on when the UPD system will be available, and is also going to, in fact, make use of the same data. So I just wanted to ask this question to you, Professor Ragas.
I think so. We indeed using all these kind of data already on medicinal products, and I think one of the the discrepancies there is between environmental assessment and the registration of products is, of course, that multiple products have the same active ingredient. And when you do a registration from product on product, it's not immediately clear what active ingredient is in there. That's one of the things we're also struggling with in the human domain. So, for example, I'm performing a risk assessment for our hospital here in our city of Nijmegen, where I live. And there I really have to go into the administration and look which products are being used by the hospital, and then have to see, okay, which products have the same active ingredient, because ultimately they end up as the same substance in the environment. So it would be enormously helpful if next to an identifier for the pharmaceutical, there would also be a direct link to, okay, what is the active ingredient, that if you would go into a product database, that you could immediately harvest the same products, the products that have the same active ingredients. So that would be enormous step forward, I would think. Does that answer your question, Illyria?
No, yes, very much. Actually, make me prompting a follow-up action, which is probably going to be to have an offline discussion to understand how to mitigate and leverage this, because we do have the same kind of challenge and system already in place, because exactly the same solution is what we use at the agency for the pharmacovigilance system. And we, in fact, even as part of the veterinary medicinal product regulation implementation, we are in fact upgrading the system in EVVet and UPD, and we connect the data. And the whole point is, in fact, the codification and identification of ingredients, regardless of the sort of regulatory information around the product, but based really on the scientific composition. So, Michael, I suggest we take this conversation offline to really try to dig into it and see whether this premier project and database can be applied to the vet data.
Yes, thank you very much, of course. Next up, I would like to give the floor to Dr. Clayton, who would like to respond to the first comment or the first question asked to Professor Ragas. Rick, the floor is yours.
Michael, hello, and thank you for the floor. And I hope you can hear me okay, because yes, my connection is actually quite bad and I don't manage to hear everything. So I work for Animal Health Europe, the European Trade Association for veterinary medicines. I've been listening with a great deal of interest to this and other presentations. This is actually a fantastic event. I'm really enjoying it. But to come to the question, should we have a similar system like this database for the veterinary sector? I think the first response is, yes, of course, we will absolutely look at what's going on there, because you are trying something new and you will be learning a lot of lessons. You put some of them on some of your later slides. And I think certainly we can learn from that. You can always learn from other people's experiences. But then comes the word of caution, because we do often rely on learnings from the human sector, but maybe in the specific area of environmental risk, perhaps we do more metaphorically put our head in our hands when people say we might be able to apply a system from human medicines to veterinary medicines, because there really are some fundamental differences. And I can think of three just straight off the top of my head. First of all, the way we are regulated. We have been doing environmental risk assessments in our marketing authorization dossiers since the 1990s, and we have internationally harmonized guidelines at the VICH level around that. And these assessments are go, no-go decision points for the authorization of our products. So it is very different from the human medicine sector. And then perhaps the second big difference is the route of entry. so into the environment. So human medicines, the main route of entry is via the watercourses, via treatment plants, which makes it a lot easier to monitor and sample almost on a continuous basis. The main route of entry in veterinary medicines is terrestrial. And there you have a lot more challenges on where you sample, how you sample, at what time do you sample, because in the agricultural sector, it's less continuous and more specific treatment time points. And of course, in the soil, you have a lot going on with the degradation or the accumulation or the binding of the active into the soil. So it's a much more complicated picture. And then perhaps a third major difference is the value of the sector. In your last slide, you raised some very important issues, which are very high in our minds. If you have such a database, who pays for it, who upkeeps it, who maintains it, etc. The veterinary sector is very cost sensitive. So it's pretty much the first question on our mind when we see these proposals, which, the proposals may be fantastic and we may want to do them. It's often a very good idea, but at the end of the day, who's going to pay for it? And that's a very important question for a cost-sensitive sector like ours. So thank you for your proposals, and I am sure we will follow very closely what you're doing. Thank you.
Thank you very much, Rick, for those comments. I actually see in the chat that Professor Heberer made a similar comment along those lines, in general being appreciative of such a project, but also, of course, pointing out the complications, especially when it comes to modeling the environmental entry. I see we have a few hands raised. We have 10 minutes left for the discussion, so I suppose that all questions can be taken. But before I'm going to give the floor to Dr. Carapetto, I would like to ask some of the first questions we got from the chat, and one of this is directed to Ad from Susanne Schwonbeck, who asks, especially considering the goals of the European Commission's strategy on pharmaceuticals in the environment. She asks if, in your opinion, Ad, the availability of environmental data could contribute to a better protection of the environment, and if you consider that to have immediate effects or effects in the long term. Thank you.
Yeah, I would also almost refer back to the presentation earlier this morning from Professor Dewulf from Ghent University. I think he started with a great slide showing that just making data available and how you present them can already have an enormous influence on the environment, the reduction of the environmental impact of pharmaceuticals. So I believe that when data come available, that data come transparent, already that in itself will have some kind of influence on how people deal with these issues, simply because the problem becomes clear on the table and people become more aware of that what they are doing can result in an environmental issue, and that will stimulate them, hopefully also partly directly, but maybe also partly indirectly through pressure from other groups, will ultimately stimulate them to reduce the environmental impact. So yes, I think on the long run it will stimulate environmental quality.
Okay, thank you very much. Then we have another question from Sana Wilson, asking what are the main reasons to restrict public access to the environmental risk assessment of human pharmaceuticals data once the database is published? Will there be a public part, for example, excluding confidential data?
we are not sure yet how exactly to deal with the question. So our aim is to make the full database public, all data public, but we are still struggling a bit with data ownership, especially. So to give an example, some the chemicals, the ingredients are owned by particular companies that may have performed a test with that compound and that they put into the database. But it's also common to sell pharmaceuticals between companies. So, for example, if a compound would move from Bayer to AstraZeneca or the other way around, the question would be if the data, which is still owned by Bayer, is in the database, if the ownership of the compound moves to AstraZeneca, can it still be confidential or not? Or so there are a lot of, especially from the side of industry, they want to have all these issues sorted out before we can ultimately decide on whether the database will be fully public or not. But our aim definitely is, and that's also our experience from IPI, where when at that time 5 years ago when we started building that database, a lot of industry partners were still a bit reluctant to give the database publicly available. So we had layers there. So some of the data were only accessible for the companies. Some data were only accessible for the research partners in the project, and some of the data were fully public. But with our new system, our aim is probably to go to a fully public system. But whether that is feasible is still not clear. It's not yet decided.
Okay, thank you very much. And with that, I'd like to give the floor to Dr. Carapeto, who has raised his hand. Ricardo, the floor is yours.
Good morning, and thank you very much for the presentation. It has been really interesting to know how your project goes. In relation to the last point that Dr. Clayton made, I have to say that I agree that all your experiences that maybe are not directly transferable to the veterinary side, but I think anyway we can. I'm sure that we will be able to get some ideas from your side. I'm thinking, for example, in the prioritization of medicines that you have used is something that we can also benefit. Maybe that eco-drug model that you mentioned, I guess it's fully comparable to the veterinaries, and also the idea of having a co-funding with the European Union for getting data from legacy products, because we also have legacy products. And the availability of medicines is always a concern for us. So I guess there are things that we could benefit, and it will be interesting to follow your work. But I wanted to come back again to the more data-related stuff. And I was wondering, Professor Ragas, you mentioned in the database that you were going to use also measured exposure concentrations to feed that database, and the data quality and the cleaning of the data has been mentioned several times during these days. And I guess that for the measured environmental concentrations, you will have a lot of differences depending on the analytical method chosen, depending on the matrix from where you extracted the pharmaceutical in question. I guess that there will be a lot of issues that would make it difficult to compare measured environmental concentrations. And I'm not sure if you have progressed in your project enough as to deal with these things, or if you have any general idea on how do you think you can deal with and make all those measured environmental concentrations comparable and standard. That was my question, and thank you very much for the presentation, and congratulations for the work.
Yeah, thank you for your question. Yes, I briefly talked about data quality. I must admit that when I talked about it, I was mainly talking, of course, about the area where this data quality is mostly pronounced present. I think is the ecotoxicity data. We have already in the IPI project extended that a bit further to exposure and fate data. So also do quality assessment of degradation tests and partitioning coefficient tests. But we haven't extended it yet to measurements of pharmaceuticals in the environment. And I think your point is fair and is also a very good point. That also within measured concentrations, you'll probably have a lot of variability in data quality. But for now, we haven't yet addressed that in our project. But I think it's a good point to consider in the future.
Okay, thank you very much. For the sake of time, I'd like to not take any more questions at this point. I see that there have been some comments made. I will make sure that these will be addressed in writing following this event. So, with this, I'd like to thank Professor Ragas again very much for his very interesting presentations, and of course all the participants for the stimulating discussions. And in summing up this session, I conclude that a project along the lines of the one that has been presented today would be more or less suited or welcomed in the veterinary domain, although there are hurdles to be overcome, mainly, well, an important one is, of course, cost, but also regarding data quality, access of data, and data governance, which, of course, applies to the human domain as well. So all in all, or all things considered, my conclusion is that the application of big data concepts, modeling, and the use of already existing data would benefit the environmental risk assessment and environmental protection very much, although there are still issues that need to be discussed, but of course, that is nothing that cannot be done in the future in order to find maybe a suitable solution to ease and facilitate the environmental risk assessment of human and medicinal products. So that being said, I'd like to thank you all again for participating, and I have the honor to actually announce the first coffee break of the day. So this will take place from now until about 11:10. So with that, enjoy your break. Thank you very much again, and have a nice day. Thank you.
Okay, thank you very much. So good morning all, and I'm sure some of you have been able to be outside for a moment. It's a beautiful day, at least in Belgium, I think, and quite a bit of Western Europe. So I'm very pleased to be able to be part of this interesting meeting today on the topic now on pharmacovigilance and big data. I've been working for the European Medicines Agency for a long time, now on the topic of pharmacovigilance, supporting a small team working in that field, also supporting the team that is working on antimicrobial resistance. Pharmacovigilance was named already a few times yesterday. As everybody has high expectations that this field is really the obvious field for benefiting from big data. It was also mentioned that we're now making an important change in pharmacovigilance under the new regulation, where we're going to rely purely on electronic data through signal detection. And in that sense, it's also an opportunity. We're currently still developing our guidelines, so hopefully today we can learn and we can see if there are any possibilities to integrate already now in the setup of our new systems some of the benefits of big data. Now, big data in itself, personally, I have a double feeling. It's a name with so much promise. Big data. It's a bit like artificial intelligence is the same. And I'm sure big companies like Alibaba and Google, and they benefit when they're dealing with commercial data that are easy to standardize. But in the field of health data, where there's much more variability, I think a lot of benefits still have to show. And also, particularly in pharmacovigilance, where we had high hopes now with the pandemic, we've seen some issues that were really problematic. Apps, for example, in Belgium, totally failed. It was a lot of promise, but didn't work. And so, of course, we have an open mind. I'm also convinced that there are huge opportunities, but what I've learned from previous conference already a few years ago with from the agency on the topic of artificial intelligence and big data, it was already clear then that the issue is not to generate the data, the issue is not the computer power. It's a lot to do still with the humans behind it, the expertise needed, and in that sense, I very much also liked yesterday the presentation from Fernanda Dorea, where she said much is still about the integration. It's not always technical. It needs to be very well planned. So that's what we perhaps can discuss today, this morning, on the topic of pharmacovigilance. And we're going to start with a presentation by Ronnie Bhui. He is the head of global pharmacovigilance on Boehringer Ingelheim. Background by education and biomedical scientist with a lot of expertise and experience also working on human pharmaceuticals. Now he is part of the pharmaceutical task force for health for animals in Europe, and in that capacity we often meet now in the preparation of new legislation. Also internationally, he's part of the VICH Pharmacovigilance Working Party, so very well placed in the field of pharmacovigilance, veterinary pharmacovigilance. So, Ronnie, the floor is yours. Go ahead. Thank you.
Thank you, Jos, and then thank you, EMA, for holding this stakeholder forum. And I'm really going to enjoy speaking about this subject today, but this is a discussion. So please raise your hand, raise your questions, because my opinion is my own, and I'm sure we can come to some consensus on the way forward towards the end of this presentation. Next slide, please. Just to say the opinions are my own. Big thanks to those within Boehringer who helped me prepare this presentation. Additional thanks to SAVSNet and the VMD for their contributions, and there's a slide that we'll show there. And finally, through Animal Health Europe and the membership on reviewing and providing their comments to this presentation. Next slide. So I think we're going to see some common themes in what I present today and what we've already heard today already. I won't talk about the definition so much, but what I will talk about is the prevalence of big data in production animal than for pet health, and I think we've heard that again already today. The production animal side, just having more commercially available data, there's a public health interest, it's commercial in its intent, and also because of the antimicrobial resistance topic as well. Whereas on the pet health side, the data is really quite sparse and fragmented, and largely unstructured. So yeah, the animal health space is different. And we need to accommodate for that. But firstly, what I wanted to do is exploit our human health counterparts and talk a bit more about the applications of big data within human pharmacovigilance. Next slide. So I've stolen the next content of the next 3 slides from our human health counterparts in Boehringer. And really what they tend to talk about big data in is this real world data, this real world evidence. And when we talk about that, they talk about health records, insurance data, medical records that are electronic in nature, social media, surveys, mobile health, wearables. Just an example, my son a couple of weeks ago got a continuous glucose monitor that is connected to an app. And we can make dosing decisions based on that information. And from a geek perspective, it's quite nice to see the data and the fluctuations of glucose within the bloodstream and that sort of thing. So that is becoming more prevalent on the human health space, and that data is becoming much more available, and there's a link to the diabetic clinic and things like that. So this sort of information is becoming more available, and people are becoming more aware of that, and this sort of area has really become called that real world evidence group. Next slide, please. So there are a lot of different definitions of real world evidence within human pharma. However, it's widely agreed that it's the clinical evidence derived from the analysis of that data. If we look at the benefit risk profile, what they're really looking at there is the clinical and economic outcomes, the patient reported outcomes, and the health related outcomes within different studies and different trials itself. But also they're looking at basic pharmacoepidemiology of disease. They're looking at the incidence of the disease, the recurrence, the prevalence, the mortality, the patient outcomes, the risk factors associated with that disease, and really tying that into the benefit risk framework when you're looking at that the pharmacovigilance aspects through the real world evidence. Next slide, please. Within the context of this big data in human pharma, it really, and apologies for the small nature of the writing on here, but really it's just used to represent the fact that real world evidence or big data is being used throughout the life cycle of a product. So from early development in the growth phase of the product to maturity of the product. So they're able to look at prescribing patterns and adherence to the product and safety and effectiveness, and compare that in different populations as well. The data itself is used to compare that safety effectiveness data they've already said, but also assess the effectiveness of any risk minimizations that we may have put on place for those products as time goes on, like label changes, data doctor letters, whatever the case may be. They're able to assess the effectiveness of that risk through big data. And then finally, on the last point on this slide, just thinking about animal health, and it may be more predictive on pharmacovigilance profile to better estimate product support costs, for example. So if we're seeing a particular sign or symptom related to the use of a product, we may be able to estimate support costs from a technical services perspective or a guarantee perspective when it comes to vaccines or other types of guarantees. Next slide, please. When I was asked to provide this presentation, really what I was trying to think about was, what is the problem statement for us in veterinary PV? So there is a disparity between this food animal space and pet health space. In the latter, the availability of data is certainly less than our human health counterparts, but even from a food animal perspective. And like has already been alluded to in the conversation so far, the availability of the food animal data is well, it's not accessible. It's commercially sensitive data. So how do we open up the barriers for that? We also touched upon this already, but the digital revolution is here and here to stay. And I will talk a little bit about artificial intelligence and machine learning, but only in those contexts, to say there is an opportunity to use those technologies to really create more value from the data that we have. It's also recognized by myself that it is multifactorial in big data in terms of the methodology used to evaluate the data that we have, and to also evaluate the benefit risk assessment of these VMPs. Opportunities also exist for disease surveillance as well. So understanding how diseases are in the general population, and really understanding where the prevalence of those diseases are in place to provide that context, that denominator data for the risk information that we're seeing with regards to pharmacovigilance information from our products. And I think the hope is that we move from, with going down this big data approach, we move from a more reactive PV practices to a more proactive PV approach when it comes to monitoring the pharmacovigilance aspects of our products. Next slide, please. I wanted to put this definition, not necessarily to read the definition of an adverse event within veterinary PV, but just to highlight some of the differences between human PV and animal health PV, which is that we're really looking at more here than just an adverse event being an adverse reaction related to the use of a product. We're looking at lack of efficacy. We're looking at environmental exposure. We're looking at human exposure. We're looking at withdrawal limits and suspected transmission. So we are looking at a lot more today in the animal health space than we're seeing on the human health space. And when we are capturing this data, we're capturing it in a very structured format. And so maybe part of what we need to look at from a big data perspective is that appropriate to capture all these different types of information in the same structured format for data analysis. But anyway, again, it's a topic of discussion, and then you're more than welcome to make your comments on that. Next slide, please. When I think about the current data sources today from a veterinary PV perspective, very much so it's coming from the structured PV databases that we have in coded data sets of spontaneous pharmacovigilance data. And this data is coming from our health professionals, from animal owners, and the degree of information that we're receiving comes from the 4 minimum criteria, for example, to something much more extensive. We also are still seeing data from studies, and that's still there in a structured format. We are monitoring published literature. Again, I think it's semi-structured in that case, where we are reviewing the literature in PubMed and other various different literature sources, and really entering that data into the PV database. So again, this unstructured data, trying to put it in a more structured format for data analyses. And then finally here we are monitoring social media, especially those that are company-sponsored social media sites, and really, again, trying to put that in a structured format within our PV database. Next slide, please. Talked a bit about the PV databases. So we are building bigger data sets, and I think with the European database that we will have access to from industry and from national competent authorities and in the public, there's going to be millions of cases, millions of case reports within that database, which will allow us to look at that data in much more detail than we have done previously. And in order to evaluate that data for signals, we're going to have to think about the different methodologies that are in place to look at that data. So common approaches often apply to those of disproportionality analyses, and I'm not going to be an expert in signal detection and signal management, but there is various different methodologies. And in a recent paper here on the screen by Dr. Mark Novotny and his colleagues, they looked at the different types of statistical methods and really tried to evaluate the different algorithms to understand the performance of those algorithms within that PV data set. And what was interesting in the paper is that it is very much dependent on what you see is very much dependent on the statistical method used, as well as the different species that are being evaluated. So it's an interesting area, and definitely more research is required to understand that data. And what would be interesting to look at as well is once we are able to bring some of those data sets together, whether these different statistical methods would be applicable across the big data approaches that we see. Next slide, please. So from a signal management perspective in animal health PV, large data sets are required, and they are required to be to have more sensitivity when it comes to signal detection. The gold standard for signal detection in animal health continues to be individual case review, and it is generally down to the relatively low number of PV case reports that we're seeing across the different portfolios that we have to manage in animal health. Our ability to identify signals is increasing, to validate, to visualize, and even to implement appropriate risk mitigations is improving. And I think this is where big data and the different methodologies that we talked about will really help us in the speed and the efficiency of looking at these signals. So I think that for example, the data mining activities, I think the foundation is there for artificial intelligence to play its part in how we mine the data in the future. and even machine learning as well, may also play as part in triaging of medically severe events. Because we have this structured data, I think this is where you can have a rules-based algorithm to really look at the data that we have. And then text mining technology is also advancing, and this uses machine learning to evaluate this unstructured narrative data. And in the next slide that SavsNet has been able to provide to me, it really talks a bit more about how that text mining technology would work. So next slide, please. So this is a click-through slide. So we'll go through in the different 4 phases in a second, but just to talk about the University of Liverpool and the SavsNet initiative, you know, it's a looking at UK wide data, looking in the general practices of small animal vets, and they have in the region around 10 million narratives of unstructured data. They have event definitions based on Vedra concepts. They have event and exposure data. They're able to compare to baseline either through internal or external controls, and really start to look at identifying cases for controls, and really just look into that data and research into that data to look at different risk mitigations that may exist for the different products and for the different signs that they may see. Click one. Yeah, thank you. So one thing they're able to do right now is to conduct really simple searches. So searching for a suspect adverse event and a drug mentioned in the text. So they may see diarrhea after drug A, is this a potential ADR, reacted to drug B. And so these simple searches are something they're able to conduct within the data set they have. Next click. They're also able to look at investigating specific drug event pairs. So looking at the drug exposure data within the SavsNet database or dataset, they're able to look for specific adverse events in the consult notes. So they may see vomiting here or V++ this morning. They can then start to collate that data and start to think about what these specific drug event pairs may look like and may describe in the clinic information. Next click. They're also capturing all these events in unstructured data, and they're looking also for ways of trying to collect all that data together. So they'll look at misspellings or colloquial kind of lexicon terms of the different signs that they're seeing. And this way they may find more than just seizures. They may find things like fits, or in the misspelling of seizures, you can see there cluster seizures, episodes, and they'll try to group all of that information together to be able to see what's happening in the data that they're seeing. Next click. And based on some of this kind of data cleaning and some of the unstructured data, recently saw how they're using topic modeling to generate hypotheses in the data. So based on everything you see here, they're able to, so if we click through a couple more times, please. They're able to see how many times certain things were stated within the database itself, and really think about were these related to prior therapies, whether related to indication, and using this topic modeling, this kind of machine learning to really understand what is happening out there in the clinic information and what are we seeing from a background population or a population within the small animal within the UK. Next slide, please. So that was a good opportunity to see what we're doing today in SavsNet and topic modeling and the different technologies that may exist to look at this sort of data. But I believe there's more opportunities that exist to create larger data sets, and pharmacoepidemiology is a word that gets used a lot, but we require a lot of information there and disease set information, as I said, to provide that context, that perspective to that risk information. And there are currently a few different data sets that are being used, and as already been discussed today, it's fragmented. As I say, it's fragmented because it's in different places. They're collecting data slightly differently, and it's how do you start to bring all of that data together to make informed decisions or informed or create informed hypotheses to look at that data. So you can see in the vet clinic data, SavsNet just showed you very briefly what they have. The Royal Vet College have Vet Compass, and if you have an opportunity to look at that data, it's very, very useful. A sister program in the US called CavsNet to SavsNet, and Banfield have a lot of data as well that they collect on their pet hospitals in the US. It'll also be interesting to see some of the lab data, so some of the diagnostic labs that exist globally, and understanding what are we seeing from a lab investigation perspective, what are the diagnoses that may be created from looking at the lab data. Even looking at some of the insurance data, so pet insurance is becoming more prevalent in a lot of countries. Is there a way that we can exploit that data and get accessibility to that data to understand what's happening out there in the population and what's happening at clinic visits, etc. I think we can also go down the traditional routes of surveys and understanding what's happening out there with the clinics and asking more specific questions when it comes to pharmacoepidemiology at the clinic level. And others may exist, and please remember to use the chat function or raise your hand if you think there's other things that we haven't really thought about here in terms of future data sources. Next slide. So continuing the theme of future data sources, telemedicine is increasing, and I think during this COVID time, we've seen organizations created so that we can perform clinic visits more virtually, and there are other kind of mobile apps and wearables for animals perhaps that we may see that are really giving us data on animals themselves. And I think we also foresee that even through genotype profiling, and I think the University of Washington briefly describe some of their research on genotype profiling that can tell us more about animals and even consider personalized medicine in the future, similar to that, what is happening on the human side. From a social media perspective, I think there's a lot of data in social media, but it's how are you looking into that? It's not about putting it all into the PV database necessarily, but I think it's rather looking at social listening and understanding that directionally is going to point you to a certain area within the PV data. But how do you bring those two things together? And I think more research, more thought is required about social media and its applications within animal health. And even thinking about some other indirect sources of information, thinking about ectoparasite products and ectoparasites in general, and how weather and climate and geographical data can really aid us in visualizing where the risks are when it comes to using certain products as well. So yeah, lots of data sources in the future. It's just how do you bring all of that together at the end of the day. Next slide, please. In researching on this topic as well, there was a paper that was recommended to me in 2005 from Glickman, looking at the safety profile of moxidectin and two other oral heartworm preventatives in dogs. Again, you'll get the slides. I'm not going to read it entirely, and you'll have to link to the paper. But I think this study was important for a couple of different reasons. It was important because it confirmed the hypothesis generated from the spontaneous PV data. So the PV data was pointing a certain way, and in reviewing the millions of clinical case records, it was able to confirm the signal that we were seeing. It also can help us evaluate the baseline occurrence of certain conditions, again, helping us to provide that context to the risks observed in the PV data. Next slide, please. And then finally, and hopefully we can generate a lot of discussion after this. So big data and its applications can aid PV. It can help us understand the health problems and help us make informed decisions on the benefit risk profile of veterinary products. The data found can be found in a variety of different sources. It's frequently fragmented, can be structured or unstructured or somewhere in between. Statistical tools and data mining methodologies are important. We need to evaluate those in much more detail, and also understand, as well as its applications in pharmacovigilance, how can we use those same methodologies, same thought processes when it comes to evaluating big data. And also, I think it's important for us to formulate a hypothesis in order to draw conclusions from the big data itself. Because you can go into that data, you can start digging, but unless you don't know what you want from the data, you'll be continue digging for answers, or you'll be trying to look for things in the data and finding things which may not necessarily be true. So it's important to go into that data with your eyes open and really to understand what is it I'm trying to do. And I think the more I think about this subject and the more I think about big data, I think what it does for pharmacovigilance, it really helps us to confirm or refute signals that we're seeing in the PV data itself. And they do work in synergy. It's just how do we make that happen moving forward. Okay. Next slide, and that's a thanks from me. Thanks for your attention. And in the slide deck as well, you'll see some of the references that we used in the presentation. But that's all from me today. Thank you.
Thank you very much, Ronnie, for this very interesting presentation. And you've touched on many fields and opportunities. And the floor is now open to have a good discussion on what can we start working on for the new legislation for the implementation. And I don't see any immediate questions coming up, so I'll start with a few reflections from our side. I think you've touched on the baseline issue. The baseline issue is something that we often struggle with, because now in single detection, what you try to do is you try to look at the kind of frequency in your data compared to the baseline in a normal population. But that's the type of information that you basically that we're not having easy access to. And clearly, one of the options would be if the practice softwares of veterinarians could really be linked and have tools available that make the reporting much more easier from their side and quicker with relevant, good quality data, that would hugely improve also the amount of data I'm sure we will be getting and the quality. I'm not sure of the speakers from Anikura are still present also today from yesterday. I know that they have the potential at least available. My question would be, from a regulatory perspective, now working with the legislation, of course, the legislation allows us to collect information of diseased animals, of issues that are, of events that are happening out there, but it doesn't specify us to really collect information of the normal population. So I'm not sure how easy it is for regulators to get access to that type of information and how open that information would be available. That would be for us, I think, one of the quick wins that we need to work on. And that's also what I think what happened for the pandemic on the human side, for example, where they needed to have on the thrombosis issue, what is the baseline issue, baseline frequency, that's another example. So similarly for our type of data, exactly the same issues there. So that's one element maybe. One other element related to, as you know, our database is very skewed towards small animals, dogs and cats, and we receive really not enough data related to food-producing animals. And there is exactly where you have the revolution of the Internet of Things taking place. You know, they're monitored much more closely because you have the interest of the production data there. So that's where we, of course, could piggyback on existing systems and plan them properly and see how can we really use that type of data instead of potentially even the spontaneous adverse event reports. I don't know, Ronnie, if you have any further views on that. I'll monitor the floor for hands up for the moment. Thank you.
Yeah. To the two comments, the clinic databases, we've certainly looked into that question, and we know that there are several different types of clinic databases that are being used. And from our initial conversations, one of the things that we're discovering is that although the clinic databases may be the same, its application at the clinic level may be different. So again, it may come in as a more unstructured kind of data, but again, looking at artificial intelligence and machine learning and those topic modeling that we briefly presented, that may be how we start to harmonize the data that we see. But it's definitely the approach that we need to continue down from a clinic database perspective. And from a food producing perspective, absolutely, there's masses of underreporting, and as I said, there is data, a lot of data out there, which is used for commercial purposes and supporting the customer. If we could find that data and have that open to all, I reckon we'll find much more than we'll find in the spontaneous data itself. So I agree, we need to explore these areas much more in detail than we are today.
Thank you, Ronnie. I see a question from James Mount, our Swedish colleague, and that relates to a platform called FAS. Providers of FAS have recently indicated that they have the potential to monitor the activities of veterinarians who use the site, in particular the frequency the veterinarians access and read information, i.e. adverse event sections. And then scrolling down, the providers has recently indicated that they have the potential to monitor the activities. Sorry, it's moving up and down with me. And so the question is really, could you monitor seasonal fluctuations of risk? What do you think a form of big data? I understand there has been a very well-documented issue on the human side on influenza monitoring social media, which, and I'd forgotten actually the real details, but it was documented over how this worked over a few years, and it was very variable. I think the type of usefulness of these social media monitoring for influenza. It is value, but it has not broken through. How do you say it? It has not provided, or it definitely has not become a common. It's commonly used yet. I don't know, James, if I can give you the floor on this, if you want to come in.
My take on the question raised by James is, I think what that data may provide us with is an ability to check out the effectiveness of any adverse event sections within the label itself, and to understand how often potentially veterinarians are reading that section, maybe from a readability perspective, but also because they're having to make that benefit risk assessment at the clinic level. So it potentially is useful. It's useful information. Again, coming to my conclusion point is, what are you going to do with that data? So if you collect that information, how is it going to help? Is it going to help with regards to communication effectiveness or something very similar? And I think that does tie itself into the European regulation and the communication part, where we really are trying to establish how effective communication is to the veterinarian on various different aspects. So I think hopefully that's been able to address that question as well.
Thank you, Ronnie. I see also a comment from Barbara. Farm management systems, how far can they be used an opportunity for better pharmacovigilance data? I was a bit touched by a few speakers before. I think the number of, well, I'm sure in production farm animal, many and the professional people all use now systems that monitor. That was also touched on by Jeroen this morning, you know, the different production variables. So the question is, how do you get them in? But also equally important, I think, upfront is really make a plan on how can they really contribute to pharmacovigilance. One thing is starting off to link them in. I think first we need to have a discussion on how are they going to really contribute, because that's what I think I've learned also from the presentation yesterday from a Swedish colleague, that it's very important to upfront to plan and to see the right objectives and to before you start integrating the data, because otherwise you get more questions than answers sometimes. One element I think touched on yesterday by our Canadian colleagues is the scale of VICH. I don't think the VICH was named there, but that was I think what was meant is that it's true that in pharmacovigilance we have one standard of reporting now, and we are one step away, in my opinion, to really work more internationally at VICH level on one even global database, because the standard is there. So in terms of standardization of certain data, except for the product data, but in terms of our adverse event data, they are pretty much standardized. So that type of advantage of scale, we could really start discussing at VICH level, I think, how we're gonna use that and approach that in a joint effort from regulators and industry. So there are definitely opportunities of scale at VICH level. I think there's comment from Ruth Clements. Totally agree with reference lack of background population data, for instance, background disease and mortality data in aquaculture. Indeed, how do we move forward with accessing health management data from producers, which could then be mined in the way Ronnie describes? Similar comment. You point about baseline from Declan. In normal population is key. As you mentioned, it is available on human side, and it will be key to try to get the equivalent data on animal health side. See De Bruyne on the comments on Vet Compass. Great UK initiatives, collecting vet and lab data. Do you think it would be useful to extend them more European, and how would that be possible? One opportunity that we have in terms of the new legislation, again, is there's an article that allows the agency to organize specific meetings with healthcare professionals, and that's one of our objectives specifically for large and food-producing animals, where we had started, I think, 2 years ago and 3 years ago with 2 meetings. We want to start in probably already next year with particular meetings, and on the agenda of those meetings, I'm sure how can we benefit from farm data, from farm management data, how can we benefit from other systems use will be on the agenda. And that's where I think lies an opportunity for us to directly interact with veterinarians in the field. Also recognizing at the same time that as a regulator, we see that specifically for food producing animals, these people come so specialized. You have only a few in Belgium. I think there are only 2 main practices that deal with almost all the commercial farm animals. So they have a lot of know-how that we hopefully can tap into also from a regulatory side. So that's for me where there should be an opportunity for regulators to get closer to the know-how and to do those people, and to sit together and to make a plan for 2 years or something to come back and to see how big data can be used. Ronnie, I don't know if you want to comment on that as well. Thank you.
Yeah, I think one of the ways I think SAVSNet and Vetcompass have been successful is that they are academic functions. So maybe part of it is not using this necessarily for commercial purposes and really collecting it to understand what's happening here in the UK. And I think if there could be sister programs across the rest of Europe, I think you'll slowly start to create a very large data set within Europe. As you correctly said, Jos, I think in these forums with the veterinarians, I think we need to pose that question to them and see how can we start to work together, and maybe there is an academic institution that would be interested in spearheading a lot of this across Europe with different academic functions as well.
Thank you, Ronnie. I see one other question, Catherine Sherman. Can we use farm data for pharmacovigilance without relating the information to the treatment, e.g. the date and symptoms reported? Catherine, on this one, you need to help me. Can I ask you to
Catherine,
clarify maybe?
raise your hand, please, so I can unmute you. I just found her. Catherine Sherman, if you want to ask your question too, so you can expand on your question, I'm going to unmute you now.
Sorry, Catherine, to put you on the spot.
Sorry, can you hear me?
Yes, we can.
Oh, thank you. Good, thanks. No, my question was just knowing that especially on dairy farms, for example, the farmers not always are right on time with entering data for treatments, and especially not always recording symptoms that they would have seen. I was just wondering how we can get around that for pharmacovigilance data to use the big data approach. I mean, I have a background in dairy farming, and I really like the big data sets we can get from there. I just don't know how we can use it for pharmacovigilance without that specific information. Thank you.
Thank you, Catherine. Ronnie, do you have a view on this?
Yeah, I think so. So it's really using big data is not around collecting PV information. Big data for me is around looking at what's going on in the population and understanding directionally. Again, to that point, I think it's only going to really be able to do a couple of things beyond what I'm saying here, but confirming or refuting a signal that we see in the PV data. So even though they may not have dates of onset or kind of the detail that we're looking for from a PV perspective, if they are seeing certain things on a dairy farm and we can extrapolate that data and overlay that perhaps with our PV information, it may be able to tell us, oh, something is happening here. From a sign perspective, a symptom perspective, or a syndrome perspective. And that will help us in again, it said, confirming or refuting a signal that we're seeing from the PV data. So it may not give us the direct answer to the question of what's happening in dairy cows, but it will help us in confirming what may be happening in that particular arena. And I think the next section is talking about efficacy. It's definitely going to provide some information from an efficacy perspective, perhaps, looking at that data as well. So, yeah, there is some value there. I just don't think we're at a stage where we can say definitively how it will help us. So that's just my little brief take on that, Jos.
Yes, thank you, Ronnie. My other reflection on this is I'm a little bit stuck with, I mean, you, Ronnie, from a company, Boehringer, can we really expect you to submit this type of information? I mean, it's falling a little bit outside of the scope of, it's very difficult for regulators within legislation to see, you know, how can we ask you to send us information that is not already a real adverse event as detailed in the legislation. What's your view on that?
Again, I think it's all about evaluating that benefit risk profile for that product. So in assessing the signal, all of this is used to as a benefit risk framework to understand what is happening with the product, and can that data support defense of a particular sign off the label, or will it even confirm that something needs to be put on the label because this is a risk seen and it changes the balance of that benefit risk profile? It's really using that evaluation, that judgment-based skills. And I think we talk about the regulations, right? We talk about validating that signal and the different levers that are at your disposal to validate that signal. And I think this becomes one of them in essence. So we would submit it if it helped confirm or refute what we're seeing from a signal perspective, in my opinion.
Thank you, Ronnie. I think we're kind of closing our time frame for our discussion. There's one last comment, I think, from Tony Simon. Yes, that relates to interrogating big data and best practice approaches. Yes, absolutely. I think that touches on, again, on the guidelines that we're currently making. And let me finish with that one. I think we need to come back and particularly on the topic of big data and pharmacovigilance, there's so many expectations on it, and perhaps have a dedicated meeting and see how we can take this forward as part also of the implementation of the new legislation. So I think I'd like to close this discussion for this morning and give the floor now to Dr. Sandra Bertula, who's going to provide us with a presentation on real-world evidence examples of big data support efficacy and effectiveness. The floor is yours, Sandra. Thank you.
Thank you, Joss. Thank you. And I also wish a warm welcome to this last presentation, our second session of our Veterinary Big Data Stakeholder Forum. And as Joss already said, we will focus on the usage of real-world evidence for demonstrating efficacy and effectiveness. Just a brief introduction of myself. In contrast to my previous moderators, I'm working not at the EMA, but at the German National Competent Authority, and I'm responsible for the assessment of efficacy and safety of veterinary medicinal products. And I'm also a member of the CVMP Efficacy Working Party and the Big Data Steering Group and the EMA Big Data Working Group. So that said, albeit this is the last presentation in the session, I want to underline that it's not less important than the topics that have been discussed before. However, while antimicrobial resistance, environmental risk assessment, and pharmacovigilance, there we already have databases, and we have some ideas how to use this big data for regulatory purposes. For the efficacy part, actually the situation is somewhat different. When you just remember the presentations given yesterday by Dr. Kleen and the colleagues from Anicura, we have big data already available and real-world evidence. And this data are largely used in research, just as examples of farm data, and as furthermore nicely demonstrated yesterday, we have also some new technical solutions that are already explored by researchers. For example, also in the field by veterinarians, just remember the apps that are used by the Anicura clinics. So the challenges we face are how this data could be used for regulatory purposes, and also what requirements have to be fulfilled. So in order to address this topic, I now have the pleasure to introduce our speakers for this last presentation in the session. Those are Dr. Katrina Stirling. Dr. Stirling has a degree in virology and a PhD in immunology, and she previously worked at the Veterinary Medicine Directorate, the UK National Competent Authorities, and then she switched teams and joined Pfizer Animal Health. Now it's Zoetis, and she's the Director of Regulatory Affairs and focusing on companion animal vaccines and on biologicals. And afterwards, our second speaker, that's Dr. Andrea Wright. She has a master in large animal internal medicine, and after working in private practice, she also joined the industry. And since 2011, she is with Zoetis, initially as a marketing manager for equine biologics. And since 2016, she is a director of the internal outcome research group and supports all companion and equine products. So ladies, the floor is yours.
Thank you, Sandra. Can you guys hear me okay?
Yes, we can hear you fine.
Fantastic, fantastic. Before I start speaking to myself. So thank you, Sandra, and thank you to all the previous speakers. And actually, I think this presentation should be a nice carry on from that discussion, because it touches on some of the aspects we touched on yesterday and some of those pharmacovigilance aspects we've just heard about, and bringing all of that together to some extent in the overall benefit risk assessment of products. And I think in terms of efficacy and effectiveness, this is very much in its infancy, and what we're going to do between Andrea and I is give you some examples of where this is starting to go, and some of those questions it starts to raise when we start to think about how we could use this data in a formal regulatory setting. And these examples come from the infancy of big data and from biodevices, so these kind of devices where we're starting to be able to collect much more data. And in that context, when I'm talking about efficacy, we've considered efficacy here in the context of a very regulatory context, in the idea of efficacy in terms of being able to support that label indication, and effectiveness as a slightly broader term in terms of that overall product benefit risk and how that product is potentially working in an external environment. And I'll switch between Andrea and I. So if you go to the first slide, please, or the next slide. So how are we using big data right now, and what might be possible in the future? So as Sandra touched on, and why I have Andrea with me, is that much of what we're doing right now is really in an outcomes research sense to support product in the field, whether that's informing marketing decisions, supporting product technically, or just understanding a bit more about the benefits of our products in the market. And then in R&D, we're very much sort of starting to look at the potential to use things like apps, biosensors, and other digital technology to collect much more data in the context of clinical trials. And as I'll come to, once we get into that clinical trial context, we're in a very different environment to some of that retrospective data collection we've heard about already. So for example, exploring quality of life for companion animals to support product benefits, and collecting huge amounts of information through apps and other sources to do that. And in the livestock area, using things like herd tracking software we've heard on touched on in terms of precision livestock farming, to assess the impact of medicines on herd health and performance, or even larger scale population levels. And technology has the potential to support products in a regulatory context, whether that's looking at additional or non-conventional endpoints, objective data collection from things like biosensors, which is a big thing in a regulatory context as to whether you're collecting data in a subjective or an objective way. We've already heard about data collection on antimicrobial use, which then links to product benefit risk assessment, and the impact of products on animal health at a herd or a population level. So thinking about products that may reduce antimicrobial use, or looking at vaccines and how they impact overall disease incidence. And then linking all that back to the broader product benefit risk assessment, which then links to our pharmacovigilance also. If you go to the next slide, please. So Andrea, I'll pass to you here to give us a few examples of how veterinary big data are being used in some real world examples here.
Thank you, Kat. So I put up a couple of examples of recently published or soon to be published data that Zoetis has been working on, or our partners, where we really looked at huge rows of data. In the left-hand corner, we took actually practice management software and extracted that data, but we looked at the transactional records rather than the health records, because in software, you have transactions which end up being invoices that have to be documented for products, but then we also have the medical records. But from the transactional part, that becomes part of the medical record. So this is already beginning to happen with, over almost 2 million individual invoices we looked at to look at just purchase compliance and economic value in dogs in veterinary practice. And then there's 3D cameras being used in the pork industry. And then Calf Tracker is actually an app. and there'll be a recent submission to the Journal of Dairy Science, and you can see that, you've got 59,000 weight recordings. So all of this is starting to go on within both production, animal medicine, and companion animal space. Next slide, please. So we began quite a few years ago because the pet owner, really when you're trying to collect this kind of information, it's easiest for them if there's an app in their hand, and especially with data where you're trying to understand the treatment benefit of a medication that acts rather quickly. So this was an example from Apoquel being prescribed and how quickly you can collect technical data, quality of life data, images, images of lesions, and then feed that back to the veterinary dashboard. This is important. We found besides sending out emails to get data at the right time, and the pet owner really likes to have it in their hand. Next slide, please. So we found out in that very short study that a mobile app is accepted by dog owners for monitoring pruritus, quality of life, and response. And it really has the potential to enhance communication between veterinarians and dog owners. Next slide. The other part is that we're really interested because pet owners and veterinarians are interested in quality of life. And how do we support the benefit risk assessment of our products? Next slide. So really, why do we assess quality of life in owners and companion animals? Next slide. Next. Really, it's a central part of veterinary practice. Really, as pet owners are interested in using medications to improve their pets' quality of life, and veterinarians are really, they want to help their pets and their practices by giving treatments that can improve quality of life. And what we found is treatment success can really be defined by the pet owner's perception of the improvement in quality of life. Next slide. So tracking can enhance vet owner communication. Next slide. But in this particular study, we went back to the veterinarians and we were just asking them how to improve our outcomes research trial, actually. And they really liked it that the pet owner came back 7 days later, and it really caused them to focus on their therapeutic options and really said it gave them another level of engagement. And it made them more focused on outcomes. If you can imagine, often as veterinarians, we prescribe medications, and then if we don't hear anything, that's good news. We only usually find out if there's a problem if they come back. We don't always do a great job about following up after a medication has been prescribed. So our real question is, can quality of life measures be used in a regulatory context? Next slide. And what we had found in looking at this data, that quality of life of dogs and owners that received oclacitinib, only the pruritus score and study day were significant predictors of quality of life. So we looked at dose, age, weight, sex, and diagnosis. Neither of those were significantly associated with these outcomes. Next slide. And then we went on when Cytopoint or Lokivetimab came on the market, and we used this app really early. This was a progress report from an early experience program, 30 days post-injection, where we monitored the owner-reported pruritus score, the dog's quality of life, and the owner's quality of life. And using an app, as you can see, as soon as day one, you can actually see what the baseline of the dog owner and the dog's quality of life is, but also pruritus in this score, and see how it changes over a 30-day period. Next slide.
So that's back to me. Thank you, Andrea. So hopefully Andrea's given you a few examples there where you can start to see how potentially we can use this kind of approach and these sort of data sets where, particularly with apps, where you can access data from a huge number of pet owners and veterinary practices that can build a big picture of the effectiveness or the efficacy of a product. But then the question we start to get to, outcomes research is one thing, but how can we then use that in a regulatory context when it comes to efficacy? So can we do it in demonstrating and supporting product efficacy and benefit risk in additional to our pivotal clinical data that we're using for regulatory? And then you start to get into questions around what are the regulatory expectations on us for validation of these kind of app-based quality of life tools? How could we use this potentially post-approval to support expanded claims or ongoing benefit risk? And then how does that link back to the pharmacovigilance context, whether we're looking at it in terms of product benefit or also product risk? Because as you can possibly imagine, when we start to ask some of these questions of pet owners, particularly if it links to things that are VEDRA terms, for example, what's then the impact in terms of pharmacovigilance data collection? So these things are very much interlinked with pharmacovigilance. And then how can this be reflected on an SPC? Is it about supporting an indication that's not described, for example, it's just there in the public assessment report or the benefit risk assessment? Or can we move then to the fact of using this data to support indications for quality of life improvement, for example? Next slide. So then this brings us on to then looking at things like about correlating digital tools to the current approach for efficacy demonstration. So Andrea's given you some examples there of these app-based data collection. So can we do anything in terms of being able to correlate those new data-driven tools to how we're currently doing this? Next slide, please. Andrea can talk through, this is just one example where we tried to look at that.
Mm-hmm. So we know that that in veterinary medicine, the paper PVAS, which measures pruritus, was a very successful tool, but it requires paper. And when you're doing clinical trials, that's another difficult thing for everyone to measure. So we worked with Dr. Peter Hill and took his paper PVAS, and we wanted to see if we could put it in and accurately put it into a digital PVAS. And so we had the pet owners do the digital PVAS in the app and the paper form, and actually figured out whether a PVAS could be used, could it be equivalent to the paper-based PVAS, and could then it would be much easier to track something like pruritus at home for the pet owners on an app. So we were successful with that. Next slide.
So that's back to me again. So yeah, that's an example of how the sort of things we've started to look at in terms of being able to use this technology. And you can imagine that in context of running a clinical trial, getting a lot more information, it's much easier for a pet owner now to be able to be providing you information through an app than having to fill in a paper-based form on a regular basis. But I think one of the big things to think about here is proving clinical efficacy in a controlled environment for registration is very different to outcomes research monitoring efficacy in the real world. And that starts to give us further regulatory questions, and we won't be able to get into these in this meeting, but it's the kind of things we'll need to think about in the future as we start to think about using big data, digital technology, these kind of larger data sets in a formal regulatory context. And that's all about data validation. The app validation expectations to use it to collect efficacy data in a clinical context, the GCP or GLP considerations, how do you audit big data or digital data collection? What validation expectations will there be on the digital tool? So Andrea gave you an example with the PVAS, looking at the traditional paper-based type collection versus an app. Or other things like the quality of life tools we've just talked about. How do you validate a quality of life tool in a veterinary context? What are the regulators' expectations going to be to do that? And are they different if we're thinking about using it for, say, a primary efficacy variable versus something where we might start to do it for secondary variables as a starting point to start generating these bigger data sets? And could an app like this, in addition, be used to support decision making on a sort of precision medicine basis to support, for example, dosing intervals for an individual animal? So if you think about the pruritus app type approach, for example, so if a pet owner or a veterinarian through app monitoring started to see that the dog was getting a bit more itchy, is that the trigger to have another dose of Cytopoint, for example? So just it links back to some of what Nancy was talking about yesterday in terms of this tele or e-medicine and being able to close that loop between the medicine and the veterinary pharmaceutical companies, the pet owners or the farmers, and then the veterinarians as to how you use medicines, getting into this, slowly moving into this phase of not just precision livestock farming, but precision medicine. Next slide, please. So the other thing is then about biosensors and activity monitors for data collection. So it was touched on yesterday by the Anacura colleagues in the context of the whistle collars, and we've got a little bit more to comment on here with those as well. It's just another example of the kind of data that we can start to look at and collect. If you go to the next slide, please. And I think I'll get Andrea to talk to this one and then back to me.
Yeah, so we already have quite a few articles coming out about when you move to a wearable sensor. So there's been some articles, different sensors out there or activity monitors about how do you quantify pruritic behaviors in dogs? How do you actually detect changes in pruritic behaviors? Now that's a short article with 6 dogs. And then over here on the right-hand side, something was recently published about the deep learning classification of behavior using a collar-mounted accelerometer in a real-world validation. So again, it's very different when the monitor sits on the collar and you're in a clinical trial and you can monitor exactly what you're watching, but it goes out into the real world. They lose the activity monitors. It changes on the collar. Is the collar off during that time? So this group from Kinship has done a really nice job of, does it even matter where the collar is or the activity monitor is sitting on the dog's neck? Next slide, please. So then, you know, what we have used is the PVAS, and we've shown you can use that in an app. But that's what is kind of gold standard for measuring pruritus. So we recently completed with the Kinship team, could PVAS, and so you monitor actually activities and make sure you do videos and make sure that the activity that the dog is reported, like scratching, is actually scratching. But then how does that compare to what a pet owner has already been using, which is the PVAS? And we actually found that as scratching severity increased, as measured by the whistle canine collar, the PVAS scores significantly increased. So this really works well to support veterinary care and treatment plans, but could you use this in a formal registration context? Next slide.
Actually, maybe just go back to that one for a sec. Thank you, Andrea. I will talk to the next one. And to the point of the bottom point here, there's just a question just come up in the chat from Klaus Hellman that actually raises the point of why we have that highlighted question on the bottom. And it's this difference between collecting this data in an outcomes research context versus compliance and using it in a where we're not always sure about compliance of the pet owner competence. How do we have confidence in using this data, big data or non-qualified big data, versus a well-controlled individual data? And that's one of the big challenges we have in the context of moving forward with this in any sort of formal regulatory context. So to Klaus's question, it raises more questions than answers, and it's something we will have to try and work through if we're ever to get to the point where we can use these kind of approaches in a more formal regulatory context. If you go to the next slide, please. This is just another example. Practically, this is from livestock, and it's using rumen bolus. So a rumen bolus in cattle that goes in and it monitors temperature and drinking behavior. And this is looking at the correlation just in temperature between a rectal temperature and what you get from the biosensor. So you can imagine you're running a clinical trial, you take rectal temperatures at certain time points, whereas the rumen bolus biosensor is continually monitoring temperature. The data in themselves are not critical here. This was simply looking at an E. coli challenge model, but what we were able to show in a very research setting was that the rumen temperature provided a better indication of the physiological state than the rectal temperature alone, meaning there was more consistent peaks of temperature, and it provided additional information linked to drinking behavior. And it allows you, as you can start to see with this kind of information, if you can imagine you had these in every animal in a clinical trial, in a field setting, or even a laboratory setting, it's less invasive. It's easier to monitor. You've got a lot more data. And what you start to see is you start to pick up things you may not have been aware of when you're doing this traditional fixed rectal temperature monitoring going in at a certain time point. So it gives you more information, and it's got that potential to do that. But this is very much early stage. This is simply simply an example of how these things may be able to be used in a context. And the same with some of this other practice software and other information we're getting from this livestock data collection systems that are in place. Next slide, please. So that all sounds great, but, and there is a big but, it's linked to the question Klaus just put out on the chat, but how does it work in a regulatory context? And we're coming back again to these questions about validation of biosensors in the same way as apps and other things, correlation to the traditional or gold standard methods, and again, these GLP, GCP considerations for data collection, validation, and auditing. I know I'm repeating myself, but these are the big questions we're going to have in terms of using this data in a formal regulatory context. And it may well be that where we start is we start small. We start with some of these use for traditional endpoints like the temperature monitoring or the collars Andrea was talking about, before we finally start to get to thinking about how can we use this for more non-traditional endpoints, or are there definitely bigger challenges. Next slide, please. And this is just, I'm not going to read it all here. It's just a sort of overall almost we were thinking about it as sort of triaging large data sets, big data, and the regulatory questions that go with it, and how those vary depending on how we're using that data. So for the highest level of control and standardization you need for a regulated label claim, whether that's for a claim target or diagnostic to support traditional outcomes. Then coming down to things like novel outcomes to support regulated claims. So that probably you're more in the realms of the quality of life type assessments, or these other broader effectiveness type approaches we might be thinking about in terms of things like reduction of antimicrobial use, animal welfare improvements, these kind of non-traditional, non-conventional endpoints or data that overall builds to that product benefit risk assessment. We could then be thinking about novel outcomes, including monitoring devices, to support use of the licensed product or a therapeutic plan. That links back more to the veterinarian side of things. So helping the veterinarian understand the best way to treat an individual patient or herd, etc. And then that non-regulated space, so very much more into the outcomes research area, but all of that then does link back to the pharmacovigilance questions as well. So I think what we've given you here is more questions than answers, and it's overall things to think about. And I think my last slide is just some general considerations from industry that Rick Clayton will come back to later, in the sense that some of these basic principles and concepts have been established by the human health industry, but they'd be very similar for animal health. So the vision of data-driven medicine and medicines regulation is fully supported. And as you can see, we as an industry are slowly moving in that direction. But the big question that we have now is how do we innovate to turn that data into decisions on medicines that will benefit animals, humans, the world. There's definitely an evolution in precision medicine, and we can't discount this global harmonization. So our ability to do these trials and run these trials, collect data in a way that we can use not just in Europe, but in other regions around the world. A collaborative approach is going to be very important to address these challenges, and hopefully this forum is just the start of that discussion. but we clearly recognise the value of real-world data to complement clinical efficacy trials, and health digitisation requires digital health and education. And I think you can see from some of these previous talks we've had how this space is evolving, and it's evolving fast. And the final message I think, which Rick will come back to in our discussions this afternoon, is that industry needs to be regarded and involved as a true partner in this, because it's only through working together that we will be able to understand how we can really use these data going forward. And I think, Sandra, that should finish with a thank you slide and a start for questions.
Thank you, Katerina, and thank you, Andrea, for this very interesting presentation. And we already got 2 questions. Nevertheless, more questions would be more than welcome. Katerina, you already addressed the question asked by Klaus Hellmann, but for all to just repeat, he asked where the threshold is between non-qualified big data and if it's better than well-controlled individual data. You already gave an answer to that. Nevertheless, I just want to give my 50 cents as well, because I think both things are not contradictory. Big data can be controlled data, especially when we are talking about loggers and sensors, and those data could help to support well-collected individual data. And on the other hand, also those individual data are not always so golden as they seem, because they are also prone for bias, and especially when we are talking about field studies. So just to conclude on that question. Furthermore, we got a question from Frederick Klein, and he is asking what kind of information are included into the quality of life parameter, and how to define quality of life as a non-anthropomorphic parameter. So
I will get Andrea to answer in detail, but the first thing I will say to that is that any quality of life parameter needs to be tailored to the disease or the condition you're looking at. So a quality of life tool that would work for, say, the atopic dermatitis, where Andrea's given you example, may then be completely different to a quality of life tool that you might need to monitor pain medication, etc. So these things are generally not generic. They need to be developed in the context of the disease and the medicines you're looking at. And maybe Andrea can give you some more details of, maybe Andrea, the example from the dermatitis one is maybe a good example to talk to, as we've got some published information on that.
Yeah. So when you develop these quality of life measures, we've been following, FDA and EMA guidelines to develop them the same way you would develop them for human health. And it starts with doing a literature search, defining a conceptual framework. Then you actually get disease experts on. So we worked with dermatologists when we developed the derm quality of life measure. And then you actually interview pet owners that have dogs with allergic and atopic dermatitis. And it's quite a cyclical process, takes quite a lot of time and effort to actually make sure that your tool is sensitive and specific enough to be measuring quality of life, because it's not exactly the same thing as clinical signs. You're really measuring how the clinical signs impact the quality of life, not really how the clinical signs they should trend the same way, but you're really measuring how the animal feels and how that treatment benefit may be affecting them overall.
Thank you, Andrea, for this explanation. I think Josh just asked a question that is going in the same direction or similar direction. Not sure if you can answer this, or if we have a colleague from the FDA here still. The question is the FDA validating or certifying these kind of health apps?
So I'll give you, my understanding right now is that they certainly have some more guidance around the quality of life tools that's available, but that's very much based on human health. And that's what we're looking at, using the same sort of principles as Andrea explained. I'm not sure if they're to the point of certifying the use of these apps in a human health context. Andrea, do you know? I don't know.
Yeah, I know there's a whole medical device field from ISPOR that looks at, and it has to do with data privacy, making sure that the apps come completely. So you can use a quality of life measure on paper, or you could put it in an app. So validating a quality of life measure is very different than validating the data as it moves from an app back into a regulatory context. But there's certainly some guidance on collecting data, because I know in human health, really the easiest way to collect all of this information is everybody has moved to a smartphone. And so if you want accurate, easy information on your medications, whether you're a pet owner or a human, it's easiest to have it in the palm of our hand right now.
Hi, this is Tasha Dugarala from the FDA. Can you hear me?
Yeah.
So I can take that question back to our colleagues at CDRH because we would follow at CVM whatever guidance that they follow in terms of the telemedicine issues. So I'm happy to ask them and get back to the group.
Yeah, thanks, Emil. Yeah, that would be really, really great and much appreciated. I think we have another question. Oh no, we have a raised hand. Mike, you want to ask a question? The floor is yours.
Thank you. My question, you highlighted challenges, but also potential of using sensors and PLS systems for interventional studies. I would have the question, do you see areas or specific aspects or topics which offer possibilities for some quick wins in this area, which could help to pilot the use of these systems in interventional studies?
I'm not sure we're quite there yet, but I think it would be interesting to have that discussion in another forum to think about, are there some examples of quick wins, to have that discussion with CVMP colleagues, potentially in certain areas where there might be some opportunities for quick wins. I think it's something we could think about for the future within Zoetis or within Animal Health Europe, other companies where there may be some things we might like to consider for quick wins to demonstrate proof of principle. But I'm not sure we've quite thought it through enough to the extent that we would be ready to do that. We've certainly, we've looked at using these kind of apps, particularly the dermatology apps, in further outcomes research studies or additional studies we've been doing with some of our products. So we're starting to think about running these kind of things in parallel or, as part of our clinical trials, but we're not yet to the point of fully using them to support primary endpoints. But I think it's something that industry would certainly be interested in exploring with the agency and the CVMP and the regulators around, are there some ways we can, as I say, look at some quick wins to show proof of principle and to start to think through some of these questions we have in terms of these validation questions, whether that be in terms of validation of the data collection or validation of the way you interpret it linked to the quality of life tools.
I can think of a lot of real world examples that might just help veterinary medicine at this point, such as if you could look at a dog that's itching and identify by the biosensor that it's starting to itch earlier, could we potentially treat the condition before we need more antimicrobials? So those are sort of the areas that we've been touching on, the thinking on. Really, we've been focused at this point in how can we improve that communication and the treatment, especially on some of these very chronic conditions that can have flares. Some of these diseases, they don't go away. They're long-term monitoring, and owner compliance in veterinary medicine can be difficult, costly, but can we improve some of the medical outcomes? That's where we've been thinking, at least from an outcomes research standpoint.
Mark, does it answer your question?
Many thanks, yes, but maybe we come back a little bit to the use of the sensors in the livestock and to the use of this PLF systems. Can you see there also some examples? You showed this example with measuring temperature. Can you come back to this also?
So speculating completely, I think yes, to some extent. I think there needs to be a lot more thought around how you can use that data. But you could consider in terms of these kind of precision livestock farming. So this kind of herd software where you're tracking, for example, milk yield, weights, other kind of information that these systems can collect. You could see a way that in the context of running clinical field trials for livestock, that may give you more information about, for example, the benefits of products that may improve health. So you're maybe looking at then you get better weight gain, better milk yields because the animals have less disease incidence, for example. So these kind of things coming together in terms of understanding the disease epidemiology on a farm or within a region, and then that information you get from the precision livestock farming type monitoring, and then linking back to then product use. Yes, if I start to think about how these things connect, I could see a way that you could start to use that, but I think we'd need quite a lot more discussion within industry and with the regulators about how we control that information such that we could use it in a formal regulatory context. I think it's one thing using it in terms of publishing data outcomes assessment and that kind of thing, but it's another thing taking that next steps with it and using it in a more formal regulatory context. But I think that is ultimately where these kind of things will go in the context of livestock farming. Yes, it's about, and I think there were some questions that I've seen coming up as to how that precision livestock farming data collection starts to translate into real usable information that can be used in a veterinary context and then in a regulatory context. So I think that's something that we all need to think about as we start to move through this journey around big data.
Thank you. Thank you to all three of you for this interesting discussion and those standpoints. We have another question from, and I apologize beforehand, Nünke Deckers. And she's asking, in the veterinary domain, there are a lot of conditions where there actually is no gold standard available, and you have to rely, for example, on owner-reported outcomes. How would you validate a biosensor or variable against these non-gold standard endpoints? Because it seems to be more complicated than in human health. What is your opinion about it?
It's always more complicated in the veterinary domain, isn't it? It's a good question, and I think that's one of those things that when we start to think about different diseases, both internally and then talking to the regulators, we need to try and figure out. And it has to be a dialogue and a discussion. And I think to some extent you start a little bit with what Andrea is talking about, is understanding the disease, talking to the disease experts as to what are the important, looking at literature, what are the important things in the context of whatever that target disease or condition is, and then putting together a coherent and a well-founded scientific argument that the regulators would agree to. So I think it's something that you need to work through. You need to consider all the available information and put together something that is credible in a scientific context. But yeah, it's a good question, and I think it's something that you will have to work through with every single thing we look at, where we're not dealing with these traditional gold standard endpoints.
Yeah, in my experience, the patient-reported outcomes trend with the clinical measures, but you're not measuring exactly the same thing. And the best example I was ever given about that was human meds in asthma. Years ago, the clinical trials or the pulmonary function test didn't improve, but the patients had fewer asthma-free days on the inhalant corticosteroids that you get in the little puffers these days. And that began to make a whole lot more sense to me about it shouldn't exactly mimic, but you should be going the same direction. If your pulmonary function tests are looking good, but if you've got fewer asthma-free days, that's really, as a patient, what's most important to you. So when I think about owner-reported outcomes, if you can get the measures as effective as and figure out what that is that's important to the owner, should trend with your clinical signs, but it's not going to be a perfect one-on-one relationship.
And maybe, Sandra, it would be interesting to hear a little bit more, we're talking about that from an industry point of view, to hear a view from either now or later from some of the regulatory colleagues, from some of our CVMP members, for example.
Yeah, actually, I just wanted to give some input on this as well, because this is a topic to my heart. Actually, not from a regulatory point of view, but more from a researcher point of view, because in my past, I had a lot of studies where we faced the question, what is a gold standard? And is a gold standard actually as golden as it seems? Because only when a method of measurement is quite old and well established, it doesn't mean that it really has to build upon reality. And I think yesterday, I'm not sure who said it, is that there was a comparison to intelligent driving. The question is, do we need an intelligent driving that is preventing all accidents, or that's preventing more accidents than when the human is driving? And I think here we have somewhat the same problem. Do we need a sensor that is quite perfect, or do we need a system that's perfect and that's showing really the reality? Or do we need a system that is as good as, or even a bit better than when we are doing it by hand, or then we are monitoring it, for example, by questionnaires and so on? And so on the one hand, the question is, what do we use as a gold standard? And sometimes I think we're a victim of our own devices, because as I said, from my own experience, we try to validate devices that were just better than what was seen by the human observers. So we had bias in our results. We had results that could not be explained because they did not match what the observer was saying. But actually, those values made sense when you were looking at from a different angle, because they were not prone to observer bias. So I think that's a really huge field. It's a huge field also for the regulatory purposes. And what we need there is, I think we need standardization, and we need some rules or some guidelines on data quality, and we need an open mind, I think.
I was going to say the exact same thing, Sandra. I think it's keeping that open mind, because I agree that many of these traditional gold standards now, when we look at them, are maybe not gold standard anymore. The information's moved on, and I think it's going to be useful as we move forward for both industry and the regulators to try and keep an open mind and an open dialogue on this, because some of these things are going to be better than what we've got currently. They may not be perfect, but they're all going to give us better information, and we do need to understand how we can use them and be open to accepting them, even if we start off doing them potentially in parallel to the traditional approaches, until there's a better understanding and a level of comfort with these newer approaches. And linked to that, the whole data management and data standardization that has to go with that.
Yeah, absolutely agree. And I think we also got some agreements from other panelists and from other participants. And I think that's really the major or the key topic we have with efficacy data here. We have, I think, 5 more minutes. So if there are any more questions from the audience, please do not hesitate to type them in the chat and I will ask them, or just raise your hand. And else, I think, Catherine, you have to ask a question from me, because what I'm interested in is your view, considering the use of big data and new technologies, just looking 10 years into the future. where hopefully we have real-world data, we have new analytic solutions, we have new technologies established. What is your prediction concerning the costs and the conduction of studies? Would it be easier? Would it be take longer? Would it be faster to authorize a product and to collect efficacy data? And what about the costs? What do you think?
I asked my clinical colleagues this question and I didn't get a response because I don't think they were quite there yet. I think it may be one of those areas where 10 years is maybe a little bit short on this one. I think it's going to take a little bit longer for everybody to get a level of comfort and understanding with doing it. In the very long term, I could see a situation where in terms of getting, if I give you the example of, say, pet owners and the dermatology kind of field forum where we've got published information, I could see a situation, if I think back to the types of studies we ran for Apoquel and Cytopoint, where we're using these kind of paper-based PVAS tools, so the owner kind of information about how itchy their dog is or their animal is, that collecting that data in terms of an app that the pet owner just downloads, everybody's got a smartphone, that has the potential to reduce some of the costs associated with clinical trials. It has the potential to improve compliance and engagement with that in terms of getting pet owners to do it. You know, somebody's going to be much more comfortable tapping the information into their phone than having to write down on pieces of paper. So I think the potential's there. Whether we get there within 10 years and it has an impact, it depends how this evolves and how quickly we get through some of these discussions about the expectations that go with it, particularly in a GCP context. I think there's a lot of questions that will come that we need to work through as an industry and as competent authorities in terms of the expectations around the GCP aspects of running these trials and using this kind of technology. But I think definitely in the long run, there is a potential to reduce costs of running clinical trials. Whether it make things any faster, I'm not sure. I think we're going to have more data, which might mean it takes us longer to process that data, to work with that data, to understand it. But I think it has the potential to make running clinical trials a little bit easier for the pet owners or the farmers involved, and it certainly has the potential for us to have more information that helps us understand our products better, that then can translate into both a regulatory context in terms of that product benefit risk, and then practically for those other user stakeholders, where there be pet owners, farmers, veterinarians, or other people involved in using these medicines. It doesn't really answer your question, I guess, but it's not one I think we can easily answer right now. But I think we're at that start of that journey, and it has the potential with the new regulation, the regulatory science strategies for that to evolve. And I think what we'd like to see is, once we get to the new regulatory strategy, science strategy for 2025 to 2030, it starts to have much more information around this that we can build on from what we've started in this 5-year period.
Thanks, Amelia. Yeah, and I totally agree that I think it's a stepwise process. So now we are going 2020 to 2025, and I think we are building up on each of those steps, and I just sometimes wish to be some steps more in the future and to see how it's done and how it would be done perfectly and what possibilities we might have. I just wanted to repeat a comment from Richard Clayton. I think it's not a question, but I think it's quite important to mention that this discussion is important. Yes, I totally agree. And also regarding the regulation 2019-6, the new vet regulation, because their efficacy is not only limited to clinical efficacy. And I think that's the first step. I think this new vet regulation might be the first step to offer huge opportunities to use big data, to use these new technologies, and to bring also the regulatory side of to a new to a new age somewhat. And also I want to mention what Hesha brought to us from the FDA. Just to clarify, FDA CVM does not regulate medicinal devices used in animals the way we do for humans. That being said, we work closely with our Center for Device colleagues when questions do come up on devices used in animals. And the last comment I want to mention is from Thomas Heberer. First of all, we have to set our goals, and we also need to build up the infrastructure. So that said, I think we're just in time. It's totally perfect. And to link to this last comment, I think to sum up this presentation is that in the current time of digitalization and automatization, there are large opportunities to use these already available data also for the demonstration of efficacy and safety of veterinary medicinal products. But nevertheless, now what we have to do is we have to address those questions on requirements, on data quality, on standardization, and as just said, to build the infrastructure. And we have to think on the legal and regulatory backgrounds. I think that's for the last words for this presentation, also for this session. I just hope to be able to send you to your lunch break, but I got the information that Ilaria wants to address some organizational points. And from my side, I wish you a nice afternoon and furthermore a fruitful forum. Thanks a million.
Thank you very much, Sandra, and colleagues and all the moderators and the speakers from this session too. It was really an excellent preparation and actually a very, very interesting discussion that we had. We touched upon various aspects, and I'm going to pass this output to the colleagues for the wrap up at the end of the meeting. So just as in terms of logistics, we are now breaking for lunch, and we will resume at 2 o'clock. So I would expect the colleagues to use exactly the same link and the registration ID that was sent this morning. I hope there is not going to be any further hiccup on this regard. And then in the future, in the afternoon, of course, we will look a bit more at the future. We start with session 3 with the visionary principle presented by our stakeholders. And then in session 4, we will come back in Europe with what we are really doing in the context of the HMA-EMA cooperation as regards the European Big Data strategy proposal. So with this, I would like to thank all the participants, the attendees, specifically the colleagues that connected from overseas, Elise Taton, Andrea, Wright, and Esha from FDA. Thank you very much for participating at this very unfortunate time frame and time zone. So thank you very much, and have a nice breakfast for you and lunch for the rest of the world. Resume at 2 o'clock. Thank you.
Good afternoon, everybody. Welcome to session 3 of the Veterinary Big Data Stakeholder Forum. My name is David Murphy. I'm the current CVMP chair, and I will be your moderator for this session. At this point, I would very much like to thank all speakers so far for giving excellent, informative, and indeed enjoyable presentations. You've provided me, and I would suggest all on the regulatory side with much food for thought. What is clear from all presentations is that there's a lot of data or information out there, and data generation will only increase. The question is, how can these data be captured and transformed into reliable evidence that will allow for informed decision-making in the veterinary context and in the regulatory context specifically? For this session, we're very lucky to have 3 distinguished speakers, all data scientists, I would suggest, who, based on their own experience of handling large, complex data sets, will provide us with their perspectives on how these data sets can be used for policy or regulatory decision-making. They will cover the opportunities that these data sets offer and the challenges associated with handling or interpreting them. And they will also address how some of those challenges can be overcome with advanced analytical solutions. But just before handing over to our first speaker, I'd just like to remind participants of some sort of housekeeping elements at the beginning of this particular session. Just to restate again that all presentations will be made available on the agency website at some point in the not too distant future. This event is being recorded, so if this is something that you're not comfortable with, you may wish to leave the event now. The recording of this event will be made available in the coming weeks on YouTube. Just to note that all participants are muted, and with the exception of panelists, you will not be able to engage verbally with the panelists unless unmuted by the host. Each presentation in this session will last approximately 20 to 25 minutes, and they will run one after another without a break. At the end of the third session, we will have a question and answer session. Sorry, at the end of the third presentation. If you have any questions, don't be shy, please ask. Our speakers will only be delighted to address them. In terms of asking questions, you've got two options. One is to put a question in the meeting chat. If you choose that option, please indicate who the question is addressed or directed to. Alternatively, you may use the raised hand icon, which is located in the bottom right corner of the participants pane or panel. If you choose that option and you're called on to ask a question, the host, Katarina, will unmute you. We may not be able to get to answer all questions, but any unanswered questions in the chat will be answered in writing and published to the agency website at a later date. So I hope that that is all clear. Now for the first presentation of this session, I'm delighted to introduce Professor Ciro Cattuto. Professor Cattuto is Associate Professor of Computer Science at the University of Turin and a Principal Researcher at the ISI Foundation. His interests include data science, complex systems, public health, and social impact of data. So, Professor Cattuto, in your own time, please.
Thank you, David, and thanks everybody for having me here. I would like to thank in particular Dr. Del Seppia for very stimulating discussions in preparing this this contribution. I will now share my screen, and I hope you can see it clearly.
Yeah, we can see it.
Okay, so the kind of journey I would like to speak about in this context is the journey that brings us from data to abstractions, to models, and to the decisions and policies that we can make on top of them, and reflect on some high-level challenges and opportunities. I was asked to reflect on the high-level perspective, so I'll focus more on that and much less on my own scientific contribution to these areas. And let me start by reflecting on the data. And this is something that I always like to start with. It's New York City, clearly, but it's made via data that instrument one specific behavior. These are data about taxi pickups in New York City, and the map of the city emerges just out of the sheer volume of this data. So the starting point and what is really new about these data sources is their scale, their pervasiveness, and the fact that they instrument specific behaviors and systems of interest. And to give you another example, these are high-resolution compact network data. This is really part of my own work that are used to inform infectious disease dynamics models. We heard a lot about sensors, and instrumenting mobility and proximity at high resolution is, of course, important for infectious diseases. And in fact, it's being used also in animal settings. This is, for example, a social network of free roaming dogs in Chad as part of a collaboration with the University of Exeter, where we measured the social network of these animals in relation to rabies and other infectious diseases. So But where things get interesting is the secondary use of data. When we speak about big data, very rarely we speak about data collecting according to a standard scientific journey where we decide what type of data we want to collect beforehand. In many cases, this is data used post hoc for another purpose. And this is a great example from some colleagues, in particular Professor Rossano Schifanella, where they used purchase data, basket data from a large food retailer in London to study who buys what type of food, where and when, and to understand nutrition at a very fine temporal and spatial resolution, and put this into perspective with outcomes related to diabetes and obesity. And then we can push this forward, and there are implicit data sources that only laterally speak of other phenomena. Influenza was already mentioned in session 2. This is one of the most striking examples to me. This is work by Professor John Brownstein at Boston Children's Hospital, very early work back in 2014, where basically they showed that click rates on pages of Wikipedia related to flu symptoms and medications can actually be fed to a machine learning model that predicts the ground truth of flu incidence in the US in a very timely fashion and with very strong agreement with what we consider the ground truth. No? So in a sense, and this is my main point here, when we speak about big data, we are usually not speaking about data originally collected for scientific purposes. It is mostly about digital traces of behaviors, digital traces from new devices, from new systems, from existing systems instrumented with digital means. And because of this, they come with several limitations. They have a temporal horizon, there is limited reproducibility, because these are not designed to be experiments. There is limited context. In many cases, when dealing with humans, there are many data protection challenges. And in this respect, the veterinary domain is actually uniquely positioned to experiment the value without having to deal with the deep and tricky data protection challenges that you have in human settings. And so I think this community is uniquely positioned to deliver on the promises and then possibly fostering more transformation also, through the feedback of these successes in the human domain. The advantage of these data sources, however, is that they are there. They are available as a side effect of many services and devices, which are increasingly digital. They are born machine processable, and today we've become pretty good with computers, and so we can use data mining, machine learning, data visualization, a host of techniques, old and new, to extract signals, discover patterns, make hypotheses, and look at system as a whole. So the One Health perspective is uniquely powered by this type of data sources. But data do not speak by themselves. They only speak through models, through abstractions. And just like, today we give for granted weather predictions that are reliable. Think for a moment what that entailed. That entailed basically instrumenting the planet with sensors, with satellites, with environmental monitoring stations, and understanding the physics of the atmosphere and feeding all of these into a supercomputer that then can give us a trajectory and forecast with associated uncertainties about the evolution of the system. So in a sense, this is the ambition of what we can do for health going forward. And in fact, in some domains, like we are aware these days, in the domain of epidemic forecast, we have made strides, and data have actually completely changed the landscape of what we thought was possible. This is just one slide for a collaboration at Northeastern University, where basically planetary data on the mobility of humans on the entire planet, airline mobility, commuting, high-resolution population density maps from satellites, they get all fused into a mathematical model that then allows us to explore scenarios. And these type of techniques are in use right now to fend off the COVID crisis. Now, when we come to big data, however, in many cases, the type of models that we deal with are not the mechanistic models such as this or such as this. They tend to be models where we where we have black boxes basically trained by showing them examples. And so this is my favorite metaphor for this. Basically, you see here you have this person. Is this your machine learning system? And the answer is yes. You just pour the data into this big pile of mathematical equations and then collect the answer on the other side. And if they're wrong, you just shake the pile until the answers look better. So in a sense, this is what we do with machine learning. We really don't know much about how things work in the black box. So we just train the black box to reproduce whatever patterns are in the data. And I realize that this is an oversimplification, but it's not very far from the reality of many applications. And so in a sense, what we are building are decision-making black boxes where we have to be extremely careful about the quality of data in the input. Already some colleagues eloquently highlighted limitations of big data, biases, agreement or lack thereof with ground truth. There is a problem, and this is very much recognized in the research community, of explainability of what the black box does, especially when we take sensitive decisions with the output of this black box. Can we guarantee that this black box behaves in a fair way? Can we guarantee that we understand why some decisions are taken? And then there is the challenge of integrating algorithmic decision-making machines with the rest of our systems, which more often than not are made of, old-fashioned paper and pencil and humans making decisions, and for very good reasons. And so the challenge is, in a sense, to integrate this type of new capabilities into old decision-making systems and to evolve hybrid decision-making and policy-making machinery. When this works, this can change the bar significantly. This is just one of the many examples that we could discuss, but certainly machine learning and deep learning in particular are revolutionizing how do image-based diagnostics. And they're doing this by piggybacking human intelligence. So this is the NIH data set on chest X-ray diagnosis, and the input is really the wisdom and the experience of medical doctors, their diagnosis, their annotations associated to images, and fed to a deep learning system. Basically, they yield a diagnostic system that can outperform most physicians in this task. But it's remarkable, and it's important to understand that this is built on top of human intelligence. This is not meant and cannot replace it. We have to figure out new ways of combining these capabilities. So when we speak about algorithmic decision making, we have huge opportunities. This is just one example in the agricultural domain. This is a system called Plant Village, which provides algorithmic agricultural advice, whereby basically inputting into the system your location and the type of crop that you're tending to, you can get personalized advice on how to optimize yield, how to tackle diseases for the plants and the animals in your area, and so on and so forth. And this is just one system, which is exemplary, I find, of systems we will need to face the adaptations and the changes due to climate change and other challenges. At the same time, there are huge challenges integrating these systems into our society and decision-making systems. This is just one example, for example, of the factors influencing obesity in humans. So this is a diagram created by the NHS, where they made the exercise of mapping all of the factors that have direct or indirect relevance to obesity. And as you see, there are many feedback loops, and there is no single node that you believe, by looking at the picture, you can intervene on to solve obesity, right? So in a sense, by integrating algorithmic decision-making systems into this kind of systems, we are increasing the complexity of what's out there. We are adding more feedback loops, and we are making the system less transparent to ourselves. So there is a big problem of understanding and governing this complexity fully. So to wrap up the introduction, what is new here? What is new really is that our digital image of the world is now tracking the reality of many of our systems more and more closely, in time, in space, in resolution of individual behaviors. And And basically, we have new data streams that provide multimodal, real-time, system-level window on many processes. And as we will see in the next few talks, this applies to the veterinary domain in increasing and super interesting ways. There's fundamental advances in how we can use computation and machine learning to uncover patterns, to uncover facts, make hypotheses from this vast sea of data. And given the large volume of the data, we can use this type of data sources to train mathematical models, machine learning models with a large number of parameters. Models of a complexity that was unprecedented before now. And they come also with challenges because their models so complex that they're difficult to understand in how they take decisions, even though their decisions are arguably correct and can be validated. And then there is the final challenge of integrating and placing all of these models and capabilities in the loop of existing systems, which is really a systems integration challenge, which is definitely more about people and much less about technology. Now, what is new in particular for a regulator? For a regulator, this shifts the landscape in a couple of interesting ways. The first one is that complex mathematical models in the loop of products and services are driving new needs for the regulator. We will need to audit in new ways these systems. How can a regulator audit a machine learning based system? What does it even mean to audit and detect potential biases and unfairness in machine learning powered systems? And this is a problem that in the machine learning community is very much recognized. And it's giving rise to an entire line of inquiry. How can we ensure that automated decision-making systems are transparent? We understand why they do what they do. They are fair. They don't discriminate specific communities or individuals. And they're accountable, especially when there are high stakes associated to their use. And then the other thing is that integrating these models into the loop of our societal system and health systems forces us to a system-wide perspective. We are naturally drawn to a One Health perspective because we need to think about the externalities. We need to think about the unintended consequences of using these systems. And all of these are new challenges, in a sense, for a regulator. And if they're not new in the spirit, they're new in the technical means that you will need to implement and in the technical capabilities that will be needed to achieve these regulatory capabilities. And then there is the other major challenge coming from the novel nature of many of the data sources that we are speaking about. And it's important to remark that there will be, and was already done in the previous sessions, there will be new type of real-world data streams coming from digital therapeutics, coming from apps. And we will need to learn to use this data for the regulatory process. And this is a challenge, of course. But there is also the larger challenge that we'll touch upon a little bit on data that are potentially useful for a regulator, but are not generated neither by the regulator nor by the regulated subjects. And so in many cases, we're speaking about privately held data, corporate data. And then the questions become, how can we ensure that a regulator can access this data? And this becomes very easily data governance and data access problems, which will require probably new policies. And the European Commission, as you know, is working on this, as well as probably new type of institutions, new type of trusted data intermediaries. And this is a challenge also for regulators right now. Can a regulator be itself in some domains a trusted data intermediary and provide this type of data brokering capability under the umbrella of trust that characterizes the mission of the regulator. So the key ideas here are simple, and they're just three actually. One is that when we speak about artificial intelligence and machine learning, data are as important as the algorithms and computational platforms. A lot of what is touted today as artificial intelligence has got nothing intelligent behind it, and the value is actually in the data. And so control of the data is really what creates the capabilities, and the data skills are the skills we need in the entire ecosystem so that we can deal with the challenges and materialize the opportunities. The second idea is that when we speak about big data, more often than not, we are speaking about secondary use of data that was originally collected for another purpose. And this poses a number of technical challenges and even stronger governance challenges. How can we access data that was not originally supposed to be used by me? What kind of limitations do those data have? How can I responsibly use it? And what type of reciprocity I can set up so that I can access this data and my stakeholders can benefit from this? And the third point, as mentioned, is that data and AI are not living in a vacuum. They plug into systems that are already complex, and we need to be more sophisticated to think about the externalities and the unintended consequences that we are creating. So, by and large, I would say that this is a governance challenge. Generating value from big data paradoxically has got very little to do, in my opinion, with data and computation, and a lot to do with people infrastructure, with generating the right type of agreements, institutions, and conversations across the different stakeholders. And in this respect, I find it very insightful that the title of this meeting is a Stakeholders Forum, because this is exactly the type of discussions that we need to be having so that we can, in a sense, govern the digital transformation so that it generates the best outcomes for all. And when we speak about this governance problem, there are basically three types of stakeholders. There is normally a problem owner, a public agency, a regulator, a non-profit, increasingly municipalities. There are data owners, and as I mentioned, these are often third parties with a business mission, not necessarily big tech, maybe a startup running an app, maybe a digital therapeutics company. We will see more and more of these stakeholders, but more often than not, they will be private. And then there is the data expertise, which today lies in research, in academia, increasingly, I would say right now, at the highest level in big tech, creating other challenging devices. So the challenge is really, how can we make sure that we create an environment where both in terms of regulation and in terms of incentives, we favor the creation of this type of conversations. And of course, the European Commission has been thinking extensively about this. This is a 2017 workshop, one of the first, I believe, that was created, focusing squarely on access for public bodies to privately held data of public interest. So already pointing to the central problem of generating value from data. And then in 2013, the Commission appointed an expert group on business to government data sharing, again putting the emphasis on the fact that interesting data sources for the public sector lies in private hands, and we need to respect the legitimate business needs of these actors while leveraging the public value of the data that they materialize and collect. And this working group created a very interesting report on business to government data sharing that I invite any of you who's interested to read. Down here you have the reference. The report provides many recommendations, but the central ones are basically that all member states should start thinking about a governance structure that can oversee and steer the process of using big data for public interest. And that this is mostly a people challenge. And so we need probably new roles across all of the stakeholders. And there is this idea that most of the stakeholders should create a new type of role, a data steward, somebody who's tasked with reasoning about the external value of the data provided by a stakeholder, and in a sense, the go-to person to speak about data collaboration. And I think it's crucial to build this people infrastructure so that we can, in a sense, make sure that we have a way of governing the digital transformation, also from the point of view of regulator and the public sector in general. And then, of course, the group foresees a regulatory framework to facilitate and create reciprocities for public sector use of privately held data, as well as more scientific research that can show that there is value. It's hard to overestimate the importance of pilot studies and research in showing that new value is there, that this data can be used, can complement existing systems, can probably outperform existing systems. And then once you have that knowledge, you can start with that type of strength and confidence to transition the entire ecosystem towards these new models. And then, as you know, this discussion escalated very, very quickly at the highest level, and there is right now on the table a proposal for a European data governance, the Data Governance Act, where ideas of data altruism, new forms of reciprocity, data collaboration are central. And this puts really the emphasis on the fact that we are speaking about an ecosystem level transformation. This is not about technology, and this is not about computer scientists. This is really about very different communities coming together with the new language of data and the new public value of data that we still need to define and deploy. And then, as you know, very recently it was proposed regulation for harmonized rules across the EU on the use of artificial intelligence. And I think that these two frameworks will resonate in their impact to all sectors and anticipate very strongly on the veterinary one in particular. So these are just my general comments, and I think I can stop here. Hopefully I was on time. So I thank you for your attention and for having me here.
Okay, and thank you very much, Professor Cattuto, for a very interesting and thought-provoking presentation. Thank you very much for that. And you at one time provide a lot of information in terms of, you know, the power of these data, that the data are there to be harnessed, but highlighting some of the very sort of fundamental issues in terms of challenges, and primarily in relation to governance, as you say, and also in relation to you know, the use of AI to generate sort of decisions, and the challenge that there is associated with that in terms of sort of, you know, explaining that decision-making process. So thank you very much for that. I'm sure that our participants will have many questions in relation to what you have presented. So at this point, I would like to thank you for now, and I'm sure that there will be questions that will come in that will be directed to you in the Q&A session. So thank you very much, Dr. Cattuto. We will now move on to the second presentation of this session. And for this presentation, we are going to hear from Dr. Claudia Kamphuis. Dr. Kamphuis is a researcher at the Wageningen University. She has a background in preventative animal health and welfare, but she's moved into the data science area, and currently is the project leader for several big data projects at the university. So, Dr. Kamphuis, I shall hand over to you, please.
Thank you, David. Thank you for the nice introduction. So I hope it works, and that you now see the first slide of the presentation.
Yes, we've got your presentation on the screen. You can continue, please.
Thank you for the invitation, and thank you for the very nice introduction. It's an honor to be here and to give this presentation that I made together with Annemarie Rebel, and it's entitled Next Level Animal Sciences, Big Data in the Livestock Domain. Well, before I head to the core of my presentation, I would like to briefly introduce myself. My name is Claudia Kamphuis. I'm a happily married mom of 2. And in my spare time, I like to ride my motorbike, do long distance tramping, and listen or watch true crime podcasts. But I'm also an animal scientist from Wageningen, and I finished a PhD at Utrecht University. And I work at Wageningen Livestock Research since 2016. During today's presentation, I will start with a brief introduction of big data, the associated challenges, and how we at Wageningen Livestock Research try to tackle these challenges. And after this brief introduction, I will discuss 4 big data projects. None of them will have a strong veterinary focus, but I hope that each of them will inspire you to think about what big data can do for your field of expertise. So, what is big data? Well, without being too negative about it, I think we're living in a world that suffers from kind of like data diarrhea, also in the livestock domain. Automation and sensor technologies do enter our domain, and each of them are producing data very often at a very high frequency and at a continuous basis, and therefore in very large quantities. Well, because our domain is becoming increasingly tech-savvy, we have to deal with large volumes of data of different variety, like images or videos, sound, or old-fashioned structured data, with a very high velocity, which is the speed in which the data are generated or the speed in which they have to be processed. So volume, variety, velocity, there we have them, the infamous 3 Vs. And these are often referred to as defining big data, but I see them more as challenges of big data, and we need to tackle these challenges before we can do big data. And at Wageningen, we try to tackle these challenges by connecting our core business, our domain knowledge, with developments, methodologies, and techniques that are used within IT and data science, so that we can store, process, and analyze these increasing volumes and variety of data that we cannot store locally or analyze with methods that we are trained in. And if we can do that, make that connection, I think that we can start doing things that we could not do previously. The 4 projects that I'm going to discuss are all big data projects. The first one is perhaps a little bit different because that's the only one in this list that highlights the challenges that we first have to tackle within our domain before we can start to think about connecting with IT and data science. And it highlights some of the challenges not directly associated with the 3 Vs, but more of the data governance that was also highlighted in the previous presentation. The other 3 projects are examples where IT and data science are much more linked with our domain. So the first project, it's about the Dutch broiler chain, which is maybe a little bit different from other countries. In the Netherlands, the broiler chain involves different stages, from the broiler breeder to the meat processor, and with the hatchery and the broiler farm in between. And businesses at each stage have their own more or less fixed characteristics, like the number of houses or the number of birds per house. But they also collect specific information, like egg production, hatchability, mortality, and carcass condemnation. Excuse me. The data that are collected at each of these stages in the chain can differ between the businesses, and there's no uniformity in the data collection. And moreover, the data that are collected at the different stages, they are shared very limited, and certainly not with all the other stages throughout the entire chain. So if we would have a system where there is a uniform data collection at each stage, and where data are routinely combined throughout the entire chain, we may have gold in our hands because that could help us to determine, for example, systemic effects of one part of the chain on performances and health at another point of the chain. And with that knowledge, we might improve the chain performance as a whole. But to do that, we have to go from the current situation with limited sharing of data to this situation. Now, Ingrid de Jong, a direct colleague of mine, has been involved in such a project where they aimed at identifying the existence of systemic effects, repeatable effects of the broiler breeder flock or farm on the production and health performance of the broiler farmer flock, based on data throughout the chain. And in this project, they focused on a fast-growing broiler breed, and they had data available for 6 years. That data originated from the partners within the project, and that involved 2 nutrition companies, 1 breeding company, 2 hatcheries, 74 broiler farms, and 1 processing plant. Now, this all seems quite straightforward, but having all these parties throughout the entire chain together in one room, working on one project that aims at sharing data is very unique, and it involved a lot of communication and building trust. And that made that this project had a very good starting point. The partners that were involved already collaborated, and they were very much eager and willing to share the data. Also, each of the partners owned the data, and that makes sharing easier. And the data were digitalized, and which is not always the case in the broiler chain. But there were also challenges in this project. And first of all, the existing databases collected at each stage, they are not made to combine them. Different formats, different variable names, different definitions of variable names, that made it extremely difficult and a tedious manual process to combine the data properly. Data quality was questionable at times and always challenging, and there's still a lot of manual recording done, which is not verified on a routinely and objective way. There was a substantial manual effort needed to solve impossible data. And although it was evident that additional data would help to identify and clarify the variation that was seen in the data, this additional data was very much, it was not a lot available, and there was no real energy from the partners in start doing so, at least not manual. Although many of the challenges were solved for this specific study through communication, domain knowledge, and a clear vision from all the partners of the potential of sharing the data, the entire procedure will have to start again if a new project would start. And the biggest challenge that we have to overcome in future projects that involve data sharing throughout the entire chain is the fear of claims that individual businesses have if data are shared, the so-called prisoner's dilemma. Well, of course, I don't want to skip the main result of the study, and after a lot of manual effort to combine data and solve data quality issues, the main result of this research was that it did not reveal any systemic or repeatable effects of the breeder farm on the performance and health indicators of the progeny. Also, there were only small systemic effects of the breeder flock on the performance and health indicators of the progeny on rejection percentage and uniformity percentage, which are 2 indicators assessed by the processing plant, but they say something about the broiler flock. Although not assessed in the current study, it could be that either the following stages of the chain had very large effects, overruling the breeder farm or breeder flock effect, or the effects were relatively short-lasting. And I think it would be extremely interesting to see what data science and IT can do in providing insight in this question, if the fear for claims is overwon and if automation and sensor technologies are more common. Well, if you want to know more about this specific project, you can read the paper or you can contact Ingrid de Jong directly. The second project I would like to highlight is a project that aims at developing an automated disease scoring tool based on images. Why? Well, images are very easy to acquire, and an automated system would allow for 24/7 scoring. And this could then be used as an early warning system in both a research setting as well as on commercial farms, so it has a wide applicability. This project is about automating a face-based disease scoring system, and that was developed by students from HAS. They selected 7 facial features from the literature that could be linked to disease, and these are the features that are shown on your screen right now. And these facial features were weighted and combined into one trait, into one single final disease score. And the potential score could range between 0, completely healthy, and 32 points, where 32 points would mean that an animal would receive the maximum of points for each of the 7 features. And I don't think that we would like to see such an animal in practice ever. In the next step, the scoring system was applied manually during a foot and mouth disease vaccination trial at Wageningen Bioveterinary Research. And at this trial, 17 cows received different doses of a vaccine for foot and mouth disease, and they were followed in time. And during the trial, images were collected on a daily basis, and a scoring protocol was used to assess scores for each of the 7 facial features for each image. And as you can see here, drool and nasal discharge received the highest scores, and the highest score was also seen on day 3 post-infection. These individual scores were then combined into that single final disease score. And as you can see here, before the animals were infected with foot and mouth disease, the average final disease score was low to an average. And there's a clear increase in final disease score as time passes. The highest score given on day 3, on average 11. And now it becomes interesting. The next step was automation of the scoring protocol, where we used the images with the annotated scores as training material. And this automation was done by students of Hazavans as part of their minor, and it involves a proof of principle with a focus on the automation, not on developing a perfect scoring model. But these students selected 4 features that are most prevalent for infectious diseases, and that were ear position, ocular discharge, nasal discharge, and drool. And they used Microsoft Custom Vision to train a model with this annotated data, and developed an API to upload images, run the model, and have a final disease score per image, all automatically, all in the cloud. And my wish was to demonstrate you this by using the link that you see here, but unfortunately, they are currently in the process of transferring the tool from Has to Ver, and I just didn't want to take the risk that there were issues when I wanted to demonstrate the tool. So I just used some screenshots here. So what I did is I searched for a picture of a cow on the internet, which I thought looked pretty healthy to me, and I'm not a veterinarian, but I hope you can agree with me that this cow here looks pretty okay. And then I went to the link provided here. It's a very intuitive tool that asks you to upload an image by clicking the button. So I did. I uploaded the picture, and after a few seconds, I was provided the output, and the model identified the 4 prevalent facial characteristics. And it also shows you the score, the predicted score of the final disease, which is 3 with quite a high certainty. And that seems pretty okay to me. And I really enjoyed this project because it's such a nice combination of domain knowledge with a deep learning model to assess the disease scoring based on images, and IT to develop a pipeline to do this all automatically and in the cloud. Well, if you want to know more about this project, you can contact Ronnie. The third project I want to show you is a project where domain knowledge and data science are combined. And it's a study where we wanted to combine multiple data streams readily collected on commercial dairy farms to predict a very complex trait called resilience. And for resilience, we used the same definition as reported by Andrea and colleagues, referring to cows that have multiple lactations, a good reproductive performance, no or very few health problems that are overcome easily, and that are efficient and consistent in milk production. Now, Adriaan's captured this resilience definition in a lifetime resilience scoring system, and that was a point system that summed scores for the number of lactations, the age at first calving or the calving interval, the number of inseminations, the number of curative treatment days, and when the cow was killed in lactation. And we applied this score on 1,800 cows that finished their productive lives from Wageningen Research Farm. And the average lifetime resilience score was 1,518 points, but it varied largely. The least resilient cow received 31 points, whereas the most resilient cow had more than 6,000 points. Now, we ranked these animals according to the lifetime resilience score and divided them into 3 evenly distributed groups: the high, the middle, and the low group. And in the second step, we only selected those cows that had also data from 4 sensors available in their first lactation. And this resulted in 370 cows with a lifetime resilience score and sensor data that were included for further analysis. The 4 sensors that we had available were sensors recording activity, rumination activity, live weight, and milk yield. And with the sensor data that were collected during the first lactation, we wanted to predict the lifetime resilience score, so a prediction on a long-term basis. But to do that, well, we had to compute potentially predictive variables based on the sensor data patterns. And therefore, we first aggregated the sensor data to daily values for each sensor and plotted these through time. And in this picture, or in this graph, you see the dark blue line for milk production. And then for each sensor, for each cow, the absolute daily values were made relative to the herd average for that same sensor, creating the red curve in the plot. And a linear regression line was fitted, the light blue curve, through this herd average. Now, the red curve was used to compute the mean, the minimum, the maximum, some percentiles, the standard deviation, the skewness, the kurtosis, and the autocorrelation. And the light blue line was used to compute the slope, the intercept, and the residual standard deviation. And we also computed the correlation between the relative curve values and the fitted curve values. And this intensive manual pre-processing resulted in a total of 56 predictive variables based on sensor data. We also kept the daily values and the daily lactation average as variables, and that counted up to over 1,200 variables. And we then used 2 different modeling techniques. We used an ordinal logistic regression that used the 56 computed features, and we applied a stepwise selection to come to the final model. And that included 6 sensor features. And the second technique was a random forest, which is a machine learning approach. And we developed 3 different ones. The first random forest was offered the exact same 6 features that were selected by the ordinal logistic regression for a one-on-one comparison. The second random forest was offered all the 56 features to investigate whether, including some of them that were insignificant by the logistic regression, to see whether they have still predictive value for the random forest. And the third random forest was only offered daily values, so data that had the least pre-processing to investigate whether the efforts for pre-processing could be reduced while maintaining predictive ability. And all the models here were developed with a 10-fold cross-validation approach. The performance of each of these 4 models was evaluated by computing the accuracy, which summarizes the correctly classified animals across the 3 categories, highlighted green. And we also computed the critically missed cows, so cows that were misclassified in opposing categories, highlighted red in this table. With the 6 features from the stepwise selection, the logistic regression had an accuracy of 45% and a proportion of critically missed cows of 10.8%. And you can also see that the random forests, independent which one, performed very similar. And in fact, none of the models performed significantly different from each other with respect to the accuracy. But the random forest that only used daily values, so with very little data pre-processing, that had significantly lower critically missed cows compared to the ordinal logistic regression. And that was also the model that required the least amount of data pre-processing. And I think this project highlights very nicely how machine learning methodology can help us in analyzing large volumes of data, where less pre-processing is required to get very similar results compared to on the more standard or used method of logistic regression. And it can demonstrate the potential benefit of using a data-driven machine learning approach in case a good prediction is desired. We submitted this work also to a scientific journal, and it's currently under review. The last project is an example where domain knowledge is connected with IT and data science. And it started for me with a dream where we wanted to develop a flexible data architecture to collect methane data at cow individual level near real time. And with flexible, I refer to an architecture that's scalable to many farms. So it should be cheap and independent of Wi-Fi. That it can also be enriched with other data, and that allows for a data quality check as soon as data comes in. And in 2018, we developed the basic architecture. We connected a methane sensor, which is a sniffer that was located within the milking robot. And we connected that one to an Arduino. And the Arduino was programmed to push very small packages of raw sniffer data every 3 minutes to a secured Microsoft Azure cloud platform. And in that platform, the raw sensor data were processed into methane concentrations, and a quality check was performed. So if there were packages that did not contain any data or outside an expected range, the researcher received an email directly that something went wrong. Now, this basic concept is now running on 15 farms, and it will be extended to 100 Dutch dairy farms in 2021. The architecture was developed further by connecting to external data sources, and we made an API with Akkerweb, and that enabled us to get access to the weather information on a very, very fine grid. And this weather information was combined with methane measurements, visualized in a web-based application. So farmers can view their methane and weather information in near real time by logging on onto a web page, and they only see their own data. And last year we focused on another enrichment, whereas we do have methane data at cow level using the sniffers, that technology does not register which cow it's monitoring. So we were dependent on farmers to provide us details of milkings to combine cow identification with the methane information. And we wondered if we could do that ourselves and also get cow identification in real time into the Microsoft Azure platform. So we are now working on extending the data architecture with cow identification, and we installed a camera that's connected to a Raspberry Pi. That Raspberry Pi is programmed with a deep learning algorithm that reads ear tags, and once a number is identified, the number is pushed together with the sniffer data to our methane data lake. So let me show you, and I hope it works. Here the cow enters the milking robot. The algorithm identifies the ear tag by a yellow blob detection. That's in the left top corner, and then it transfers the ear tag horizontally, and we apply transfer learning, and that algorithm is reading the ear tag number. Once it reads the 4 numbers, that number is pushed to the platform. And we're very eager to develop this further. We are now rolling it out on the dairy campus. And I think this is a very nice project that strongly indicated the potential when we combine IT and data science into our domain to allow new research initiatives in ways that we could not do before. And that brings me to the last slide, where I would also like to thank Annemarie, Ingrid and Ronald to share their work and to allow me to present some of it. I would also like to acknowledge the funding body. It's the knowledge base, data-driven and high-tech. If you want to know more, please feel free and flick me an email and I can see what I can do for you. thank you for listening and enjoy the rest of the day.
Thank you very much, Dr. Kamphuis, for a very clear and informative presentation. It is interesting, very interesting. It just to see the power of big data and how machine learning can help to make sense out of that. So again, I'm sure that our participants will have questions in relation to what you presented. So I would invite them now to put those into the chat, and we can look to pick those up in the Q&A session after our final presentation. So thank you again, Dr. Kamphuis.
You're welcome. Thank you.
Okay, we will now move on to the final presentation of this session. For this presentation, it will be given by Ermanno Cavalli, who currently holds the position of Senior Data Scientist in the Assessment and Methodological Support Unit in EFSA. He is currently leading a project aimed at joining forces across European Union agencies in deploying of artificial intelligence. So without further delay, Dr. Cavalli, I shall hand over to you, please.
Yes, thank you very much. And thank you very much for inviting me here today. I have shared my screen. I hope you can see it in a while. I'm holding the position of Senior Data Scientist in EFSA today in the Assessment and Methodological Support Unit. By education, I am a computer engineer. I joined EFSA, European Food Safety Authority, 14 years ago. Before that period, I have an experience of 21 years in information technology in the industry. And I want to tell you that it is a big pleasure to work in EFSA because there is a big gap between computers, information technology, artificial intelligence, and life scientists. So it is really a big pleasure to be able to work in this environment. I will tell you today about the efforts we are currently conducting in the automation of one of our critical scientific processes, that is systematic review, systematic literature review. The first slides are an introduction to the problem. We all know we live in the information age, so we know that the number of papers, scientific papers, which are the essential data of the systematic review process, you know that the number of these papers is increasing dramatically every day. This slide is not even so dramatic. It is from the National Science Board and shows how much the number of science and engineering papers are increasing every day. We all know that not the quality is increasing, the quantity is increasing, but as we are a regulatory agency, we have to make sure that all the relevant scientific information is included in each of our scientific opinions. So I will go on with 3 other slides from the Cochrane organization. So, for example, this is already from some years ago, but we are in a situation where we have cases like 75 trials and 11 systematic reviews appearing every day. Who is ever going to read all those scientific papers, and how will we ever keep up with this situation as a regulatory agency? And another aspect of the problem is that it takes time typically to close a systematic review. This is again a graph from Cochrane organization, and you see that it can take up until 24 months from the initial search for a systematic review to when the systematic review is published. We have had cases in the European Safety Authority recently where it has taken us for a year to publish our new scientific opinion on added sugars. So what happens in this time frame, and is the result of the systematic review still relevant when we publish it or not? Because there are areas, there are scientific domains where the information changes very quickly and new scientific papers are published very quickly. And just to close this introductory part, this is another paper from Cochrane where they have wondered how many systematic reviews are still relevant when they are published, and you see that after 2 years, only 75% of them are still relevant. So many systematic reviews are not relevant anymore when they are published, no? And they are very expensive also. So how can we tackle this problem that for a regulatory agency is of paramount importance? So that is why we have started working on applying AI to automate the area of systematic reviews. This is a simplified version of the process of systematic reviews, systematic literature reviews, as defined by the Cochrane organization and also as implemented by EFSA. So we have started working essentially in 3 areas, and my presentation today is organized around 3 areas. First of all, we are working on an open. Okay, so the presentation is organized around 3 areas. The first one is about defining an open file format, which is able to, the first area is about the definition of an open file format, which is able to exchange information throughout all the areas of the systematic reviews. The second one is about an AI tool for the abstract screening phase at the very beginning of the systematic review. And we have evidences that we are able to replace 1 out of the 2 human experts that are currently involved in this phase, or conversely, we can save 50% of the efforts of our experts. And another area where we are working is the so-called data extraction, because the papers that are selected for inclusion in the systematic reviews are in the form of, in the narrative form. So we need to be able to extract all the data there. And we are working on a tool that is able to extract the relevant data from this paper using a name identity recognition technique, and we are working on that together with US environmental protection agencies. But before you are able to extract entities, you need to know which entities you need to extract. So we are building an EFSA ontology for food and feed safety, deriving all the historical data from our 18 years of systematic review in this tool, which is called Distiller SR. So my presentation today is organized around these 3 areas. I'll start with abstract screening. We are at the very beginning of a systematic reviews. We have decided which papers we want to include there. Usually we have some tens of thousands of papers there, and typically there are 5 experts in a working group. So we have to reduce them to the ones who are really relevant, something like some hundreds of them. And the first phase is to do that only reading title and abstract, so that you do not buy some tens of thousands of paper, but you buy only the relevant ones. So this is a typical situation we have found in our history, in our tool, in our historical evaluations done so far. The process is that there are 2 experts, 2 independent scientific experts, reading title and abstract, and deciding which papers have to be included and which have not to be included. And this is a typical situation. We find that there is only 70% of agreement. I've done this presentation some months ago to the EFSA Scientific Committee, and this is a controversial slide. I want to use this as a baseline to measure how our AI algorithms are working. Some of the influential members of the scientific committee said, yes, but this is the situation we want, because we want to preserve different scientific points of view. So I report this for honesty and clarity. But this is a typical situation we find in our history. And the methodology specifies that when there is a disagreement, the paper has to be included. So we want to stay on the safe side. So we have taken our AI tool and have asked the tool to perform the screening. And this is the comparison of the results between human experts and our AI tool. These are the numbers we have for sensitivity and specificity, which are already very good because our baseline was 70%. So we have wondered, first of all, the tool has included more papers than the human reviewers. That is fine. We want to stay on the safe side. So there is not so much information lost. But on the other side, we wondered what's happening here, because the tool has decided to exclude 4 papers that were originally included in the systematic review by the scientific experts. So we said, what's going on here? And is this a problem? So we have gone to check the 4 papers compared with what the human reviewers had done. And we had come to this conclusion that 3 papers would have anyway been excluded in the next step, that is article evaluation. 1 paper has been kept until the end of the reviews, but it was about subcutaneous administration, which is not in the regulatory domain of European Food Safety Authority, which is only dietary administration. So maybe this should make us think that most likely the human experts in this case, it is not even clear why they did this choice. No, so AI somehow has done something better than what they were doing, and this has been a great satisfaction for us. Let me stop for a while here. For me and my colleagues, we have seen that AI can be safely used in this context. It can save us 1 human reviewer, use only 1 scientific expert human reviewer rather than 2. And this has happened in Parma. This is not science fiction. It has not happened in the Silicon Valley, but it is a very good example of what AI can do in our reality. And this is becoming reality. In EFSA, we are having many scientific opinions where we are using this tool. It is declared in the scientific opinion that the abstract screening phase has been performed with this tool. Now, this scientific opinion works very well, qualified presumption of safety, in this case of yeasts, because it is a scientific opinion we republish every 4 years and we update it every 6 months. So we can use all the evaluations done in the past as training database. So we have a very good training database for this opinion, and we continue to improve the knowledge. We are also going to use it now for another set of scientific opinions from our Nutri panel. They have a very tight deadline, 2 years, to reevaluate 8 scientific opinions on micronutrients, mostly vitamins. So they are going to use again this tool, and they will declare it on the scientific opinion. This is a kind of scientific opinion, as I told you, that it works very well for the application of AI because are scientific opinions that we regularly update. But what happens when it is a brand new scientific opinion in a scientific domain that we have never worked before? So we do not have a training database. So in this case, we use a process called active learning. We start from a database, a list of papers, and we don't know which have to be included and which have to be excluded. We have one of our scientific experts, human reviewer. We start doing the job on a subset of the papers and decides which are to be included and which are to be excluded. We fed them into the AI tool. The AI tool does an evaluation on the whole database, and then the human reviewer can correct what the human expert is doing. So we call this process active learning, and the human reviewer has to evaluate only a subset of the full database, and then AI can continue independently. This works only also on a brand new scientific domain, a brand new opinion. And we have done some measurements, because the question is when the human reviewer can stop evaluating papers. We have done, again, this is an example from our history, the isoflavone scientific opinion in EFSA, which has been a very controversial opinion, where on a whole subset of 7,800 papers, only 105 were kept as relevant. And we have done some simulations, and we have seen that the AI tool, when the AI tool, the human reviewer has done an evaluation of half of the papers, 4,000 out of 8,000,
the AI tool is already able to identify 100 out of 105 that are relevant. So this is again why we claim that this AI tool is able to save 50% of the effort to our scientific experts, either by replacing one of the two experts or having only one expert that is doing the evaluation for only 50% of the whole papers. So that's why we claim we are already saving in this specific area 50% of the work to our experts. And we have 2,500 scientific experts. You can think how much of a saving is that, and consider that time is the most precious resource for scientific experts. So this is a very promising area, and this tool is already becoming production in EFSA in many of our scientific opinions. The second part of my presentation, it was abstract screening. The second part is data extraction. When we have selected which papers to include, we need to extract the data from it. Papers are in narrative form, natural language, so we need to be able to find the data where it is. We are working together with the Environmental Protection Agency on this, with Cochrane, and also now with NIH in the US, National Institute of Health, because this area of data extraction is very expensive and also, we know, very error prone. And we are using name identity recognition techniques to be able to go and find the entities in text, not only simple entities like sex, for example, male and female are the value, but also strain. If you see strain, in this case, it is a complex textual entity. So we are working with this technique. Name identity recognition is, of course, not something we invented. It is a very mature technique. Now you only need to train it in your domain. In our case, we need to train it in the domain of food and feed safety, areas like human health, human studies, animal studies, and very specific areas. So that is where we are working with the Environmental Protection Agency in the US to provide training databases for these algorithms. But as I said before, you need to know which entities you want to extract. And so we are also working to derive an ontology. The problem with ontology is not that there are no ontology out there. There are too many ontologies. You need to define which ontologies are interesting in your domain. So we are working to automate the definition of our ontology from our historical data into this tool called Distill-RSR. We have an history of 18 years of systematic reviews done by our scientific experts. So we believe we have a goldmine of knowledge there. And we are working to extract the data from the silos of this tool and to define which entities in existing ontologies can be applied to our domains. And we are already having very promising results in having this definition, this extraction done automatically. So we believe all the data is already there into our tool. It is our history. We only need to be able to extract it automatically. That is essentially where we are going, where we are working in the area of data extraction. The third part of my presentation today is about the tools and the capacity to interconnect them. Again, the problem of tools for systematic review is not that there are no tools, it's that there are too many tools. This slide again is from Cochrane organization. There are a lot of tools, but none of them is able to cover all the steps. So to have a systematic review automated from beginning to the end, anyway with the human beings sitting on the driver's seat. So there are tools that cover some phases, but none of them is covering all of them. So we are working to define an open file format which is able to interconnect the information from all these tools and to have a super tool, an orchestrator tool, which is able to perform a systematic review from beginning to the end, calling all the other tools that are existing there. Some are open source, some are proprietary and need to be paid. So these are the three areas where we are working on. Abstract screening, we already have a solution. We consider it is there. Data extraction, we plan to have a better solution next year, and we want to interconnect the tools. It will take some time. Now, where we want to go, this was where we are now. Where we want to go in the next years. We want to work on other areas like the appraisal of individual studies that come later. When you have decided which studies you want to include, when you have extracted data, you have to appraise the study using essentially risk of bias techniques. Discussing with Cochrane, we believe this is a mature area and there is room to work there. Again, when I did this presentation to the scientific committee, there was a mixed feeling, which is good, which is positive, which is good. Some of them said it is impossible, you will never be able to do it because it requires too much expertise. Some of them said, we want to work with you on this area because we want to see how it works. And I told them, if you remember already, abstract screening 3 or 5 years ago was considered impossible. Now it is there, it is working. So we want to work on the appraisal of individual studies, and we also want to work on the final stage, which is the presentation of data and results, because there are a lot of AI tools or automation tools there which are very good at presenting data and results. So the scientific expert should not spend so much time there. These are the same concepts in a timeline. So with this year, we close our work on abstract screening. We want to continue until next year on data extraction, and then we will continue. We start this year and continue on critical appraisal, and next year generation of final report. We believe it will take some more time for the encompassing tool phase. We are also working on a new approach together again with the Cochrane organization. For example, if we are able to automatically extract the data from all the included studies, we can switch the phases and do the selection of studies, not only based on title and abstract, but also based on the data that it is there. And the so-called concept of living reviews by Cochrane, we want to scan the horizon of scientific publication, maybe even every day, and understand when there is new evidence that would require a revision of a scientific opinion. Then we are also working on automating the whole phase of evidence management in our risk assessment. Systematic reviews is only one of the 4 pillars of evidence management in the EFSA risk assessment. The other are data collections from real world. The third one is the production of primary study, which is a new phase introduced with the introduction of the new transparency regulation that has gone live a couple of months ago. And the third one is what we call ECE, expert knowledge elicitation. So when we are not able to find data in the literature, when we are not able to find data from data collection, we go and ask the experts, for example, people in the slaughterhouses, so on. We have a new project. We are launching a new project this year. Will go on until 2027, where we want to explore where AI can automate all of these phases, which altogether are the bulk of evidence management in the regulatory process of EFSA, in the scientific risk assessment process of EFSA. This is the new paper, which is called the Speedo. We have prepared a team paper, and we are producing now a roadmap for action. It will be will be ready in October 2021. We are in a very large consultation with other European agencies and international organizations in general, and also with the member states. The roadmap will be able in 2021, and we will start with the investments from 2021 up until 2027. It will be in the order of millions, few millions per year. So that's what we are doing in the area of automation of systematic reviews here at EFSA. We want to expand it to the automation of the whole evidence management. We are very proud of this. This is our contribution from a small regulatory agency, from the small town of Parma to the larger mission that we all have. Thank you.
Thank you very much, Dr. Cavalli, for a very interesting presentation on how artificial intelligence is being used currently within EFSA in terms of generating scientific opinions. Dr. Cavalli, sincere apologies from my side for interrupting your presentation. I had some connection difficulties, so I do apologize for that. But what I would suggest we do is that we move directly to the question and answer session. And if you've got any questions for any of the three speakers, please either put them into the chat function or raise your hand, and then we will look to take them from there. Dr. Cavalli, if I have you on the screen, there's one question that has come into the chat which is directed to you, and the question is how scalable and flexible are the solutions that EFSA are currently looking at, and what would be required to prototype or adapt those and apply those solutions for scientific review in the veterinary medicines area, for example?
Mm-hmm. Yes. This is a large cooperation. I've shown here what we are doing in EFSA and what are the results tangible for EFSA, but we are working very close with the EMEA, European Medicine Agencies. We are working very close with ECDC in Stockholm, European Center for Disease Control in Stockholm, and as you have seen with US Environmental Protection Agency and US NIH. So we want to make these solutions scalable and mostly flexible to be used by everyone. Of course, it depends a lot on how much the processes, the scientific processes are aligned in the different agencies and how much the scientific domains are aligned. Typically, the algorithms and the models work everywhere, but the training data is different from reality to reality. That is the only challenge.
Okay, thank you very much for that, Dr. Cavalli. Another question has come in, and this one is for Professor Cattuto. And the question is, yesterday, Dr. Doria mentioned the challenge of connecting diverse data that is probably more difficult than data volume management. Especially due to secondary use of data. Do you think that efforts in data standardization is sufficient to leverage this challenge? Is there any advanced analytical tools that can help coding and connecting the data to assist with data standardization? So Dr. Cattuto, that is a question directed to you.
Thanks for the question. I think the answer is a mix of both. Our ability to connect or to spot connections between different schemas, different database schemas, and to map one data form into another are improving. At the same time, the luxury of the regulator perspective is that the regulator is the one entity that, because of its neutrality, of its mission, and the centrality in the dialogue with all of the stakeholders, has the full authority to, in a sense, propose a standard and push a standard. So I very much think that that there is space for standardization, and it's really difficult to do this in multi-stakeholder fashion, as we know. Normally, there are incumbents who have the force institutionally or de facto to impose a standard. I think EMA has got the position to propose standards or to engage probably the stakeholders in a dialogue that lets these standards emerge. I would say technical solutions would probably help, but I wouldn't rely on technical solutions where you have people-based and institutional solutions. Probably a combination of both going forward would work.
Okay, and thank you very much for that, Dr. Cattuto. Again, I would ask if anyone has got any question, please put it into the chat function or raise your hand. Dr. Cattuto, one of the points that you made in your presentation is that you feel that the veterinary community is uniquely placed to exploit or explore further, at least, the opportunities that are in big data. Would you care to expand on that comment?
Yeah, the comment was largely based on the experience of and the practice of carrying out similar projects in public health and in human health in particular. And I had the experience, which was at the same time stimulating and troubling, of dealing, for example, during 2020 with the implementation of contact tracing apps for COVID, and that was a great learning experience because it's a process that shed light on the complexity of designing public health interventions that leverage the personal devices of citizens, which are tied, however, to a privately controlled ecosystem. No? And so I think that this complexity, it's something that we have to face and we have to learn to govern. It's made significantly more complex by data protection. And I don't mean to say that as a negative connotation. I mean, GDPR is great, and GDPR is just a starting point, but it increases the complexity of the decision space, and it creates rightfully friction to demonstrating value of data-rich pipelines. So I think that the vet community in this respect can operate with a much reduced burden in terms of data protection and use of sensitive data, and so it's better positioned to deliver on the promises of the uses of data that can be collected more readily, can be persisted more readily, decision-making system that can be implemented and tested with relatively fewer safeguards in a way. So I think it's an environment where the reduced data protection concerns allow more experimentation. And so I'm very much looking forward to what this community can achieve. And we saw some examples already, no? With using data from sensors, from what sort of surveillance and monitoring system in the loop of learning systems to design better policies, to test their effectiveness. In general, I would say there is much more space for comparatively freer experimentation in the vet domain. And if this community could deliver on some of these promises, I think this could inspire also similar projects in human health, where of course, like more complex challenges due to data protection would need to be faced. But yeah, I would say that in a nutshell, that is the opportunity for me.
Okay, no, thank you very much for that additional clarification or explanation. Okay, I have another question that I'd like to put to Dr. Kamphuis, if that is okay. Dr. Kamphuis, you provided 4 sort of very sort of practical applications of how big data can be used and analyzed using AI for different purposes, and all of them are interesting. Of course, the one that I was quite struck by was the facial features experiment or piece of work, basically, and this is sort of going back to the presentation that we had just before lunchtime. In relation to that piece of work, what would you say sort of would be sort of appropriate sort of next steps in terms of sort of validating that as a sort of a scoring system that may be used within the regulatory context? Have you any particular views on that?
Well, if we want to go to use such a tool for regulatory purposes, I think the most important step is now to improve that model and to validate the scoring system itself. That was not the priority of what I just showed you. But if we can improve the model so that it's also collecting more data and labeling the data that can be used for model training, I think it can be used for regulatory purposes, but we have to be very careful when we apply such a tool for regulatory purposes. If I may ask back to you, can you provide me an example of what you mean with regulatory purposes?
Yeah, I guess I'm just sort of reflecting on the discussion that we had, the presentation just before lunchtime, where there was a discussion on looking at other sort of ways to sort of harness data and behavioral data from animals in terms of predicting disease, and how that may be used, in the context of a study designed to test a particular hypothesis around the use of a veterinary medicine, for example.
If you mean that, I think this would be it was. We used data that was collected using a foot and mouth disease vaccination trial, and if we have this system to assess the efficacy of a vaccine, that will allow us to continuously monitor how animals are affected by foot and mouth disease, and we can maybe trace the disease and how it is expressed in the animals better by continuously monitoring such an experiment and such a trial. I think it would be very, very useful. It's just, it provides you a 24/7 method to monitor animals.
Okay, no, thank you for that response. Dr. Kamphuis, I've got a number of people that want to ask you follow-on questions or additional questions. If I go to Dr. Claassen first, and then after Dr. Claassen, I will go to Dr. Carapetta. So Dr. Claassen first, please.
No, thank you very much, David, and thank you, Claudia, for an absolute excellent presentation. I was really looking forward to that one. When you look at regulatory use cases, where I see there is a need for indeed more objective monitoring of an outcome, it would be looking at, for example, measuring pain in animals, which is notably difficult. Possibly also animal welfare. I think diseases that affect locomotion. I can see great opportunities there for employing big data and artificial intelligence in making the results more objective, because now very often we have to rely on very subjective monitoring in different centers, which is hard to define. So have you got some news for us on possible developments in that area? I know that Wageningen is very keen on working on animal welfare. Is there anything that we could learn from you that we could take on for our future processes?
I first of all, let me say that at Wageningen University, we're trying to implement the data science and the IT in practice. There are some other projects that we are working on that could be very beneficial as well. I think we are now also analyzing live stream data of dairy cattle that are housed in groups. And we use that video material to assess how long it takes for a cow to stand up or lie down. And that might be an excellent indicator, and an objective indicator that might be useful for health and welfare. And in another project, which is not maybe directly linked, but it's a very interesting one, we're working on the development of a digital twin. So that's a data architecture that allows real-time data to flow in in this particular situation to predict the nitrogen cycle on a dairy farm. And if you have that data architecture available and have different models that communicate with each other, it will bring the chance to objectively monitor, objectively assess alerts for farmers, or also farm advisors, And I think there's great potential. And it's just a few examples of what we are working on in Wageningen University. I think the focus. Well, I can go on and go on. I just think about, oh gosh, if we can look at the methane data, we can measure that at cow individual level and have the data come in real time. That is an option right now. And if we can combine cow identification real time as well, we're not there yet, but we're in the process. You can objectively measure methane, and you can use that data to phenotype animals on a very large scale and use that in your breeding program. So there's a lot of things that I can think of that can help us further.
Okay, thank you very much for that response, Dr. Kamphuis. That's it is all very interesting. As you say, there are lots of possibilities. Now, I would just like to take a question from Dr. Carapetto. Dr. Carapetto, please. Ricardo, you're muted. I can't hear you.
Thank you. Sorry. Yes, yesterday, it's a question for Dr. Kamphuis. Yesterday, it was mentioned that even if there's a lot of possibilities of using data in the livestock farming sector, it is somehow questionable that the benefits or the obtained by processing so much data justifying all the work that it implies. And as you have a practical experience with the poultry Dutch sector, I just wanted to hear your views on your experience on that. Was that cost effective, that project? I mean, the goals that you achieve worth all the work? Were stakeholders happy? Thank you.
Unfortunately, I do not know the details of that project myself. I wasn't involved in that project. I know that Annemarie Rebel, she is joining this presentation, so maybe she can answer you in the chat box. But otherwise, I would strongly suggest to mail Ingrid de Jong and ask her directly. Yeah, that's what I would advise. I personally have been involved in another study that tried to combine data throughout the broiler chain, and that was unsuccessful, and we had to stop early because there was willingness to share data, but the partners in that project were no data owners. So that was where it stopped. There was no willingness of partners indirectly involved in the project to share enough data, which is that was very sad. I do get your point that to make sensor technology or precision livestock farming a success on a farm, for example, that has to, well, then we have to prove that it has added value, and for farmers particularly, it's economic value, and that's very hard to establish. It's very hard to establish.
Thank you, Dr. Kamphuis, for that. And Dr. Carapetto, that's something maybe that you can pick up directly with Dr. Rebel if you want to follow that. I'm conscious of the time. We've gone about 5 minutes over, and maybe I would suggest that we would stop there for now. I would very much like to thank the three speakers for giving very, very informative presentations in relation to your particular perspectives on big data and how that information can be harnessed for the good, and what are some of the challenges around that. A number of the points that you raised in terms of opportunities, challenges, those are points that will be raised and followed up on in the next session. But for now, I would just like again to thank all three speakers for providing much food for thought. Thank you to those who had various questions to put to them. And as I say, for now, I would suggest that we stop here and then return, I would suggest, in 15 minutes. I'm looking to the Secretariat side now to get confirmation that that's okay. Katerina or Ilaria, what time would you like to reconvene at?
It's okay. The 15-minute proposal is accepted.
For 15 minutes.
Correct.
Okay. Well, then what I would suggest is we return at 3 o'clock, 4 o'clock. Okay, so it's just slightly over 15 minutes. So if we reconvene at 4 p.m.
Thank you.
Okay, thank you, everybody. Enjoy your coffee, and we'll see you all back in this room at 4 p.m. Thank you again. Bye-bye.
Welcome back, everyone. I hope you can see. I'm always struggling with the cameras in this room, so but I hope you can all see me now and hear me now. We're going to start with the closing session of this Veterinary Big Data Stakeholder Forum, which is a session for the way ahead. It will be the last session looking forward, and over the past day, we've heard some really inspiring examples and of what you can do with data, where we're going, some visionary presentations as well. So I think this is a good basis to proceed from. This afternoon, you will see a presentation by myself and Professor Thomas Heber from BVL on a proposal for a European Veterinary Big Data Strategy, because it still needs to be developed. We'll have the roundtable and open audience discussion with stakeholders, because it is a stakeholder meeting, so that's what it's all about. And then Riccardo Carapetto will wrap up and describe the next steps for European Veterinary Big Data Strategy. But before I start on my presentation, I would like to give you a bit of historical context here on how we came to this meeting. Starting basically with the veterinary regulation, when we were working on that, we realized that we were going to collect quite a lot of data and that we needed to do something with that data. And I don't know if Jana Shalansky is connected, but Jana is the one that inspired me and said, Ivo, we do need to have in the veterinary division a data scientist, because otherwise we will not be able to deal with all those data in a structured way, and therefore we won't be able to use the data that we're going to collect in a proper way. And so with that, we started an internal mobility procedure. We hired Ilaria, who came with us with a huge set of skills that she had obtained in data science on the human side, and we asked her to transpose that on the veterinary side. Obviously, also realizing that we had to develop that into something bigger. Now, when you go to the May issue of the Regulatory Rapporteur, you will find there the EMA Veterinary Data Strategy. It has been published. It was an internal document that we prepared for publication in preparation of this stakeholder forum. And we hope that that ultimately can also be the basis for further development of a European veterinary data strategy. We've seen that a lot of hurdles still need to be taken. And I hope that this afternoon in our final session, we can come to a conclusion on that. And with that, I would like to give the floor to myself and start with the presentation. And the presentation is, as we can all see, a proposal for a European Veterinary Big Data Strategy. And so here you have what I just said in a nutshell. It's not a coincidence that we're having this Big Data Stakeholder Forum at this moment in time. We are preparing for the veterinary regulation implementation. So data collection will start, and we'll make a few references to that. And I think the timing now is really good to have this workshop or forum in order to further it develop. And I think when you look at it, the implementation of the veterinary regulation is a catalyst for the EU regulatory network and its stakeholders to develop and embrace a data culture and to join veterinary regulatory requirements with the use of novel data technology. and also for us to be the pioneer of digital transformation across the EU medicines regulatory network. And we know that this is ongoing on the human side, and we saw the presentation of Peter Arlett yesterday, and I think we should transpose that to the veterinary side. But I think there are more opportunities, other opportunities on the veterinary side that we need to capitalize upon. And the vision that we have is to establish a strategy that can help us in the evolution from data collection to data connection. So not only collecting the data, connecting them, analyzing them, and using them for regulatory processes. Next slide, please. And in that sense, the goal of the EU Vet Big Data strategy is to increase the interoperability across regulatory systems that shall be operated by an optimized set of scientific resources to reduce administrative and economic burden and enhance consistency, transparency, and responsiveness. Now, that's very ambitious, and I think it forces us to make very pragmatical choices. So when you look at the pragmatical choices that we are making, that we have to make them both in the topics that we are going to address, but also in the timeline, and be realistic about what we can achieve in the network. And therefore, I think it's good to clearly identify what the objectives are for us. And one of the first objectives is to implement sustainable processes and systems, both in terms of data collection and data quality and how we're going to manage that. And we do see already that that's a big challenge to get good legacy data into the UPD, for example, or a collection of data on antimicrobial sales and use. We all know those challenges, and they will grow by time. I think several presentations that we have seen have shown us that the amount of data is only growing, which has specific requirements on data quality, but also on the analysis system. Then integrating the systems powering the reusability of the data across different domain and processes. So reutilizing data more than once for different types of processes. Basically having single entry of data, but then also collecting unstructured data and linking them to the well-known data. And deliver accurate, ethical and reliable information to promote public and animal health and to support these regulatory processes. Next slide, please. So, Veterinary Big Data strategy aims at defining three things, and I will look at specifically the first and the last one in this presentation. First, the data framework for the implementation of advanced digital solution in key regulatory areas to support regulatory activity and to promote public and animal health in a more sustainable and efficient way. Second one is the strategic direction, focusing on the development of a data culture to address and anticipate data analytic needs and what may arise in the future. And the last one is an implementation strategy approach targeting at realizing regulatory benefits in the short, medium and long-term phase. And I think important to mention here that if you want to turn this into a success, pragmatism will need to prevail. You have to be extremely pragmatic. We have to show ambition, but we can't be overly ambitious, because then I think things will get lost in translation and we will not achieve anything. On the next slide, you see the framework: regulatory business case, data literacy, stakeholders, data landscape, and the sustainable data ecosystem. Now, regulatory business case is placed on top, and that is done for a reason. Because it is all about the business needs. If you cannot identify the business need or the regulatory use cases, you're just collecting data and you're not going to do anything with it. Having said that, it would be too easy to say that if we do not see a regulatory use case for specific data at this moment, that we then should not look at the data and the data sources and look at the data ecosystem and the data landscape, because if we've shown something over the past 2 days is that there is an awful lot of data out there, and that we're not looking into the connection of these data, but there are certainly data sources out there that have the potential to fulfill a role in the regulatory decision-making process. So on the next slide, these are some regulatory areas where you can see already right now at this moment there's real regulatory use cases. Veterinary medicines information management, pharmacovigilance, antimicrobial resistance, environmental risk assessment, possibly determination of withdrawal periods, cascade use, demonstrating efficacy and effectiveness of VMPs, and that will be challenging. New methodology to be developed in that area. Coordination of manufacturing inspections, regulatory submission framework, and innovation of veterinary medicinal products development and innovative use of digital technologies in that area. And I think these, it's not even limited to these examples. Some of them will be developed in the near future. Some of them will be developed in the somewhat longer future, let's say in the next 5 to 7 years. But it's something you have to keep in the back of your head, that these are the regulatory areas that we would like to focus at. And when you look at the next slide, this describes the same as we've seen in the previous slide, but across the product life cycle of veterinary medicinal products, starting with R&D, the authorization processes, and then the post-authorization activities. And I think all these processes are linked together, and the more we can find these connections and link them, the better we understand the data, the more we can actually start doing with this data, and the more regulatory decisions we can take based on these data. So this is just to trigger you in your thinking, things that we already do, where can we possibly replace them using digital solutions or deploying data sets more. In the next slide is about data literacy. And what we've described for our own veterinary data strategy is to establish veterinary data hubs. And we can easily put that into the network in order to create a data mindset, to establish a data culture across the EU network, to connect experts with cross-sectional ambition, like how can we connect quality, safety, immunologicals, environmental risk assessment. The connection, I think we need to look at the new type of expertise, or we need to invest in our current regulators and the industry, and we can only do that jointly, and scientists to really create that digital mindsets, a mindset based on looking at big data. Because if we as regulators are being confronted with big data sets and we don't know what to do with it, then it would be a waste of time and resources, both for the industry and for ourselves. And the third bullet point is to identify and answer research questions and data analysis requests for regulatory purposes. And then if I move to the next slide, the next slide is about stakeholders, which is very appropriate since this is a stakeholder forum. And here you see a list of the stakeholders that we currently see. It's EU regulators, obviously, but also global regulators, and we've seen some good presentations and really value the input into the stakeholder forum from FDA and Health Canada. I think if we want to develop this into really something successful, big data would really also allow us to link globally data, and that could be on safety, but it could also be on efficacy, and really I think that interaction with the global regulators, not limited to FDA and Health Canada, but other global regulators as well, I think is really important as a vision towards the future. Industry, obviously, and we've heard the perspective of industry, and we're going to hear more during the roundtable. Vet practitioners, farm and companion animal health system providers, and we've seen also clear examples of that, and academia. And I think combining these stakeholders into this type of meetings, but also into research projects, could really bring benefits and could open up opportunities that we're not looking at right now. And I think it really needs to be done. It could be under the European regulators network strategy or under the EMA regulatory science strategy. I think it's an area that still has huge opportunities for development, and we should take that opportunity. On the ecosystem, next slide, I think, and it's also clear from all the presentations, we have to develop an ecosystem that will be sustainable in managing increasing data sources. So more sources, but also more data in the individual sources. I think there's a real challenge there because it has implications for data quality, data standardization, or how are you going to deal with unstructured data? How are you going to bring them? But it also brings challenges when it comes to data ownership and how are we going to convince the data owners at this moment that sharing data with the regulatory network or with other stakeholders is bringing benefit to the system as a whole, but also bringing benefit to the stakeholders that donate those data. And I think it has to be established, but I really feel that that is essential for the success of a veterinary data strategy. For the future, encompassing the use of innovative solutions, machine learning, artificial intelligence, natural language processing, and we've seen examples of that and the challenges there. Connecting and retrieving evidences from a complex variety of data to support regulatory decision-making in a reliable, auditable, and for sure also legal way. I think that whenever we move from the current ways of how we deal and how we evaluate veterinary medicinal products more to a way where we look at the data in a different way or combine more big data, that we have to ensure that it's properly validated and that it is supported from the regulation. If we can't do that, I think, again, we're missing a huge opportunity here. On the next slide, the data landscape. First bullet point I think is really important, characterizing new data sources and data nature, per public versus commercially confidential data, define data standards, identify data quality and metadata, develop and improve advanced analytical models, methods, modeling and simulation, define data access and governance. And they've all been mentioned throughout these 2 days. And I think we've seen very good examples during all the presentations. And when we were preparing for this stakeholder forum, it was a steep learning curve for myself and my team as well in discovering that people were sitting on data that we were not aware of. And that very likely one of the first things that we would need to do, and there's a budget for that, and it's something that we'll probably do in the course of 2022, is having a good and structured approach on identifying data sources, data ownership, and how we can work with the different people that own the data. On the next slide, I move on to the implementation strategy, and I would like to be very short on that. I've got a few slides, but I will not go into the detail. What I would like to stress here is that manageability of the implementation strategy and the sustainability of what we implement, that should be first and foremost one of the most important topics. And if you look at the next slide, we look clearly at a short-term phase, a medium-term phase, and a long-term phase. And the short-term phase, you could say easily, is linked to what we need to do to implement the veterinary regulation. And we all know what the deadline is. So I think until the end of 2022, it would be realistic that we have the systems in place, that we have standardized data in place that we can start using. And so that's a very pragmatic way of looking at it. And even though this is a phased approach until 2027, that may be a bit longer, I think it is still a very highly ambitious program if we really want to achieve what we want. So if you look at this slide and short-term phase data collection, it's the focus on collecting underlying data, building the data framework, and identifying new and suitable data sources. Medium-term phase is more about data integration, analytical inception. So building upon what we do in the first phase, integrating data and developing analytic reports and methods in key regulatory areas. And then the long-term phase is data connection and expanding of analytical capabilities. So exploit data connection by means of new technical solutions, new data sources, real-world data in key regulatory areas like farm management systems, data for assessment and evaluation of veterinary medicines, and then hopefully in that way develop not only a sustainable system, but also a robust system that can withstand legal scrutiny and that we can really use for regulatory processes. And in the next slides, and I will not, I had a few backup slides in here, which were looking at these individual phases, and I will not show them for you today because I think that giving the high level view here would be sufficient. And I would like to give over to Thomas Haberer, who will provide us with an HMA vision. And I have to stress here that Thomas, representing BVL, will give the views from the NCA that he is chairing. Thomas, you have the floor. Thank you very much.
Thank you so much, Ivo. And yes, you're right, Ivo. I'm just this is just my personal view, or the view of the BVL on the situation. And I remember, Ivo, when we have been talking about this issue, I guess it was in 2019, the first time, you didn't really have to convince myself that big data is an issue that we have to approach in the future. And of course, there are a lot of discussions going on at the HMA side. And I can't give you right now a harmonized view on the HMA position. But what I can tell you is, and we have been talking about this yesterday, that of course this is an issue that we really take care of. And as I mentioned, we are currently working on the strategy, and one of the theme teams is on big data. And we will, of course, and we have to approach this issue. And of course, I'm pretty much in favor of this. And I was very happy that, Ivo and I, we were talking about this earlier, and we were also planning together to give this presentation, and that we were also introduced into the process of developing the strategy first for the EMA, but also probably as a starting point to go any further, because of course, it can't be the EMA alone to finally fulfill the requirements of this strategy. And to be convinced of the strategy, it's also a matter of convincing the NCAs and the HMA as a whole that the big data strategy is something that we have to follow in the future. Next slide, please. Thank you so much. So, of course, for all the NCAs, it's not only our NCA, the focus is right now on the new vet regulation, EU 2019-6, and the implementation of the new veterinary legislation is a great challenge. The timelines are very tight. Additionally, national regulations have to be adjusted and also need to be implemented simultaneously to the NVR. Of course, every challenge is also a chance to modify, to amend, or even to completely change the working processes. And this is something that is, of course, something we have to do if we're going to implement big data. So the applicability of big data, new technologies, advanced analytics is something that we have to deal with. And as Ivo mentioned, we are now with the implementation of the Union Product Database. We have to implement it on a European scale. We have to define the or to guarantee the interfaces to the national databases. We have a database for the eurovigilance veterinary side, so pharmacovigilance. We have the antimicrobial consumption and data and the resistance development ESVAG we have been talking about, and we have heard a very interesting, I think, excellent talk about ESVAG and what has already been done on this side. And of course, pharmacovigilance and signal detection is something that is right now the only approach for pharmacovigilance in the future that is left. So we have no PSURs any longer in the future. We have no renewal process. So we have to define ourselves on a new basis, and probably it's one way to use big data, not the only way, but one approach that is, of course, leading into a better future to approach this pharmacovigilance signal detection approach. So only a pan-European strategy allows us to coordinate this at a European level, so it's a coordinated approach. And I guess, as Ivo said, this is an excellent time and opportunity to implement big data right now into our regulatory workflows. However, of course, the NVR itself also challenges the NCAs and, of course, our staff members. Due to the many changes to come, there is a certain demand for continuity. If we wish our proposed big data strategy to be successful, we need to recognize and address the concerns and the doubts that are still on the market. So we have to show and to convince at least the key personnel that the use and the integration of big data is both beneficial and without any alternative in the future. Awareness and a joint positive perception are the keys to success. Next slide, please. So it's a joint approach. It's a proposal for European Veterinary Big Data Strategy that's on the market right now. We have on the EMA side the EU Veterinary Big Data team. We have a joint veterinary big data strategy to be implemented, and this has to be driven from both sides, from the EMA side and also from the HMA side, because the NCAs and their experts are needed to bring it into force. Next slide, please. Thank you so much. And it makes sense to do it on both sides. So because we're exploring synergies, and this is something that we compiled from our point of view, which is necessary from both sides. From the EMA, we expect a transparent and clear strategic goals. We expect transparent time frame, including milestones. We expect an open communication. We expect to coordinate, to organize training options for national experts, and to provide digital IT solutions. And what is the HMA, NCA sides are ready to deliver. So as far as our NCA is concerned, of course, I can only tell you that what is needed from our side is to adjust the network to accommodate new tasks related to big data, to support corporations, to provide resources, of course, adjust internal organizational structures, which is necessary right now because we have changes which will be significant. And of course, to further develop IT structure. So our IT structure right now is not capable of dealing with this issue. We have to create jobs, align employment decisions to these jobs and to the new situation. And of course, we have to develop the skills of our experts, which will be different in the future to meet the recommendations and, of course, the necessities that are needed for our future work. Next slide, please. So what are the open questions? Who, how, what? So it's, of course, first of all, and I think it has been mentioned several times within the last 2 days, it's a question of data ownership. It's a question of data access modalities. It's the responsibility of data processing, which is, of course, something to be clarified. Provision of technical and IT solutions is a key. Reimbursement is something that we are, of course, pretty much interested in on the NCA side, because until today, we have no real idea how to finance all that is needed at the NCA sides without getting any reimbursement. Responsibility for training and education is something that's also very necessary, and we have been talking about this lately at our NTC workshop, that this is something that has to be included into the NTC training strategy. Next slide, please. So the pillars of a successful veterinary big data strategy are, first of all, participation. So we have to attract, of course, not only the attention, but also to be ready to participate. And of course, it will be different with the different NCAs. Not every NCA is prepared to participate from the very start. But of course, a few NCAs have to start with this process and to convince the other NCAs to join us finally. So cooperation is, of course, a pillar. Cooperation between the whole network, all on the HMA side and also at the EMA, and of course together. Specialization is something that is needed and necessary for the future. So we will have specialists in the future that we have to educate. And finally, transparency is a key. So only if you deliver transparency, there is a willingness to, of course, participate again. So all these 4 pillars are, of course, something that rely on each other. Next slide, please. Yeah, it's the last slide. Ivo, any questions from your side? Do you want to add something at this point?
No, thank you very much, Thomas. I think that we will enter into the round table discussion after this. I think we could take 1 or 2 questions if there's really urgent questions at this moment in time before we move to the round table and open audience discussions, or we can take them in the round table. And I don't see the chat, but if there's no questions at this moment, I don't see any. Then I guess.
Me neither.
Okay, then I guess that we can move on to the next part of this afternoon's session. And the next part of the afternoon session, it will be a roundtable and open audience discussion. We've got about 45 minutes for that, and since we are on schedule, I would like to suggest to take that full 45 minutes. We've asked the participants in the roundtable discussion to prepare a short presentation with basically 2 questions. What are they expecting as the outcome of a veterinary data strategy? So what would mean success for them? And the other question that we asked the participants is, how committed are you? So what are you going to do in order to deliver on the data strategy? So if you anticipate that there will be an outcome for you, how are you going to get there? And how are you going to work in the network to get there? And for this, we've invited 4 stakeholders. The Association of Veterinary Consultants, Animal Health Europe, FDA CVM, and the Federation of Veterinarians in Europe. You've heard already a bit about the view of the agency and from an NCA. So I think that in combination should give us a good starting point for a roundtable discussion. So my suggestion is that we take the speakers and presenters for the roundtable discussion in the order that they are mentioned in the program. So I would like to give the floor to Klaus Hellman, representing the Association of Veterinary Consultants. Klaus, you have the floor.
Yes, thank you, Ivo. Do you hear me? Yeah. Yes, first of all, thanks for the invitation. We are more than happy to participate as an Association of Veterinary Consultants. We have prepared a few slides. To be honest, we have, of course, heard now during the last 1.5 days a lot of that already. And based on that, I think we can go to the next slide, but even skip that a little bit to you asked and save data here for more discussions. We certainly have some experience, as many of you may know, that I'm at least personally mainly involved in the development of products, which was kind of the first of the 3 topics that were just indicated by Ivo as well as Professor Heberer. On the applications of the big data. So I can see that EMA is mainly coming from their own databases that they are currently obliged to establish more or less by the new regulation. And of course, that is big data. But on the other hand, we have been working in clinical development certainly for a long time with certain kind of big data, although we probably called it differently. So we have seen that we have not a very good structures database. But many different sources, and the problem is to have reliable data and to be able to combine that. I think that's and to be able to trust it. So the legal current system in general makes it very difficult to approach these data, and that has been mentioned quite a couple of times. Under GXP, we have, of course, the obligation to have really true data, correct data. And that is often difficult in these larger databases, although we sometimes work, of course, even in individual studies with really large databases. Next slide, please. So for the expectations, I think there are a lot of fundamentals that have been mentioned before. Ownership of data needs to be clarified. How can we access them? How can that data be transparent to certain stakeholders? We have a current lack of standards, it was mentioned as well. We need use of data limited to certain valid and scientific rationales. We even have in the legislation only opening to certain experts of pharmacovigilance data, which I at least see a little bit critical. Consider the legitimate interests on data protection and proprietary information. on the one hand, but then on the other hand, of course, that we want to work with that data. So in that way, we have been working a lot with obtaining consent to use that data, but at the same time assuring security and anonymization of that data. And then the question is how that will be accepted by competent authorities, and where is the threshold where we have individualized data that or individual data on a small data set where we can fully trust in it, in comparison to data that may not be as of good quality as we would normally expect. So expectation, there are lots of expectation because we can use such approach in a trustful way. That is my point here. Next slide, please. You asked for the next question is on the committed of our organization, certainly as Association of Veterinary Consultants. We are probably, as I already mentioned, committed to use data. Yes, we will be more than happy to comment on the appropriate way to do that, use tools or participate in the development of new models to justify the use of big data where accessible and where that may make sense, but also to basically address the potential benefit risks of using that data, which I find still very challenging. So in general, our contribution will certainly be based on our know-how and interest to promote the availability of animal health products. And we welcome in this sense the initiative of European Medicines Agency as well as the heads of medicines agencies. But there, we consider there is still quite a way to go, as it was displayed by previous speakers as well. With that, I pass it back. Thank you.
Thank you very much, Klaus, for that. And I would like to now move on to Animal Health Europe and give Rick Clayton the floor to present their views.
Thank you very much, Chair. Now, one of the advantages of being in the last session is that I can already express my thanks and appreciation for an excellent event so far, anyway. I think it's been fantastic. Now, the title of this session is The Way Ahead, which is interesting because really we are right at the beginning of the journey. So the way ahead is going to be very much setting out the objectives. You can move on to the next slide, by the way. Very much setting about the objectives and laying down the principles and conventions. We've heard a great deal about the opportunities, and it's been a very inspiring day and a half. And I've certainly learned a lot, such as random forests was something new to me. But I haven't heard very much about focus and focusing on the objectives and focusing on the regulatory area, except perhaps from Ivo and Thomas in their outline veterinary data strategy, where I really do think they've got the right approach to have the phased approach and focus very much on implementing the new regulation first and taking things in a stepwise approach. So that's why I've started my intervention here with the word objectives. Before we know where we're going, before we can plan the journey, we have to know what the destination is. What is it we're trying to achieve? What's the purpose? And I think this message was delivered very clearly, beautifully by Fernanda Doria yesterday, and it was re-emphasized by Jos today. We don't want to do things just because we can, and we have to have a purpose. So yes, please, let's focus on the regulatory use cases. Then we can look at the what infrastructure we need to achieve those and what the operating framework should be. And the operating framework is very important. We need to start with the definition of rules, guides, principles, conventions. And we can be getting on with this now, and we can learn also from what's happening on the human health side. Even obvious rules need to be put down. You may think a rule is obvious until you try and operate in the real world, and then you find some people don't recognize it, an obvious rule. For example, in the chat today to the panelists, we have been bombarded by adverts. You may think it an obvious rule that in an EMA webinar, you don't put adverts in the chat, but it can happen. I wanted to just mention the link of the regulation of diagnostics. We don't have an EU regulatory framework for veterinary diagnostics at the moment, but there's obviously a very strong link between big data and diagnostics, so we need to bear that in mind. And I also wanted to mention the international context, but I think that has been well addressed already within this forum, so I won't say any more about the importance of that. So if we go on to the next slide, it's very clear that the animal health industry will want to engage in this discussion. As Klaus said, and I think many speakers have said, digitalization is happening. It's inevitable. It's essential we engage in that. And in fact, many Animal Health Europe companies are already well down this road and moving into the sort of digitalization space for animal health, as you would have heard from the Animal Health Europe speakers over the last day and a half. The Animal Health Europe policy and strategies is at a very early stage. We have done a framework discussion document, a sort of orientation document to start with, to prepare for this event. But we have not drilled down into any policy discussions on all the various subtopics within. So there's still a lot of work to be done. So this stakeholder forum is very timely and very welcome. And we hope to move forward together in defining what we do for the veterinary sector. The other thing I'd say is that there does need to be a win-win outcome, hopefully to deliver more without adding more burden. There is a tendency in regulatory areas that we just add more on top of each other. Now, I believe with digitalization, there really is an opportunity to trim down and focus and be more efficient. So I hope that is what we can achieve. And the next bullet is very closely related to that. We need to improve things, bring more efficiency, etc. And you'll see I also put in there, improve our working lives. I think that is often overlooked. There are plenty of ways we can improve things, but also by removing unnecessary work, duplication. The reuse of data is perhaps a good example there. We need to support the decision-making process across the whole product life cycle. That should be the focus now, I hope, of the discussion this afternoon. Peter Arlett made it clear that he saw regulatory use cases in every step of the product life cycle. So that's where we need to focus for now. And then whatever we produce, it needs to be fit for the future, fit for purpose, and fit for the animal health sector. I'm sorry if I've overused that phrase a bit, but there needs to be the right cost-benefit outcome for our sector. So if we go on to the next slide. I expect it will take a little moment to just move on. on this slide, I want to close with just a quick look at what we would see as our policy priorities. And I think I can be quite quick on this slide, Chair, because a lot of it has already been mentioned. This is from our own brainstorming, and if we look across to what's happening in the human health discussions, it's a lot of the same points, such as data quality, confidentiality, ethical governance, etc., etc. So maybe I'll just focus on a couple of things that are important to the animal health sector. The first thing is assessing what's coming out of the HMA-EMA Big Data Steering Group and their work plan. Yes, we do need to look at that and see what it can give us. And yes, we will participate in all the workshops that have been organised by Peter Arlett and his crew. But we need to be very careful that we adapt anything coming out of there to the animal health sector. So, if I try and provide an image, we don't want a direct line of connection, because then we might feel we get pulled along. I would rather there was more of a sharing of information, so we can take the information and evaluate it for our own purposes. Some things will be the same, some things will be different, but the key is it has to be adapted to our very specific sector. We need to keep the discussions separate, I think. We need to be able to learn from the human health sector, take their learnings of their successes, what worked and what didn't work, and have an independent discussion of how we apply it, and not have things automatically transferred to us. This is a very fine line that we walk. Our sector is small, doesn't have the same resources as the human health sector, so we do need to profit from learnings from them. So we want that connection and that exchange of information, but at the same time, we really have to make sure we have our own discussions and put in our own solutions. Under the challenges to address there, I'm not really going to go through any of those because I think they have all been touched upon quite well. Maybe I'll just pick out a couple. Acceptance of evidence, halfway down the list. If we're talking about using outputs from big data analysis for regulatory purposes, then there's no point in doing that unless there is some acceptance of the evidence in the regulatory processes. And then the last one I'll pick out, Chair, is right at the bottom. And I think Thomas mentioned this as well, and that is the funding. We're not a high value sector. We don't have unlimited resources, so we always look very closely at how things are going to be funded, and we need to look very closely at exactly what is needed for our sector and do that, but do no more, because it's pretty likely we won't be able to afford it. So with that, I'll close and thank you for giving me the time, Chair.
Thank you very much, Rick, and for giving a clear presentation and clearly stating also the specificities of the animal health sector versus the human health sector, and we are aware of the limitations that we have here. So we can have a discussion on that afterwards. Next speaker will be from FDA Center for Veterinary Medicines, and I would like to give the floor to Hesha Dugirala. Please, You have the floor.
Thank you so much. Thank you for having me. I appreciate it. This has been a fascinating day and a half. Really appreciated listening to these speakers. So I was tasked with 2 questions from the FDA perspective. The first being, what are our main expectations from a big data strategy? So the 2 main objectives, and this is in addition to the excellent presentation that my colleague, Dr. Errol Strain, gave yesterday, was to use our existing data to its full capacity. We sit on a ginormous repository of pharmacovigilance data at CVM. We have data that we leverage from our human health centers through the GSRS system, which has information on applications that have come in for human drug devices and our veterinary products as well. We also think it's really important to leverage existing data sources that we may have not had an opportunity to touch on in the past. So CVM does have a memorandum of understanding with Banfield Pet Hospitals. So here in the US, Banfield has almost 1,000 hospitals now across over 42 states. They get over 8 million pet visits a year. Their medical records are completely digitized. So this is a tremendous source of information in terms of pet health. And so we are starting off in our collaboration with them to use it as a way to validate our signal detection methodologies that we use within CVM for our pharmacovigilance data. So if we see a signal within our adverse event database, we can ask Banfield and their veterinary epidemiologists to look at their data to see if there would be a similar trend. And they've been wonderful to work with. They have a very strong sense of a mission towards animal health, and they have access to certain data that simply we don't get. And so like in terms of unapproved products or products that may be intended for human use, but animals may be exposed to. And so there are other private entities like that we are in discussions with on how we may be able to leverage their data to learn more about what happens with certain FDA regulated and unapproved products and animals being exposed to. And I think this is a really exciting way for us to leverage data. The Banfield data is about as big as it gets, and and what do we provide to Banfield is our expertise and our epidemiologists and data scientists within FDA, and to share with them the best practices that we've learned by managing our adverse event systems and the other data sets that we have at FDA. Next slide. So the next question I was asked to comment on was how committed we are to the development and implementation of big data strategy. Well, we're fully committed, and this is something that we've been at the forefront of as a regulatory agency for decades now. The original Bayesian statistics that were used in data mining were developed at FDA by Dr. Anna Schwartzman and colleagues in the Office of Human Drugs back in the 90s. We're constantly looking for ways to improve our data quality that's received into the center. We're working with regulated industry on review of big data pre-market, and Dr. Strain talked about this in terms of genomics specifically yesterday. We're very interested in advancing methods used for big data analytics. I'm the chair of the FDA Data Science Council, so these are data scientists from throughout the agency, human centers included, and we've generally found that CVM is about 5 years behind in terms of our implementation of big data tools and strategies, and we learn a lot from our sister centers in terms of what our best practices. And but like it's been mentioned, like Dr. Clinton mentioned, it's really a question of how do we keep in mind that the complexity of veterinary data is so different from human data. We can't just take one tool and apply it to our data, but we do learn a lot in terms of what is out there that we could potentially try on our data. We're also collaborating with stakeholders on best practices in using veterinary data. So myself and colleagues are on the VICH signal detection discussion paper group. And so we hope to have a draft paper done by the fall that talks specifically about veterinary signal detection, best practices, tools that are used. And we hope that this really propels the conversation forward in terms of where we should be going in terms of veterinary signal detection. And finally, forging partnerships with other stakeholders. And so this is where I talk about Banfield and some other entities that we're in discussions with. There are a lot of other sources of big data out there, and how can we best leverage them when we have limited resources in terms of the type of information that comes into our regulatory industry. Thank you.
Thank you very much for that view. I'm sure there will be questions on that presentation as well, because I think there's a lot to be learned also for European regulatory network on how things are approached elsewhere. So and we'll open the discussion after we've heard the presentation of the next speaker. And the next speaker is Jens van Dobbenburg, representing here Federation of Veterinarians in Europe, so the healthcare professionals. Jens, please, you've got the floor.
Dear colleagues, good afternoon. Next slide, please. For FVE, the Federation of Veterinarians of Europe, representing over 300,000 vets in 39 countries, working in all disciplines, it's clear that fast developing digital technology will enable us to collect incredible amounts of data connected to veterinary medicine and animal health. Nancy de Brienne of FVE yesterday already stated embracing new digital technologies is an important component of FVE strategy. The activities of veterinarians across various disciplines can be part of generating these big data, as well as using results after these data have been processed. Opportunities seem endless, as has been outlined by various speakers during this seminar today and yesterday. Next slide, please. As a profession, over the last decade, we have gained a little bit of experience with big data. Of course, systems yesterday were less sophisticated than they are today, but the same is true if we compare today to tomorrow. In our view, some general principles apply, considering big data in our working field. An essential point is privacy of people from whom data will be extracted will be protected. Sounds obvious in a region where we just have implemented GDPR for exactly these purposes. Sometimes, however, this will not be enough. Looking, for example, to the process in some countries establishing data collection systems on antimicrobial consumption in animals, we learned that quite some people feel unsafe dealing with this collection. Although 1984 is past since decades, George Orwell is always near. For this reason, it's important to carefully consider if the extraction of data is based on private requirements, for example in the food chain, or has a legislative basis. The word compulsory has a different understanding in these two different situations. Another one, who has access to this data, has been discussed at length during these days. How do we avoid data to be locked up in silos without any interconnection? We should avoid further that animal owners become locked with a provider or one provider without the possibility to transfer the data. Linked to that, there's the old question, who exactly owns the data, already discussed. Especially in the space of private commerce, this is a significant question. Is it the one who finances that determines conditions like having access to data? Or do we know something like a right you can't take away, as is the case with our personal medical dossiers? And dear colleagues, last but not least, veterinarians are struggling with the discussion on the status of the outcome of processed big data in a special situation. I will explain. Time is near, animals will carry wearable devices, generating veterinary medical data. It's already today. When these data will be combined with artificial intelligence based on big data, this can result in a digital diagnosis. And today, there's no country, I repeat, no country, where it is allowed to diagnose, to prescribe, and to treat without examining the animal or animals physically. What will happen if tomorrow the digital diagnosis becomes maybe more accurate than my veterinary brain and my stethoscope? Can the quality of the data be that good we can depend on? Next slide. All important points to address, but for sure possible and worthwhile to solve. FVE strives to enhance animal health, animal welfare, public health, and protect the environment by promoting the veterinary profession. Together with its members, FVE aims to support veterinarians in their daily practice. One of the priorities for the next 5 years is to embrace technology, including the opportunities and challenges of big data. Thank you.
Thank you very much, Rens, for that. And I think what I would like to do is I would like to start the roundtable discussion. Unfortunately, I have to say my computer broke off midway, so I missed part of the questions in the chat. I see that Thomas has replied in the chat to a question, but I don't know what the question is because I can't see it. So maybe Thomas, can I give you the floor first and highlight your answer in relation to the question that was asked?
Yes, Ivo, of course I can do so. So the question was from Claudia Kamphuis about, perhaps I get the wrong impression here, but it comes across like the goal is to collect and to combine data at a central place. And yes, you will have to deal with governance and data ownership, but have you considered, oh, now it's skipping. But have you considered also other approaches like federated learning, where data stay at the data owner and the model is brought to the data and comes back with just information? So it's probably a question to you, Ivo, or? So I also give a small reply, but probably you start first.
It's a valid question, and I think we can't answer it because we're yet at the start. I don't foresee that we will have all data centralized. I cannot imagine that we can fully leverage data if we have those data centralized place, because that would really be a transfer of ownership. So it's something that we need to investigate. It will depend highly on the type of data. Some data will be centralized by definition because it is mandatory to collect those data or to have product data, substance data, other data, organizational data in the European databases. Other data, I think the data that we're looking at also for the future that can really accelerate the use of data, we don't own. So it will be the challenge there to identify where these data are sitting, how we can free up those data, and how we can structure them in such a way that we can make them usable for purposes. And Ilaria, I see you want to comment on that as well.
Yes, I think it's a very good point. And as you mentioned, Ivo, I think it's also part of the establishment of the ecosystem together with the data governance aspect. I think it was a point that was raised yesterday by the industry colleagues is in fact having also access to the data in various forms. And it was raised one of the opportunity, or at least one of the proposal, was to in fact expand the current health data space to cater also for animal data related, which is currently a bit left aside. So this is something that I think it could be taken into account as a follow-up initiative to look into it. And of course, as part of the development of the big data strategy at the European level, we need to understand which are the data model for accessing the data. And also together today, also Professor Cattuto was, for instance, citing the business to government model. So I think we need to sit together and see what are the data sources, where the data sits, where the data can sit, and then establish a data governance all around it is part of the discussion that we need to progress with the network.
Okay, thank you for that, Ilaria. Before I start taking some of the questions that are in the chat, let me try to briefly also look at the outcome of this, the presentations of the roundtable. What we've heard is presentations from the veterinary consultants, which are largely in research and development phase, supporting companies, but also during authorization process and after that. Animal Health Europe, representing the big pharma largely, another regulator, and then the veterinarians. And we've heard different views, different angles, I think, to what their expectations are and how they can contribute. And it has triggered for me at least some questions on how we can develop this in a reasonable way, because I do understand the concerns that exist with the different parties. And let me then start by asking a question first to the colleagues from FDA CVM, because for me it would make sense, and we know that global harmonization is always a challenge in regulatory processes. But for me, it would make sense that we would seek a collaboration on how we can not use data from both sides, but how we can approach the use of data for regulatory processes. So maybe I can ask FDA to comment on that briefly. And then also I would be interested in learning more about the actual collaboration that you have established and how you see the forging of partnerships, because I do feel that partnerships are really pivotal to the success of developing big data strategy. So if I can ask you to comment on that briefly.
Sure, thank you. So to your first point, we are open to any and all discussions on how we can advance data science in terms of veterinary health. We are active participants in the VICH working groups, the steering committee, as well as the discussion paper on signal detection. I think that right now is the predominant forum by which we're collaborating in terms of best practices. But if there are other ways that we should also be having those discussions, we're delighted to be involved in those discussions. We're just looking for innovative ideas on how to advance the science. And if there are better ways for us to do that, then we'd be happy to be involved. In terms of the partnerships, these are what we call MOUs, Memorandums of Understanding, and they're posted. The Banfield one specifically is posted on the FDA website. They're in an effort to be transparent. All MOUs that FDA signs are available publicly. There is no exchange of funds. We are a small center and simply don't have the ability to purchase data. So what we offer to our partners is our expertise in terms of how to use big veterinary data, our experience in terms of using big data analytical tools on our own veterinary data, and then providing consultation to these entities in terms of what they could do with their data. So there's a specific private entity that we're in discussions with right now, who were originally thinking of hiring a veterinary epidemiologist to bring on to help them with their big data. But we said, well, before you do that, maybe we can help you with kind of talking you through what you may be able to do with your data with what you already have in-house. In exchange for that, we can query the data when we have some sort of regulatory question. We knew that it was absolutely off the table to begin with, that we would not have direct access to this data, so that was never a part of the discussion. It is really a question of we pose a question to the stakeholder that has the data, and then they mine their big data database to see if they can answer the questions that we pose to them. So it's a question of finding an organization that has, a source of big data that can be used for some sort of regulatory purpose. It makes sense not for regulatory decision-making per se, but for validating data that we may already be evaluating in-house at FDA. And then really, speaking to their altruism and their desire to advance veterinary public health. And so that is kind of the key to the collaboration. So what they're getting is this idea that they're advancing science, they're advancing public health, and they're also getting expertise that they may not have in-house that we at FDA have in terms of how to deal with veterinary big data. And then we're getting access to data in order to validate the data that we already have, so we can make more sound and more confident decisions in terms of our regulatory action.
Okay, thank you very much for that clarification. I see in the chat there is a question from Klaus Hellman. Klaus wants to know whether do competent authorities foresee to further harmonize access to data in the EU? Does NCAs contributing? And would this require a legal mandate as we had to wait for the UPD? Maybe Klaus, you would like to clarify your question a bit first before I decide who I'm going to ask to answer it. And Thomas has his hand raised. So Thomas, maybe you want to answer the question before Klaus starts to speak.
No, please start first, Klaus, because I guess we are on the right now, and I also have some problems to understand what you really mean with this, because of course we harmonize, but anyways, probably meant something else.
Well, obviously we have, thank you, Ivo and Thomas, for giving me the floor again. Well, what I think is obviously there is a lot of data in the public, well, not in the public, in the domain of the competent authorities. And the first question, or probably the easiest one, would be that these data would be made, would be used. And we currently have obviously a lot of national databases, and not all that data is shared between the different national on a European level, if we just talk about Europe. So I'm wondering, well, we all know that we had, well, probably we were fond of having a European product database, although we now see the challenges to get it. That's another question, but obviously that was more than necessary, but it took 20 years after establishing of the European Medicines Agency to get it. So are there any plans on that one to look first in your own area where you could benefit of that? And would that need a legal, well, basically legal mandate? Yes.
Thomas, do you want to go first?
Difficult question. I guess we are talking about different levels. So if we're just talking about the national level, it's also complicated. Even in Germany, as you know, Klaus, that we have the federal states who are in charge, of course. Also, if we have some measures to be controlled, the control is with the federal states. Well, we're collecting data, and we always have this question, who is the owner of the data? What kind of responsibility is with which agency on a federal level, on a national level? And of course, what kind of data can be finally distributed and shown? So we always have, of course, I'm just thinking about the sales data, so they have to be aggregated to a certain degree, because they should not be traced down to an individual company or an individual veterinarian, for instance. So this is something that we have to deal with, and as Ivo said, we are just at the beginning. And if we're talking about the big data, we're talking about different areas that are used where big data can be used. We're talking about antimicrobial resistance, and I was pretty happy about listening, of course, to Hesher about potential cooperation. So we would be really looking forward, especially in the area of antimicrobial resistance, to have, of course, a global approach, which is necessary. And we have some obligations especially with sales data and also with consumption data in the future. So this is really defined. With pharmacovigilance, it's a little bit different. So as you said, Klaus, we have public data available, but we also have other data which are owned by somebody, and it has to be clarified who is going to be in charge, who is the owner of the data, how can these data be used in the future. This is pretty much unclear. And if we're talking about probably introducing big data into even other areas for the authorization of products, it will be more difficult. So first of all, we have to set our goals, of course. What do we want to reach? What kind of data do we have? Who is the owner of these data? And of course, a harmonized approach is pretty much welcome, because it would not be very beneficial if every NCA is developing its own strategy. So this was also the reason why I'm pretty much in favor, of course, of this approach of a joint EMA-HMA strategy on big data, because we shouldn't do everything on our own. And of course, we should not be divergent, of course, with our databases in the future.
No, thank you very much for that, Thomas, and giving that perspective. From my side, I think that what we are seeing now under the new regulation is in fact unprecedented. It becomes mandatory for to establish a union product database. So one database that will have all authorized products in the union and a few more than just the authorized products. So, and that will have a public component to it as well, which will be accessible by everyone in the public, where we are looking at developing functionality that will be also very useful for healthcare professionals. We will have mandatory collection of sales data of antimicrobials and in the future use data, again, also with the aim to make it publicly available, the analysis of that, to do the analysis, to look at how can we use those sales and use data of antimicrobials in a very granular way to help in reduce the risk of the use of antimicrobials in animals for animal and for public health. I think that's also, again, unprecedented. Before it was voluntarily. And this, we want to connect probably other third countries to that system as well, because we do believe that it doesn't stop at our borders. Manufacturers and wholesale distributors database will be upgraded. And I think the pharmacovigilance database with the move from PSURs to signal management, but also again with a public component where all signal management for all products again in the union would need to be dealt with. So we are, in that sense, moving away from national databases, even though I realize that some member states will still maintain their national databases and the national pharmacovigilance systems. I think what you see in the regulation is that clearly it needs to go to centralized way. And that's the biggest step that we can make at this moment in terms of providing a legal basis for that. We are defining in legal acts also the data standards for pharmacovigilance reporting and for antimicrobial sales and use reporting, and building the systems accordingly and trying to link the systems as much as we can. If we go one step further and say there's more data, realizing that there's more data out there and that we have to work on how to start utilizing those data, there's still a lot to be done, because there and NCAs may have their own national databases. We do know that we are obliged to collect the sales data of all veterinary medicinal products in the UPD, and there will be a reporting by the marketing authorization holders. But these marketing authorization holders still have to report also to some member states that would require those data for their own purposes, and that would lead to double reporting. And that certainly is something that we could work on and try to avoid that in the future in order to reduce the regulatory burden. So it's still a long way to go. I see there are no further questions in the chat anymore. And in the interest of time, I would like to close this part of the afternoon session and move on to the last presentation of the stakeholder forum. And that is by Ricardo Carapeta from the Spanish agency, and it's on the European Veterinary Big Data Strategy Next Steps. Ricardo, you have the floor.
Yeah, thank you very much, Ivo, and good afternoon, everybody. I try to be as fast as possible because it's already late, and it's been a long and very interesting day. What I'm going to talk about is just for information. We are a small group of 5 people working on the drafting, which could be, or thinking which could be this European Veterinary Big Data Strategy. And what I'm going to present here are which we have identified as the key next steps that we have follow. I just want to warn you before I start that it's a process that it's a project that it's in its inception phase. So what you will see is just a few steps that are very necessary, but very preliminary also. As anything that you start from scratch. And next slide, please. So the first thing we have to do is is related to the EU veterinary medicines regulatory network. There is already a big data steering group that affects mainly to humans, but also, as Peter Arlert mentioned yesterday, has got a veterinary appendix, and there is some representation in that big data steering group from the veterinarians. There's somebody from the CVMP going there, somebody is me, and somebody also from an NCA, that is Dr. Bertolat, that moderated this morning from Germany. But there's also staff from EMA, from the veterinary division. You already know Ilaria Del Sepia and Mark Goldhammer. So the four of us, together with the fifth one, Celine Simonet, also from the VVL in Germany, got together and started working on this issue. Nevertheless, even if the big data steering group has got this veterinary appendix, we felt that we need the involvement of the whole network, because this regulatory network is a wider structure that also provides expertise, because it involves all the NCAs across the European Union, and they have a wide expertise in the authorization of VMPs. It also has the resources, because the assessors are basically coming from the different competent authorities. But it also, and that's important, have the representability of the different European sensitivities, but also the different farming systems across the European Union somehow could be understood by the national competent authorities. And it's also the proper forum to give an incentive to stakeholder collaboration and the development of any kind of strategy. So what we agreed is that we need to have a governance structure for veterinary domain, and that it needs to be defined. So the next step, next slide, please. Yeah, thank you. The next step will be to liaise with HMA. HMA, as Thomas just presented, is the heads of medicine agency. So it's a network that involves all the national competent authorities and also works together with the Commission and with EMA. So it's important to bring HMA on board to this project, because we can take advantage of all the features that they presented in the previous slide, but also to inform the national competent authorities that the adjustments that they might need to make in the network to integrate big data, so they are aware of our intentions. Also, it might help them to define future employees' profiles, because currently the most demanded employees profiles in any NCA are more related to clinical part and toxicology maybe, and but maybe we have to rethink about future needs. Also, we can get the IT infrastructure, and we intend to have an agreement on a proposal of a EU veterinary big data strategy by the end of 2021. So the first step for us will be to liaise with the HMA to get all these things. Next slide, please. The next point we wanted to work on is about data literacy. The Big Data Steering Group launched a survey in 2021 across the network. It involved human assessors and also veterinary assessors, just to check which was the level of knowledge and expertise in big data and related technologies. We had 250 responses from the vet domain, and it wasn't a surprise to see that the knowledge was not very deep, and there's a lot to be done in there. And as Ivo mentioned in his presentation, it's necessary that we embrace it as a culture. And when I say we, I mean all the assessors and competent authorities. So it is important to bring the level of expertise up. The good thing of this survey, that those launches, sorry, somebody's calling me. I'm sorry. The good thing of that survey that was launched is that it also was designed in a way that we could have more information in specific fields where we should focus for increasing the knowledge of the network. Next please. Next slide, please. So the next step would be the improvement of the data skills in general. So what we intend to do is to define a training curriculum, taking the information that was provided by this survey that I mentioned, where we already know which are the fields that need more improvement and that are of higher interest for the assessors. We also wanted to liaise with the UNTC. The UNTC is the European platform for training that is used by managed by EMA. And we'd like to use the UNTC as a platform for these trainings, because this will be the way of reaching to all the national competent authorities, which we think it would be very important. And it's also something for discussion, but I think that after this forum, it's something that unavoidable and that we really need to do is to have thematic workshops with NCAs and stakeholders to bring together all the different views and needs. So we are able to define something that is fit for a purpose, for a specific purpose, as was mentioned before. Next slide, please. Yeah, and the last step that we have to give is about data strategy. It has already been said that we are very busy with implementation of the new veterinary regulation that starts to be applied in January 2022. But as part of that regulation is the new databases like the Untitled database or the pharmacovigilance database. And there are time constraints for that, but we should keep an eye on the trying to design it or to make it in a way that we are able to extract more functionalities in the future if it's necessary. But well, we are aware that all the national competent authorities, Commission and EMA is very busy at the moment with the implementation of the new veterinary regulation, but it's something to keep in our minds, all these things. We also wanted to establish a vet hub that is the way, the name that we gave to a technical group for making some progresses on those things that I have written down there. We want to draw a data landscape and to identify which are the current data sources that we have, but also future more innovative data sources that we can think about. We have to progress on data standardization and on the use of metadata and on the definition of business cases. And I think that was my last slide. Next one. Yeah, thank you very much for your attention. I have another one, another slide. If you can go to the next one, please. Yeah, thank you very much. That's only because I'm from a small city in the southwest of Spain, and I always spend 1 second to recommend everybody to go there. It's a World Heritage City, and you will love it if you ever have the opportunity of going there. Never go there in summer because you will melt down, but in any other season it will be great. So thank you very much for your attention, and I will wait you in Cáceres. Thank you.
Thank you very much, Ricardo. And I can tell you that I already visited Cáceres, so and I can recommend it to everyone. But then Rick reminded us that we're not supposed to make any commercial for anything during this meeting. It's inappropriate in that sense, Ricardo. No, thank you very much. And in the interest of time, and I see participants already leaving the meeting for possibly other business meetings that they have. I would like to wrap up at the end a bit. I would like to start first by thanking all of you for staying with us for such a long time, and specifically the speakers that we've heard over the past 2 days. And they've given us, I think, a very good starting point to have further discussions on how we can develop a data strategy, a veterinary data strategy. The speakers have addressed a variety of topics, ranging from regulatory use cases to also, and I'm very thankful to the speakers that do not come from a veterinary regulatory background, giving us their time and their insights in how data can be used elsewhere and showing the possibilities that big data analysis really brings. I think it's really food for thought from all sides. And in addition, for those regulatory use cases that we have on the veterinary sides, that are really there, antimicrobials, pharmacovigilance, environmental risk assessment. I think, again, this meeting was a good starting point. And I think all we need to do now is really make it happen in the future. So I'm very thankful for the support of the NCAs involved. And I look forward in working on the development of the European Veterinary Data Strategy together with the coalition of the willing, I would say, the NCAs that are willing to step in and work with us. And we will not forget the stakeholders in this respect. And we've listened to the stakeholders, their concerns, but also their willingness to invest into the future systems. I think what I remembered from what Ren said, technical developments go at such a fast pace that what we now feel will really require huge investments, and where we don't see the real return on benefit in 10 years from now, it will be a common good. So we have to prepare for that future, I would say, and we have to prepare for it starting now, starting today. And that was the whole intention of this meeting. Set the mindset and create a level playing field for all of us to start those discussions. So this, I suspect, will be a recurring meeting in addition to the info days that we are organizing. In that, I hope that a year from now we can have another meeting on the same topic, and we can actually show where we have made progress and provide you with a more focused meeting on, indeed, veterinary big data. Now, a meeting like this, and I mentioned that I've really enjoyed the preparation of this meeting because of all the meetings that we had with the speakers and trying to think, okay, what will be reflecting with the audience? How can we make it as attractive as possible? But to make a meeting like this happen, you need a big support team. And the support team that I had was very talented indeed, and they have made it happen in the preparation of the program, but also over the past days, whenever there were technical difficulties, making sure that the presentations were on screen, making sure that we had all the access to the chat. And I think I'd like to thank them for that. I have to mention here Katarina and Sylvia. Katarina has been really, really helpful in organizing all the speakers, all the meetings, managing the calendars. Ilaria, obviously, for being guiding here and continuously coming up with new ideas and being enthusiastic about the new speakers that she always found. Mark Goldhammer has been very helpful. I mentioned Jana already for sparking the ideas that we had to do this big data, and Irene Zanetti, who's been very helpful in and on the communication of this together with the team and stakeholders. And so a big applause for all of them. And with that, I would like to close this meeting. And thank you very much all for your attention. I hope you've enjoyed it. I look forward to having this meeting physically, possibly as a hybrid meeting with people virtually connecting next year. Have a good day to all of you. Thank you very much.